Hi, Olivia. Are we ready to start?
I am, but okay. So the thing is, since my laptop is restarting, I'm trying to
Hold on. Sorry, we are live streaming right now. So maybe in 5 minutes we'll start, right?
Okay, yeah, 5 minutes works.
Yeah. My laptop is not charging. Why? Not charging? मैंने क्या कहा?
Hi, Nidhi, I'm there. I think I'm audible.
Yes, you are very much. Hi, Dr. Kanika. And I think we're ready to start. Olivia, do you want to start? Are you ready to start?
Yeah, I am. And should we wait in for more speaker, like some people to join in, or should we go ahead?
So we're live streaming already, and people
Okay.
are there on our auditorium waiting for us to start. We'll take a quick 2 minutes and we'll dive into the session. So,
Okay.
everybody who is listening to us, very warm welcome, and we're going to start another 2 minutes. Till then, you can have a look at our lobby and look at our sponsor lounge. You can look at our community partners, have a look around, and if you have any questions, you can always reach out to our help desk, and we'll catch you in another 2 minutes. Olivia, are we ready to start?
I'm ready when you
Yeah,
are.
I think so.
Okay, great. Let's dive in.
Uh,
Uh, Wait, give me a second. Am I visible? I hope I am.
Yes, you are.
hi,
Hi,
Olivia.
I'm sorry for looking so disheveled. I have been trying to figure things out since the
So,
morning. Oh,
Olivia, we are live in the lobby for everybody to watch us.
okay.
So
Good
let's.
morning, everyone. My name is Olivia Roy, and I'm your moderator for the day. A very warm welcome to India's first patient-focused PCOS Summit 2021, presented by the one and only PCOS Club India. PCOS Club India is the first ever community-focused and community-based PCOS-related organization working towards the betterment of menstruators. It is focused on PCOS-related nutrition, PCOS-related medication, and the like. Our focus is mainly so the detailed agenda is present on the left side of the screen. At any point in time, if you have any questions, you can reach out to us by clicking the help desk.
Okay.
So our first segment is by Dr. Nidhi Singh and by with Dr. Nidhi Singh, who has over 10 years of struggling experience with PCOS and being dependent on pills and being disappointed in the face that lifestyle change is the only solution that can help. But nowhere could she find a trusted resources on how these lifestyle changes must be made, especially for South Asian audience. With PCOS and periods being a taboo subject in India, she felt a dire need to maintain the conversation about PCOS. She realized that live experience could truly help women and be a very powerful tool to find reliable sources and build trusted community. The other person who's going to join our moderated session is a very well-known doctor who too is going to speak about the exact same thing, just like Nidhi ma'am did.
Great. Thanks, Olapriya, for the introduction. A very warm welcome. My name is Nidhi Singh, and I'm the founder of this community, which is the India's first patient community for PCOS. PCOS, as we know, stands for polycystic ovary syndrome, which over 26% of people in India might be living with. And this is just a small number that we're talking about. The diagnosis and the taboo related to this subject makes it even impossible for everybody to get diagnosed timely, and there are a lot of people who end up getting diagnosed very late. So the whole agenda today and the whole narrative with PCOS Club India is that we want to educate more and more people about this chronic condition so that they can take care of their lives and they can take the right steps, they can access the right tools to be able to manage this condition naturally and more holistically. In this segment, we are going to talk about basics of PCOS, and I have Dr. Kanika with me. She is also the medical advisor on our panel with PCOS Club India, and she is a PCOS and infertility specialist, has a really big experience dealing with PCOS patients and deals with people day in, day out. And she wants to talk about this subject as introducing you to basics of PCOS, what is the PCOS pathology, and how does it really work. And the agenda that we have set up today, we have all the sessions lined up on how you can manage this condition and know more about this condition. With that, Dr. Kanika, I welcome you very warmly to talk about PCOS. Do share your intro with the audience, and then we can dive into the presentation.
Hi, Nidhi. Actually, welcome all to the PCOS Summit. I'm in fact very excited because nobody in India actually comes up with the whole PCOS or PCOD, in fact, or one of the same things, just to clarify from the way in the beginning itself. The reason is because somehow the whole thing has become such a taboo and it has become such a big challenge in today's day and age where nobody caters to the problem. So, am I audible to everybody? I'm just wondering. Am I?
Yes,
Oh,
Dr. Kanika.
all right. Okay. So, honestly speaking, the way PCOS and something, of course, I'm a gynecologist, so I end up reading about it when I was studying. And that time at itself, it wasn't so fulminant. People weren't talking about it too much. But now, with the whole lifestyle and the stress, and stresses at different phases of life, leads to a lot of hormonal imbalance as well. So hence I ended up digging in more deeper. And at some point of time, even I have suffered from it. I've got no shame in saying so, that we too, as gynecologists, go through certain things and we have to take care of them. And so now currently, I'm of course a PCOS specialist and infant and laparoscopic surgeon. I'm working at the Max Hospital Saket in the laparoscopic division, and as well as at Orchid Hospital. So, but the reason I was really excited to bring this on with Nidhi is because I'm so glad that finally people are talking and it is okay and it's not a big issue per se. Like, I mean, we can cater to it and it's not a taboo, because a lot of times women have come up to me and saying it's a big taboo. You can't talk about it. If you've got a problem, then someone will think it's not okay. You're not fine. So I'm glad to be on this forum, and I'm associated with Nidhi and the PCOS Club India since quite some time. So I think let's dig into what it is actually. So, first and foremost, to everybody who's on here, welcome. Thanks for being with us on a Saturday morning. And I'm pretty sure the next 2 days are going to be very informative. You can get in touch with any of us, track us down for any help you require. My basic aim through all of this with Nidhi is that any girl, even if she has a doubt of what's going on, she should be able to reach out and seek help. And it should not be such a big struggle, because although it is a very lifestyle dependent disease, we can fix it. So please do not harbor it in you. Whatever questions you have, whatever doubts you are, whatever help you want, we are here for you. So moving onwards, PCOS is something which came up pretty recently. Of course, I'm assuming like our moms, our grandmoms probably did have it, but it never got diagnosed. And PCOS usually suffers, like in India, it's about 26% of the women, which is quite significant. And you'd be surprised to know that in abroad as well, it is very, very, very prevalent. And unfortunately, it kind of starts with a lifestyle problem, which eventually becomes into a fulminant hormonal problem. It's very rare that it's vice versa, that you've had a hormonal problem which leads to PCOS directly. So I'm pretty sure, like, all ages, be it from the point you've got your menses, the adolescents, the adults, we all at some point of time have gone through hormonal changes, and few of us suffer from PCOS. So, what is exactly PCOS? So, I would say, like anybody who has been facing menstrual problems, acne, hair on your face, hair on your chest, having this obesity, which is like more male sort of androgenic obesity. So we all kind of see these symptoms with us, and then we wonder what's going on. And obviously, all of this is abnormal. And the routine thing everyone ends up saying is that, you know what, just lose weight, and or probably just eat better, which is not so simple. Okay. So breaking it down to what exactly is PCOS, basically, in a nutshell, what happens is that there is excess of androgens, which is a male hormone. Okay. And there is an imbalance of another hormone called as insulin. Alongside, we've got other partners playing like estrogen, FSH, LH, but these are the predominant things which lead us to so many of the symptoms of PCOS. So I will not go into so much of medical physiology of it, but well, there's a hormone in your brain which releases, basically, which stimulates the FSH and the LH, okay, which causes an imbalance in that hormone, which eventually leads to an imbalance of your androgen and your insulin. So in both of these things, eventually what happens is that when you've got more of androgen is the male hormone, I would say you pretty much start getting very male features. Like women in general, not supposed to get hair on your chin or hair on your chest. But when you've got more of this androgen, you kind of tend to. And then you've got the imbalance of insulin. So insulin per se in your body is supposed to keep a check of your sugar. So whatever we eat, all the ice creams or chocolates or whatever we eat, so a normal person eats that, insulin comes in play, puts a check on it, and keeps your blood sugar in control. Now, because we've got an imbalance of your insulin, sometimes there's an excess of insulin which is really trying hard to work, and it's not able to work correctly because of course we've got the other hormones to play in. So that's why when you've got the deranged sugar levels and these all hormones, androgen, insulin, FSLH, they all play in a synchrony, and you see the symptoms you see. So whenever you end up going to a doctor, like suppose we have, yeah, so I would like to focus this on that your ovaries trying to compensate and do the best for you eventually end up being very cystic. And basically there's an estrogen and a progesterone imbalance, and there is more of the cystic features of the PCOS. I will get to it later, like how on an ultrasound PCOS ovary looks like. So there is a Rotterdam criteria, although I would really like to say this, that when a patient comes into us, sometimes these features don't even match, and it's a very clinical judgment. Nevertheless, three things out of these is your polycystic ovaries, in which in an ultrasound you see about 12 or more follicles, okay, and they could be even more than that, but at least they should be measuring around 2 to 9 mm, or your ovarian volume is more than 10 ml. This is a very theoretical way of looking at it, although sometimes when you look at an ultrasound picture, we find multiple follicles and we pretty much know that, okay, fine, perhaps this patient is having PCOS. Even if it's not 12, I'll be very honest with you on that, although the theoretical version says 12. Now, next thing is hyperandrogenism. Like I say, you start literally resembling like a man. You would be having facial hair, you will have chin hair, you'll have this obesity, fat, which is more around your waist, on your thighs, and you'll have loss of hair, and there'll be hair thinning. Sometimes people don't have per se loss of hair, so there is hair thinning. Like the texture of your hair pretty much gets ruined. And then, of course, you've got acne. So, this kind of acne, when a woman comes into us, sometimes the acne, you can easily see a whitehead growing out of it. These acnes are more or less nodulocystic acne, which kind of keep developing on the undersurface of your skin and they don't pop out. So, that's again a very, very strong feature. Of course, we've got different phases of acne, and I think a dermatologist would be best to cater to this. But what I kind of end up seeing is that when they come into us and say, you know what, I've got acne and it's not popping up, I don't know what to do, it keeps paining inside, then of course we know that this is probably leading to an androgenic phase. Then you've got the menstrual imbalance. In the menstrual imbalance, you've got either no menses at all, which could be for months to come, or there can be a reduced flow in your menses. Either way, I would say you need to keep a check. So having said this, I'm pretty sure that, of course, weight gain also comes into this. Some people become actually diabetic, and you should go in for an at least a check. The worst that could happen is probably you would just ignore it, which I would not want you to do considering the kind of mode and education we have now. So diagnosis, of course, becomes a pelvic examination blood test. We do a pelvic examination once the lady is allowed it, she's married, she's okay with it. We kind of get to know the whole pathology. Like the first image kind of shows like how we exactly as gynecologists examine the uterus and probably the ovaries and how bulky the ovaries are. And the second image is how you can see, like in a black and white image, where you can see all the cysts are around the ovary, which are making it like we call in medical terms like a pearl necklace. So there was this very funny quote. I mean, I'm sure you guys have gone through it, that when they say about PCOS that I'm so classy that even my ovaries wear a pearl of necklace. So yes, this is where it comes from, necklace. The symptoms are your cystic acne, like I've said, your delayed periods or no periods. The reason you have food craving is because of your whole insulin act, and you would constantly feel hungry, like in a very like although you're full, at the same time you'll be craving sugar, and especially even after your meal. Technically after your meal you're full, you're fine, you shouldn't be eating, but you still have this craving, and it's so difficult to say a no to it. Honestly, I've been through it, so I know it. Unexplained weight loss or weight gain. All right. And then you've got all of this, of course, in a nutshell, does affect your mental health as well. You've got acanthosis nigricans, which is a darkening area around your neck. Like you would be able to see like dark strias of like you would be wondering how your neck is becoming more darker, and you'll feel like see thin lines of like probably someone has drawn it out with a pencil. You'll probably be able to see that. Pregnancy issues is one of the things. So many women, when they get married, then they're trying to conceive and they're not able to conceive, and then they get discovered with something called as PCOS. So I would really like to break the myth here that yes, PCOS women do conceive. They just need a little change, a little modification in their treatment. That's all. But you can definitely go ahead. All of this said, it really, really puts you bad in a bad mood, low self confidence, bad body image. I have dealt with women who would cancel meetings, cancel vacations, would not step out of the house because they would be so conscious of all of these features. So, my main go to is that you've got any of the things on the screen, you should contact a doctor. Now, when it comes to infertility, like I've said, like most of them get discovered with PCOS and it can be treated. A lot of infert specialists I know end up saying that, oh, you've got PCOS, you probably need to go for IVF. Not necessarily. We have different ways of dealing with it. And PCOS women are, like I told you, are usually insulin resistant. So their bodies can make the insulin, but they can't use it effectively. That's pretty much resembling how a type 2 diabetes affects. They also have higher of androgens, like I've said, which basically stops your eggs from having ovulation. Hence, your egg does not get released. You got irregular period. You have to think of it like this: like a man does not conceive, right? A man does not own a baby. Hence, a man does not have eggs. So now, when our bodies start behaving like a male hormone, we will also not release eggs. We'll pretty much be mimicking a man in a woman's outer shell. So I guess when we get it, I'm hoping if this is what I'm able to convey from this talk, it will be great. That you pretty much you have those features of male um, body basically. So what causes PCOS? To be very, very honest, this it's pretty much there that there is no particular cause. We don't know whether the chicken came first or the eggs, but we do know that they're interconnected with your lifestyle, your stress, and your eating habits. All of these things they eventually lead to having an imbalance of your hormones. So and of course, it is genetically predominant as well. Like if you in case, I guess the next slide will show you about exactly like when you have like your mom's got PCOS, you kind of tend to like have it at some point of your time. You'll have to go down, and the problem is this: when we approach our moms, our grandmoms, they'll be like, hey, we didn't know. We don't know. We probably were gaining weight and we don't know. Maybe we had children. We don't know. But it does, we have found out that it does make a difference. The genetic predominance is there. In the PCOS pathology, so basically, like I said, there's estrogen and progesterone imbalance, and the ovaries also produce male hormones like androgens. The ovaries release eggs to be fertilized by man's sperm. The release of an egg each month is called ovulation. So whenever each month you have an egg release, in a normal woman who's not married, she is called an ovulatory cycle. When we have an egg release in a married woman, she has chances of being pregnant. I'm just saying chances because the egg eventually has to meet the sperm. We've got hormones such as the FSH and LH, which are produced in the pituitary gland, like I told you, a gland in the brain, and they pretty much control the ovulation. And FSH stimulates the ovary. It tells the ovary that, you know what, I'm going to produce a follicle, and now I'm going to place an egg in it. And the LH basically comes and bursts the follicle, like bursting up a bubble. It's like how you would make all your balloons in your holi, you're stagnating them, collecting them, and now we need a trigger to pop them up so that the egg comes out of it and it gets released. And that's when you have an ovulatory cycle, which is okay. And even if you have an anovulatory cycle for 1 or 2 cycles in a year, which is all right. I need to bring this to you. A woman does not ovulate every month. So all of those who are listening to this regarding infertility, please do not stress on this that I have been trying for like about 3 to 4 months and I'm still not getting pregnant. What's the problem with me? I've already sorted my PCOS. That's because your eggs are not going to be released every month. There are few months which will become anovulatory. And that's why you have your ovulation sticks to tell you, are you releasing that egg or not? And when it comes to an unmarried woman whose cycles are erratic, that's when we have less of cycles, less of flow. All of these are connected to your ovulation.
Dr. Kanika, sorry to bring you, just last 2 minutes we have.
Sure, and I think I'm pretty much done. So you're basically the two go-to things are LH, FSH, estrogen, progesterone, insulin, androgen. I guess these 6 hormones are what we focus on as clinicians. And that's what we end up testing. When you guys come to us, we have a test of all of these things. And we're able to tell, okay, fine, this particular area is a problem. So moving on to the next thing is, yep, questions. I guess I could go on with PCOS, but I guess my to go thing is, before the questions come in, that I would really want to say this, that you can probably change doctor to doctor, um, dietitians and fads, but it all ends down to your lifestyle and your control. And it's pretty much a vicious cycle. It's like telling somebody who's depressed or not feeling good to wake up in the morning and go to work out, and the person's going to be like, I don't feel like it. I'm already very depressed. I want to lay in bed and miraculously want this to go. But unfortunately, it's not going to happen that way. You will have to push yourself towards your mental health and your physical health. That's when the medicines we give kind of put in effect. Like all the OCPs we give or the androgen problems we cater to, it all comes in a very synchronized way, and it has a good effect on you when you are focusing on your health.
So, Dr. Kanika, we have a question. What about people who have periods more than 7 days, like 10 to 12 days? Is it normal?
No, it would not be normal. But yes, if in about, let's assume in 1 year, if about 2 or 3 cycles are like that, I would say it's okay. Because then I'm giving a discount to your hormones, to your stress, but it should be checked in through. Ideally, it should not be 10 to 12 days. We should be menstruating for about 3 to 5 days, spotting maybe for 2 more days. It should end in at least 7 days. So it is going up to 10 to 12 days. Please have a check in, for we know that probably your estrogen is high. And you have to ask in that I have regular periods, no cysts in my ovaries, but I have high androgen levels, cystic acne, insulin resistance. Okay, let me say this. You probably not infertile. If you came into me with these things, I would still treat you as a PCOS. So what happens is that let's put it like this. If I have an entire pizza, it is not going to show on my body tomorrow. It is going to show on my body probably after a week. Similarly, like when we are having PCOS, it is going to take about a month or two to have its cysts and everything. It's not going to immediately come up as cysts in the ovaries. But yes, if you got high androgens, you've got acne, I would really suggest that get in a treatment. Please do not label yourself as infertile. You just need to get this treated. Try naturally. For all you know, you can conceive. And I'm probably like all the gynecs are listening, and they're probably telling me that, okay, Kanika, you're kind of taking this away from us, but I'm going to give you the hard truth here, because this is what we're here to do today. So you're not infertile. Please, let's get a check on your hormones, get you some treatment. And then if you don't conceive, we'll consider it. Why to give up and term yourself as infertile so soon?
Absolutely. And I think for infertility has been one of the most highest known myths. A lot of people come to us and say that I have PCOS. Does it mean that I will never be able to get pregnant? That's the biggest myth. And I think what you said is completely right, that not everybody could lead to infertility, and what you explained, that ovulation could not happen. Hormonal imbalance can affect our ovulation cycles. It just becomes a bit difficult, maybe causing a bit of delay in our ovulation cycle. And this is what you need to understand your cycles better and take care of yourself, take care of your menstrual cycle, understand how your body is really working with the help of the doctor. So if you whoever is listening, if you ever would like to consult Dr. Kanika, you know where to go. You have all the details on the banners, on the lobby area of our contact details. We can put you in touch with all our doctors who are going to be presenting today. So with that, we're going to have to move on to the next segment. There are a couple of more questions, but I'm sure we will be able to answer in the coming segments. Somebody asked, what is the difference of PCOD and PCOS? There's no difference.
There's no difference.
Yeah, there's no difference. Dr. Kanika, thank you so much for making time today. It was truly a pleasure, and it's been really, really amazing working with you and building this community with the help of you. So thank you so much. And
thank you so much, Nidhi. I'm hoping this is going to be fantastic. And I guess your next speaker is already on queue. So, I mean, I'm hoping to see you guys in some other segment. And I'm doing a lot of PCOS myself workshops this month, because this is something I really want to help people with. But all of you out there, you've got a great opportunity. Seek it and make use of it. And I guess I'm holding up to Dr. Sheila Nambiar now. And all the best, Nidhi. And bye, guys. And you can get in touch with me. I'm pretty much approachable to all your questions. So I should see you next time. Take care, Nidhi. On to you now.
Thank you. Thank you, Kanika. Thank you so much.
Take care. Bye-bye.
Bye. Dr. Sheila, we have you on board.
Thank you so much, Nidhi ma'am and Kanika ma'am. We have Dr. Sheila Nambiar on board, talking about enhancing PCOS management with lifestyle medicine. And Dr. Sheila is an OBGYN with over 25 years of practice at Parvati Medical Center in Ooty, Tamil Nadu, South India. She's also a certified lifestyle medical physician throughout the British Society of Lifestyle Medicine, BSLM, which is globally recognized as part of Lifestyle Medicine Global Alliance, LMGA. Besides her OBGYN practice, through her wellness program, TFL, she prevents and treats non-communicable diseases, NDCDs like diabetes, obesity, PCOS, infertility, depression, dysfunction, and other various chronic lifestyle diseases using fitness, lifestyle medicine, and positive psychology. We are overjoyed to have her on board with us. In case you want to join the lobby and see the details about the events, they are on the left side of the screen. Thank you so much.
I was on mute. Thanks, Olivia, and very warm welcome, Dr. Sheila. Very, very happy to have you on board. The kind of experience that you have put in your practice and being certified as a lifestyle medicine physician, I'm sure you're very, very motivated in terms of making a true change in the PCOS community and spreading more awareness. With this session, we would like to know more about lifestyle medicine. We would like to know how budding practitioners can also learn more about this and include this in their practice while treating people with PCOS, because all we know, PCOS is not curable. We don't have a cure, and lifestyle is the only way where we can understand our bodies better. We can take care of ourselves without the pills. We all know we don't want medicines. Nobody likes to have medicines. And the lifestyle is the only thing that we can truly manage our conditions better. So with that, Dr. Sheila, I would like to invite you to answer some of the questions which our all audience are waiting to hear from you. A very warm welcome.
Thank you, Nidhi. Thank you for that intro. And I'm happy to be here to answer a couple of questions. Take it away.
Great. So, Dr. Sheila, first question is that you've had a big career in the OBGYN world. What made you pursue lifestyle medicine after having completed your studies in gynecology and with that experience? And what made you lead ISLM?
Well, I think like many practitioners and many physicians who go through the current medical curriculum, I discovered when I started practice that there is a gap between what I really wanted to do and what I was doing. And what I was doing was basically treating symptoms using pills, potions, and surgery. I was not treating the real cause. So for instance, taking another non-communicable disease as an example, if you look at, let's say, a heart attack, people would say, for instance, I know many people, myself included, we've all been through the agony of losing somebody we love to, let's say, a quote unquote heart attack. So the cause of death is a heart attack. But if you really look at it, that's not the real cause. The real cause goes a little way back. And it's usually lifestyle and behavior. So by just treating symptoms, while I am completely on board with emergency treatment, on board with medication and surgery where it is required, because I'm still an allopathic physician, I think there are a lot of times, in fact, most times, when we need to address the root cause of the disease. Most of the time it is lifestyle. So I didn't start as a lifestyle medicine physician. Actually, I literally put the cart before the horse. I started by certifying in fitness and lifestyle way back in 1999, and I started teaching exercise, nutrition, counseling patients. Of course, there were a lot of raised eyebrows at that time, because what was a doctor doing teaching exercise class? But I enjoyed it, my patients and students enjoyed it, and I still continue to do that, because I realized that fitness, diet, counseling, that didn't exist in my current armamentarium. After doing that, and after doing that for literally 18 to 20 years, I discovered in 2016 that there is an actual specialization called lifestyle medicine. And I attended the Asian Society of Lifestyle Medicine conference in Taiwan in 2000, I think it was 16 or 17. And after that, there's no looking back. And we started a couple of us got together, we started the Indian Society of Lifestyle Medicine. And here we are in India also, we've got this thriving society now, increasing in membership every day. And I'm hoping that, it increases even further.
That's brilliant. That's brilliant. And this is something that what you're doing with ISL, I mean, Indian Society of Lifestyle Medicine, leading that, it's fantastic. And I wish you all the very best.
Thank you.
I do have another question. So how has this changed your practice, and what has been the response of your patients, specifically with PCOS, we'd like to know?
Yeah, well, my practice has changed in many ways, Nidhi. For one, I've been in general gynec and obstetric practice for now over 27 years. And obstetrics, for anybody who knows, is a very, very stressful field. In fact, it's one of the most stressful fields. So for me, it has been life-changing as well, because I have introduced a lot of other factors into my practice, such as having workshops, counseling patients, exercise, of course. And this actually mitigates a lot of my stress as well. So it's been therapeutic both for me and for my patients. My practice today is much more nuanced. It's not as hurried and rushed, seeing a whole lot of patients, run-of-the-mill symptomatic care. It is the counseling, the talking to the patient, it takes much, much longer. And of course, I have my paramedical staff to help me, because you can't do it on your own. You need a team, you need a dietitian, you need other people on board. So it's become very much a part of my practice. And how have the patients responded? Well, it's a mixed bag. Not everybody is on board, because making the lifestyle change is not easy at all. And that's what lifestyle medicine is about. We literally handhold you through the behavioral change. But it's not easy, and not everybody wants to put in the effort. And this is where the medication comes in, because you may need to introduce the medication for symptomatic help in the initial stages, because patients do want relief. They want relief from pain, they want relief from the heavy bleeding. So symptomatic treatment may still be required, and I'm not against that at all. What I'm saying is introducing lifestyle in the meantime, helping the patient through her behavioral change, which is definitely not easy, hand-holding, helping her to empower herself. Essentially, that is the role of a lifestyle medicine physician, empowerment of the patient to take care of herself. So that process is not always easy. Some patients get on board beautifully and they are extremely satisfied, because it's not just symptoms and not just the PCOS that is helped, but their entire quality of life improves. Because we also introduce positive psychology, which talks about positive emotion, how to increase positive emotion. There are several positive psychology interventions that I use where we improve positive emotion in a patient. So, and we do know that an improvement in positive emotion allows the patient the opportunity to take better care of herself. So it's all interlinked.
That's because I feel that the counseling aspect is something that we as a patient would love to get when we go to a doctor. And we have seen in the community, not everybody is able to invest that time, even if the doctors want to.
Yeah.
You definitely need the team to be able to provide that counseling. And what you're doing is very beautiful. And I hope more and more doctors can take away, or the budding health practitioners could learn that how they can do it more comprehensively. Because if you truly want to make a change, the counseling is the only thing that we feel can, help us more. Because now, as we know, after the diagnosis, we have so many questions and we want somebody to handhold us. So thank you for making that change, Dr. Sheila. Very, very inspiring. Moving on to the next question. I think you've already sort of addressed what is the approach for dealing with PCOS and hormonal imbalance cases, but do you want to add something more to that?
Yeah. So whether it's a PCOS patient or any other patient with a non-communicable disease, or even something like depression, back pain, we start off with something called motivational counseling, motivational interviewing, where you don't just ask the patient her list of complaints, which is what we normally do. What's your problem? And it's just 1, 2, 3, 4, 5. We also talk to the patient about her life. What are the other aspects of her life? And even questions like, what is working for you? What are the things that drive you? What are your stress levels? How is your sleep? What are your social connections? How do your social relationships, how are they affecting you? These are all very, very relevant factors. And like I already said, it's not easy to have this entire conversation with every single patient every single time. So you do need a team. So once you get the real history of the entire life, not just symptoms, you move on to deciding whether she requires the symptomatic treatment as of now in order to manage symptoms, and then also introduce prescriptions of diet, prescriptions for exercise. So as an LM physician, lifestyle medicine physician, I do prescribe. I prescribe a diet just as I would prescribe antibiotics for an infection. I prescribe an exercise routine as I would prescribe something else for some other problem. And I also prescribe positive psychology interventions as and when required. And then we also handhold, because it's not just a prescription, sliding a prescription across a desk. We do a bit of handholding, which means follow-up is very, very important. So we ask them to come back, online consults, or meet my dietitian, or meet a psychologist, meet another junior lifestyle medicine physician, whatever the case may be. Depending on the willingness of the patient, we always follow up.
That's really great. And we have never seen, Dr. Sheila, you're on board with us on our panel, and there are a lot of people who might want to avail your services. So if you ever want to get in touch with Dr. Sheila, please feel free to reach out through our website or our numbers given below, and we'll be able to put you through her. There's certain questions which are coming in, and we'll take it through as we go towards the end of the session in the next 5 minutes. So Dr. Sheila, what advice would you give to the budding health practitioners and gynecologists, and how can they improve their doc and patient relationship? The reason why we have this question is there is so much of negativity about, doctors not listening to the patients. And this is something that we get from our audience. While there are so many people like you who are doing things differently in the PCOS world as a health practitioners. So what advice would you give to them?
So while I would say that it's not easy to be a doctor in today's environment, It's not even as easy. It's much more difficult than when I first started, for instance, because the environment itself has changed. There's so much social media, there is the internet. So the patients are also informed without really understanding a lot of what is going on, litigation, all of that. So please understand the other side as well, that doctors also have it tough and we lead very stressful lives. So I'd like you to also understand that aspect. And one of the reasons why there is no time and patients feel doctors don't listen is because there is no time. They see many patients every 10 minutes or even less. So now, not everybody would want to go into a lifestyle medicine practice. I think it's a huge career choice. But I'm very happy to see a lot of young gynecologists, especially, are signing up to become lifestyle medicine physicians. What I would say, even if you don't take up lifestyle medicine, even if you don't go through the certification process, which is not, it's not a cakewalk, takes time and effort and all of that, I would greatly recommend that you at least understand the importance of lifestyle in the management of PCOS. So which means that as a doctor, as a gynecologist, stressing on lifestyle to your patient will also help them understand the importance of lifestyle. Because we know that when a doctor counsels and talks to a patient about something like weight, like diet, like exercise, she takes it more seriously. So firstly, understand the importance of lifestyle medicine. And I think it's important to create what is called a therapeutic alliance with your patient. So you're not just a doctor giving advice. Today, we want to create a therapeutic alliance with your patient. You want the patient to actually walk with you or you walk with her. So a bit of handholding, coaching, rather than just being authoritarian and say, do this and do that. Right? So I think that approach is what the healthcare is coming to. Things are changing. There is a huge paradigm shift in healthcare. Patients expect something different. And I think doctors are also recognizing that and definitely getting on board. A lot of them are definitely getting on board. So that would be my advice. Create a therapeutic alliance with your patients and also listen to the patient, not just her symptoms, but actually listen with empathy and authenticity. Because she can tell you she can actually give you the diagnosis with just what she says to you.
That's said so beautifully, Dr. Sheila. And with that, we already have a lot of questions coming in about Indian Society of Lifestyle Medicine. Do you want to tell more about your work, your goal?
I'll be happy to. Yeah. So the Indian Society of Lifestyle Medicine is a non-profit organization. It was started in 2018, February. I'm the current president and I'm one of the founders of the ISLM. And it is part of the Global Alliance, Lifestyle Medicine Global Alliance, a physician, allopathic physician, nutritionists, exercise physiologists or occupational therapists, and psychologists. These are the people who can actually become members of ISLM. So you have the physician category and you have the affiliate category, which is all the psychologists, the nutritionists, etc. And either you can just become members of ISLM and then follow our member page on the ISLM website, or you can go ahead and take the exam, which happens once a year. And fortunately, it is happening in India as well. And this year, in fact, it's a virtual exam. When I took it, I had to travel to Edinburgh to do it. But a lot of the countries, us included, we have the exam once a year here. The exam is an international board certification. So you become either a lifestyle medicine physician, if you are an allopathic physician taking the exam, or you become a lifestyle medicine practitioner, if you are a nutritionist or a psychologist. Once you do that, then you will also be able to, if not practice lifestyle medicine completely, at least you can introduce it to the current practice that you have. And this applies to any specialty, from pediatrics to neurology to psychiatry to cardiology. Every field of medicine requires lifestyle intervention. And knowing the principles of LM will help any specialist. And you can go to our site, islm.org.in, to check out the website. And if you're a physician or a nutritionist, you certainly can become a member and we'll be happy to guide you. You can reach out to me. Nidhi has my number. You can reach out to me if you're interested in becoming a member. we'd be very happy to have you on board.
That's amazing. I hope more and more people know about this. And with that, Dr. Sheila, we get to the Q&A segment. We do have some questions coming in. So there was one question about how can we pursue lifestyle medicine? So we've already shared that. There is a question on how does plant-based diet help to improve PCOS symptoms?
Yeah.
And we have a whole range of topics lined up today for that, but we'll be happy to know from you.
In lifestyle medicine, we propagate a whole food plant-based diet, which is basically a plant-centric diet. So you don't necessarily have to go all the way vegan if that's not something you desire, but certainly increasing the quantities of whole foods, primarily from plants, is extremely beneficial for PCOS as for any other inflammatory condition. We know PCOS is an inflammatory condition. The underlying cause is an inflammation. Plant-based diet helps with that. Eliminating dairy helps to a large extent. Increasing the amount of and the variety of plants that you consume, which includes green leafy vegetables, fruits, nuts, beans, and seeds. All of this will improve your condition. And also help you lose weight, because we know that weight is an issue with PCOS, and losing the weight becomes very, very difficult. So diet is the primary driver of weight. Exercise helps, but diet is a primary driver. So we recommend the whole food plant-based diet, as it is anti-inflammatory as well. And there is a lot of research coming up. The Mediterranean diet is, of course, been highly researched. A whole food plant-based diet is very similar, but we try and keep the animal products to the absolute minimum that a patient can possibly tolerate. And a patient is willing to go. We may need supplements like B12, vitamin D may be required. But yes, that's what we advise in lifestyle medicine.
That's great. And for the audience who is interested to know more, our next segment is actually by a plant-based nutritionist who's going to talk about proteins, and a couple of more sessions tomorrow as well. So if you'd like to know more about top mistakes while doing that, or things to know before you go on a lifestyle which is based on plant-based, you should definitely look out for that. Thanks, Dr. Sheila, for that. There's a question that what if a dentist wishes to pursue LM? Is that possible?
Currently, dentists have not been included, and there are several reasons for this. But of course, going forward, we will be, doing a lot of ratification of the current constitution. So at the moment, unfortunately, I'll have to say no. But I think if you reach out to me and keep in touch, I will definitely keep you posted when it opens up. But I really appreciate that a dentist wants to do this.
Yes, and Dr. Sheila can be, contacted separately through her website. Her website is www.drsheila.com, and you can approach her and subscribe her, or subscribe to her updates and so on and so forth. There's another question which says that my doctor is adamant on giving me metformin, and I asked for inositol supplements, and she said that I will not be able to work around that, and it will not work for you. Please share your thoughts. Just want to put out that in this session, I'm sure you will have a lot of personal questions related to your personal health profile. So we can only help you in a very limited way. If you do want to take a consultation, I think that'll be the best way. But over to you, Dr. Sheila, to share your thoughts.
Yeah, I don't want to comment on individual patient care, Nidhi, because I don't have the complete history. So it would be very unfair of me to comment on another doctor's prescription. I have no idea why she has said what she has said. Although I must say metformin is one of the drugs that are used to improve insulin sensitivity, but that's all I can comment on. I don't know why she hasn't recommended myo-inositol. I'd rather not comment on something that I don't have a complete history of. I would, talking to the patient and getting a history would be more beneficial. There was one question, can people with MBBS pursue lifestyle medicine? Yes, certainly. So if you've completed, the minimum requirement is an MBBS, so most certainly you can.
Great.
And then can nature cure? No, unfortunately, we only allow allopathic physicians. There are various reasons for this. So allopathic physicians, nutritionists or dietitians, psychologists, exercise therapists, these are the people who can pursue lifestyle medicine.
Great. There is a question which is a bit, again, personalized, but I'll try to make it a bit generic relating to what we also get in our community, is that some people come off the pills and they try to do lifestyle modification and they do not get success. And there is a question always hovering on our minds that should we go back to the pills, or how long should we wait with our lifestyle modifications until we go back to the pills again? This question is, I think, the most highly asked question in the community, but I'll give this to you to give your generic opinion.
Yeah. So getting your period by itself is not the ultimate objective for the patient. From a doctor's perspective, because just getting the period by itself is not something that is going to be beneficial unless her endometrium is becoming much thicker because of a very high estrogen environment. So if you've already started your lifestyle modification and if you're seeing results, which are by which I mean if your weight is coming down, if you are exercising enough and in the right way, if your diet is appropriate, I would say you could wait a minimum of 6 months to without really being too concerned about not getting periods alone. So you don't need to, and you don't necessarily have to go back to the oral contraceptive pill. You could just take the progesterones for the second half of the cycle. And there are many ways of managing this. So I wouldn't right away say go back on the pill. I would definitely say tweak the modification to the extent where there is a result. It's not just about the lifestyle modification, it's about the result that comes with the modification. So if you're not seeing results, then from the modification, by results I mean your weight, your sleep, your stress levels, all of that needs to come down. It's not just the symptomatic treatment of the PCOS that is important. The rest of your life needs to fall into place, and it won't happen overnight. Nothing happens overnight. There is a whole lifetime of behavior that needs to be changed. That will take time, and we need to be patient. We need to have a positive and optimistic approach to it, and with some guidance from a certified and somebody like a lifestyle medicine physician, it can certainly be helped. So don't be too concerned just about periods alone. I think focus on getting your lifestyle in order, implementing the changes. Even if it's slow, that's perfectly fine. Small steps is perfectly fine. And things will fall into place. And your treatment is also dependent on what is the ultimate objective. Is it infertility? Is it having a conception that is the objective? Or is it just periods that is the objective? We need to also address that part. So just going back on the pill is not the answer.
We do have a question about related to the ovulation. So do we get a period even without ovulation? How's that possible, and what is the chance of that?
Yeah, it's very, very, very possible to get a period without ovulation, which is what essentially happens in PCOS when you don't get a period for a very long time, and then you get often a very heavy flow for maybe 10, 15 days, or maybe a very scanty flow for a couple of days. That is a bleed without the ovulation. So the background or the pathophysiology of PCOS is that ovulation doesn't happen on a regular basis. So the bleed is only the shedding of the endometrium or the inner wall of the uterus. And that can happen with just hormonal fluctuations without actual ovulation. So the diagnosis of ovulation needs to be made in order for you to for us to determine that it is ovulation that is causing the bleed. Sometimes what is called as dysfunctional uterine bleeding, for instance, which may not be PCOS. It's a different problem altogether. DUB is because of anovulation or improper ovulation. So yes, it can happen. There was another question about can doctors with just MBBS pursue? Yes, you can. yes, you can. You don't need a specialization. You can pursue lifestyle medicine.
Thank you so much, Dr. Sheila. I think with that, we have addressed most of the questions that came our way for you. And thank you for such an insightful session on pursuing lifestyle-based medicine. And what you're doing is truly a remarkable change that we see in India with gynecologists practicing lifestyle-based medicine. So I hope more and more people pursue this, and more people get to know about what you're doing. Some brilliant work. And thanks again for making time. Thank you for
Thank you,
being
Nidhi.
to earth and being so humble about your tight schedule and taking time out to be here today with us.
Thank you, Nidhi. Thank you so much. I hope it's been of some help, and I hope I've also inspired more doctors to take up lifestyle medicine.
Absolutely. Thank you, and have a good day.
Thank you.
That, we are ready to host our next speaker. His name is Vaibhav Garg. Hi, Vaibhav.
Hi, Nidhi. How are you?
Thank you so much, Nidhi and Dr. Sheila. Before we start with the session, Vaibhav Garg is a sports performance nutritionist and a metabolic disorders expert. His specializations lies with enhancing sports and exercise performance through nutrition and helping people reverse and prevent lifestyle and metabolic diseases like PCOS, diabetes, heart diseases, thyroidism, obesity, hypertension, cancer, and the list is endless. After receiving his master's degree from the University of Sheffield over the last 10 years, he has the fortune of working with professional football leagues like the IPL, the Super Fight League, and he has closely worked with Gary Christian and his team as well. Thank you so much for joining us today. And the entire summit details will be available on the left of your screen, and the helpline desk numbers also are mentioned at the end of the presentation below.
Thank you so much, Olapriya, for the introduction. A very warm welcome, Vaibhav. Vaibhav and I would like to say that we've worked before on a lot of topics. This is not the first time he's part of our community. He's spoken a lot about the whole food plant-based diet, about veganism, how his patient community has been leveraging the supplements that he's founded his own chain of supplements which are true and authentic, and also been working very closely with people with chronic conditions. We are very, very eager to know about your thoughts on protein and their role with PCOS. You've been doing some great work in the sports segment and sports arena in India, working with big leagues. So congratulations, Vaibhav, and welcome on board for the first ever PCOS Summit today.
Thanks a lot, Nidhi. It's an honor to be here, and kudos to you and the team for putting something like this together. I've always said that we need to raise our voices where it's required, and especially when it comes to lifestyle, it's too overlooked. We need to speak more and more about it. So, before we dwell deeper into it, could I have someone put up the slides? If it's yeah. We can just start from the first one. Thank you. You can just shoot it to full screen and then we should be good to go. Okay. So your question basically on protein, right? So, what do we do about the protein? So let me speak to you about, first of all, protein in general, and, a little bit about the science about protein. In my opinion, first of all, we really overestimate how much protein we require. It's not supposed to be as hyped as the industry makes it seem, honestly. For God's sake, all our ancestors were vegetarian and they were not protein deficient. I can assure you that. Okay. Speaking about PCOS, though, if I were to just give like an overview, it's advisable, obviously, to eat a diet that is rich in some proteins because we want to reduce the glycemic load. Because especially since the female body is going through a mild to severe state of insulin resistance, I would encourage not only a protein-rich diet, but a diet that is supremely rich in fiber too. Like I said, we overestimate the need for protein because the real macronutrient here is fiber and not protein. I know with the subject is protein, I'll be talking a lot about that as well, but I'm trying to draw attention on the important areas as well. All the colorful, antioxidant-rich fibrous plant foods are our best friend. You can't forget that. For better understanding, the proteins are the building blocks, so you can relate the building blocks, the amino acids, the proteins basically, like bricks in the wall. So you need only as many bricks as the size of the wall, right? So if you want to build a wall by 5 by 5, for example, and you need maybe 100 bricks, if you even have 101, it's not going to use that extra set of that extra brick. Similarly, you only need to consume as much protein as is required by your body. Eating more protein will not make you lose weight, and neither will it reverse your PCOS. That is the reality. Okay, we do not store excess protein. It's all about optimization.
Great. Moving on to the next topic, we had that how much protein does one really need? Does this change if you have a predominantly like a sedentary lifestyle, or like versus when you're active?
So for the audience here and majorly for the ladies here, I want you all to ask yourself a simple question though first. If you were to ask yourself, who am I? Would you be the woman on the left? I'm talking about the sedentary lifestyle, or would you be the active woman on the right, who's more active, basically? If you pick the left, please get off your backside and start doing something. It can be anything. You can go play a sport, dance, do yoga. You go to the gym. You pick, but you must always keep moving. That's just not healthy. For protein intake, I keep it very simple, and it's worked very well for all my clients over the last decade. If you are inactive, I think about 10% of your total calorie intake, based on your basal metabolic rate, of course, can be a protein intake. So what does this mean? So for example, if your basal metabolic rate is 1500 calories, which means that you would burn 1500 calories on a daily basis, 10% of that would equate to about 150 calories. Now, if I divide that by 4, that's equating to about 35 to 40 grams. So if you are inactive, your body doesn't need to build that much muscle, doesn't need to recover that much. Hence, it's enough. On the contrary, though, if you have an active lifestyle, you can definitely push it up to 20 to even 30%. That's what I usually keep for the athletes. So the food, honestly, would usually take care of all these needs. Protein supplements, really, they need to be earned. If you are highly active, we need to do some calculations. We need to assess the quality of your life, the quality of your exercise, the quality of your food, and then we understand whether there is a requirement of anything additional. Honestly, more than 90% of you in the room today do not require any protein supplements, even if your gym buddy or trainer have asked you to take it. Nidhi, you're on mute.
Yeah, sorry, that always happens, right? Tell us about the whole foods plant-based sources. Is it true that in an Indian diet, we cannot fulfill the protein requirements, especially if you're looking to increase protein in our diet? Could you share a few examples of foods on how one could include more protein in their diet, especially for a vegetarian or somebody who's plant-based?
Okay, so before we jump on to the next slide, I want everyone to see this slide, and it's there for a reason, okay? So do you see the anatomy of a cat feline on the left versus the dental structure of a human on the right-hand side? This itself is an indicator that you and I, all the people in this room, we are not carnivores by nature. We do not need to get our protein from animal-based foods. Okay, and here's where I just want, because see, their teeth, their dental structure is meant to tear into the meat, because that's how, you need sharp objects. So we are more advanced than that. We don't use our teeth, but then, we are individuals of high IQ. So we invented the fork and knife. Honestly, we don't need that. Okay. We don't need to tear into our meat because we're not supposed to be consuming meat. But this is where I go deeper into the typical Indian diet. And this is my favorite bit. So let's take an important ingredient, of the Indian diet, and which we have touted to, be highly beneficial, rich in calcium, rich in probiotics, rich in protein. That's basically your milk products. See, you need to understand, you and I, we're not baby cows that we need to drink cow's milk and then ferment it to make curd and then further process it and get paneer or cheese. Cow's milk is for baby cows, and let's just leave it at that. We can always go deeper into the science of how you're consuming a ton of growth and sex hormones also along with the milk, components that are not required by your body. And listen, we do not get calcium from milk. Stop falling prey to the mass marketing and false advertising. If you have a look at the study on the lower side, the populations that actually consume most milk are more prone to fractures, poor bone health, and things like arthritis. Yes, this is research. This is the science. I haven't made any of it up. Okay. You need to stop following those non-proven diets. There are a ton of things out there. Take milk to lose, you eat a lot of paneer, basically take the keto diets to lose weight and all. We just need to change our mindset a little bit. We need to shift away from, losing weight, for example. Even if you have PCOS, there are multiple kinds of PCOS. Okay, there's thin PCOS, there's a heavy PCOS. So if you have PCOS, if you're trying to lose weight, don't focus on the weight, focus on the root cause of the problem, which is basically the hormonal imbalances. Focus on the insulin resistance. But anyway, coming back to the Indian diet, if you have a look, the Indian diet is actually one of the best. And I don't take, milk into consideration because, see, nature never intended for us to consume the milk of another animal. We are the only ones who do it. We are the only animals on the planet to do that. And milk is associated, as you can see in the other research, it's even linked with cancer. And this is just one form of cancer I've highlighted here because obviously the audience here would be more interested in something like this.
Vaibhav, I have a question here.
Sure.
So we talk about, a lot of paneer in our homes, and this is coming from an Indian typical home where, and me coming from, a place where I had to educate my family and folks that I will have to give up dairy. It's not an easy journey. Let's assume this. And for a person who's just trying to make a change, it gets a bit difficult to go into a process where they're taking out milk, they're taking out paneer, they're not in charge of their groceries, and they're not in charge of a lot of things in their life. So what are the sustainable things that you tell your patients? And it doesn't mean that somebody has to go plant-based like fully like tomorrow. Obviously there's a step-by-step approach. So keeping in mind with the foods that you're trying to talk about, how can we bring that change in our homes?
So I spoke about optimization earlier, but okay, getting to an optimized state might take time. So it's always good to make the transition slowly. How I believe we can become believers of this though is that we need to educate ourselves. I've always believed in education. When I sit down for a session with a client, I spend anywhere between 60 to 90 minutes.
Wow.
Because it's all about education. You've experienced that firsthand, Nidhi, for yourself, your family members. We need to spend a lot of time on educating the person. If you do not understand the problems that your body is going through and why it's happening, everything is a moot point. The food you're consuming, the exercise you're doing, everything is pointless. Absolutely. But to answer your question, yes, you can start making simple transitions wherein if you feel there is enough research, if you believe in the system, give yourself a month, give yourself 2 months, start getting off one item at a time. It could be milk, it could be paneer, it could be curd. If you are if you are experiencing symptoms related to PCOS or anything else, any metabolic disorder, it could be digestive issues, poor liver health, joint pain, you would be surprised. You'll be surprised if you start giving up milk products. Within 3 to 4 weeks, you will see a massive difference in how your body feels. I often ask people this question: why can you not look and feel like an athlete? They weren't born with superpowers. They were not gifted any special abilities. No, it's all about conditioning. They educate themselves, they condition themselves. So you can go for options like plant-based milks. You can go for options like, though I'm not a big fan, honestly, of soy, which is tofu, which is which is supposed to be a good solution, alternate for paneer. I'm not a big fan of it, and I'll speak about it a little later as well. But you can opt for more legumes and pulses in your diet as a source of protein instead of paneer. There was one more research I was planning to put up here with regards the casein, which is the milk protein, but I thought it would be deviating a little from the topic. But see, these are simple transitions, changes you can make. And if you're not in charge of the groceries at home, it's best to educate not only yourself, but then your family members as well.
Can speak about it from a personal experience. It's definitely hard, but doable. You have to, whoever family is with you, your close ones, with your lifestyle change, I think the improvements will also show in their lifestyle. And even if one person in the family educates themselves, it just makes things easier. And slowly and gradually, you are able to make that change, but it does take some time.
Okay. I just want to add a little bit more. We were speaking about the Indian diet, and this is where maybe you can jump onto the next slide as well. See, the typical Indian diet, this is just one aspect of it. And people usually say, could you just jump to the next slide, please? So people usually ask me that, okay, aapne milk hata diya, now what? There's nothing else left to eat. I was in the gym yesterday, and I was having my training session with the trainer. And he was showing me his blood reports. He's like, sir, mera cholesterol badha hua hai, ye mujhe please aap bata do. So I was giving him some tips ki aap ye changes karo, aapka theek ho jayega. And there was another member there overhearing me, and he's like, fir bacha kya khane ke liye? Maine kaha, have you ever been to a sabzi mandi? And the trainer started laughing. I'm like, go to a sabzi mandi and you will be spoiled for choice. You will not be able to incorporate all those items into your daily routine at all. I mean, you can go weeks and you can have a new option to eat every day of the week. So the typical Indian diet unit consists of vegetables, fruits, pulses, grains, nuts, millets, seeds. It's going to give you all the protein you need without any of the nonsense. So you see these animals on the slide. You know what's common with all of them? They are vegan, or what we commonly refer to as vegetarian, which means that they eat only plant-based foods. And trust me, they are all bloody strong. They are not conditioned by advertisers and the food industry to consume meat and protein powders to gain muscle. Just by the way, you can see the abs and pecs on a gorilla if you ever see one. Google a gorilla's image on Google, okay, and all you see are his pectorals and his abs. Oh, by the way, the man in the picture is Patrick Bobomian. He's German. He's one of the strongest men in the world. And yes, he eats only plants, as you can clearly see from that photo. See, here's the thing. The typical vegetarian or vegan diet can and will give you more than enough protein. Okay, and the slides to come again will further emphasize that. So I'll just speak a little bit about, just step aside from the lifestyle disorders part, PCOS and all, speak about what the athletes also are doing. I've worked with more than 500 athletes in my time. I've worked with a lot of sports leagues. I continue doing that. The first one, okay, it's the most striking one. And rarely, I'll be honest with you, rarely will you see a research paper. Okay.
Sorry, Vedant, your voice is muffled.
My voice is muffled. Give me.
Now you're fine. Now you're fine.
It's fine now? Okay, great. So I was just saying that if you look at the first research on the top left, rarely would you find a research piece on the internet, anything published with the topic ending in an exclamation mark. Do you see that? The best athletes in ancient Rome were vegetarian. It is a statement. Besides the research being in place, it is a statement of intent. They did not consume meat. Okay, and the ancient Romans or the so-called gods that they have been referred to, you've seen images of them on the internet, and what all they used to do. The other research here, you can ignore the New Zealand part here, okay? But I thought there was an interesting extract from this one when I was looking up some stuff to put up here. When we speak about exercise, the only thing we hear about consuming after an exercise routine is a protein powder. Be it your gym buddy, be it your trainer, that's all they talk about. But if you look at this, and if you look at the conclusion, it is basically the conclusion to that research, that something like a blueberry, basically foods rich in antioxidants, colors, have such an anti-inflammatory effect that they help reduce muscle damage, they improve blood circulation. They do a job that is supposed to be done by the fruits and vegetables that your protein supplements will not do. They have shown to have far more beneficial effect than just protein powders. So we need to, again, like I'm saying, get out of that mindset. The science is, ladies, the science is very different from what the media will tell you always. You see these athletes, I'm sure most of them are familiar with these people. There's Serena Williams, Novak Djokovic, that basketball player, by the way, is Kyrie Irving. Everyone knows Virat Kohli, everyone knows Mike Tyson, everyone knows Lewis Hamilton, okay? Do you know what the two things common to them? I think you already know one because we've been speaking about it again and again, that they are vegan. But despite being vegan, they're all champions in their sport. And I can emphasize again on that, they are champions in their sport. Do you not see that there is a gap in what the reality is and what we are made to believe? See, with all the athletes I've worked with, I optimize the consumption of protein. They all come to me with either higher fat percentages or the inability to perform up to their expectations because they have the science of food all wrong. They think protein is the answer to their success, but it turns out it is suppressing their performance due to the meats and whey proteins they're consuming. They do nothing but increase inflammation and oxidative stress, period. It's all about inflammation, reduce inflammation. Even PCOS is an inflammatory condition. Inflammation is at the root of every metabolic disorder. Okay, overconsumption of proteins is not going to lead to anything great. It's just going to, result in deposition of fat because anything extra that you put into the body stores it away for some time later. Oh yeah, and what about the damage and extra stress that it would put on your liver and kidney?
Absolutely, Vaibhav. There's so many questions which have come up, so I think we'll take just 2 minutes to close the presentation and want to give enough time for answering.
No problem.
Okay, in the next segment, we had questions about, does one have to turn non-vegetarian or resort to supplementation to specifically fulfill their protein intake? We do have many people who may live away from their homes and do not have access to wholesome plant-based diets. And can, in that case, protein supplements be advised? If so, what should be their approach?
So I will stick to the point, okay, and I will share a very interesting piece of research also while covering this, okay. See, I've mostly covered the part about how much protein, powders, etc. Okay, focus on a high fiber diet, nicely balanced with complex carbs, plant-based proteins and fats, lots of colorful fruits and vegetables, and of course your plant-based vitamins and herb extracts, which obviously are need-based and have massive therapeutic benefits. So I have thousands of documented cases of disorders like PCOS, diabetes, cancer, heart disease, reversed through what I like to call my very own diet therapy. Okay, this pattern of eating, by the way, will give you more satiety as well as compared to a high protein diet. Okay, here's something I picked out for all of you, and I really want to speak to you. So there are apparently two appetite control systems in our body: the homeostatic system and the hedonic system. The homeostatic pathway actually maintains our calorie balance by making us hungry when energy reserves are low and abolishes our appetite when energy reserves are high. Very simple, right? In contrast, though, the hedonic or reward-based regulation can overwhelm this homeostatic pathway in the face of highly palatable foods. That's what happens when we're exposed, right? This makes total sense from an evolutionary standpoint because back in the day, it was rare that something in front, something came across in front, like maybe honey or something like that. So it was very normal for us to grab it. But today, such opportunities are not rare anymore. We have stuff like sugary foods, fatty foods in front of us all the time. And this is where the hedonic drive may end up taking control. It overwhelms us, okay? and it throws away all kinds of reasoning and sense. And honestly, we have invented through no fault of our own PCOS, diabetes, heart disease, and even cancer. It's our own invention, it's our own doing.
We wanted to address something about soy. What is your view on soy and how this is a good way to include more proteins in our diet?
There are a lot of different takes on soy. The soy product companies will do all they can to tell you about the benefits of soy, with it being high in protein and also beneficial, due to the phytoestrogens and all. I have a take that is slightly different based on the understanding of the food industry. See, soy was cultivated as cattle feed, as fodder. It wasn't for human consumption. Land where soy is grown can actually be wiped of its nutrients because of the nature of the crop. It just draws everything from the soil. Nothing else can grow on those lands. It has immune suppressing qualities. It is inflammatory in nature if taken regularly. And if you have a thyroid condition, you need to stay miles clear of it. If consumed in moderation, that too of the organic variety, we can still make peace with it, but only as a condiment. Don't bank on it for your regular protein intake. Did you know that part of the reason for global warming is the cultivation being done to feed the dairy and meat industry? Acres and acres of land are actually converted to grow soy and corn so that farmers can rapidly increase the weight of their domesticated and abused animals. There's a lot happening, not known to most of us. That is why we take up, people like Nidhi, myself, so many out there. We take up the mantle to educate all of you on these important matters. And really kudos to Nidhi and the entire team and many others who are raising their voice and, setting the wrong right. We really have a long way to go, but we've at least put the movement in motion now.
Thanks, Weber. This was truly insightful. In fact, we have one segment dedicated to soy, which is tomorrow with Dr. Neetu Bajekar and Rohini, who is going to talk just about soy. So if anybody is interested, do tune in for that session. Now, with that, I'm going to jump in right into the questions because they are overflowing for you.
Sure.
So we'll start with the first one. What about gut health and benefits of ghee to help it?
There are always exceptions. Ghee definitely is beneficial for us. So the advantage with ghee is that it is highly alkaline and anti-inflammatory in nature. If I were to speak about the chemical constitution of ghee, it greatly resembles human mother milk. And obviously, if something resembles human mother milk, it would be good for us. So that is one exception, definitely. As far as gut health is concerned, see, our gut health is the first line of defense. That's where, the bacteria line up the intestinal walls. That's what basically ensures whether efficient nutrient absorption is taking place or not. Everything you eat basically ends up in the gut. So yes, it's very important to keep your gut health in check. And yes, things like not only ghee, but prebiotic foods. Okay, so prebiotic foods are foods that are healthy or foods for the probiotics in your gut. So things like rice, fibrous foods, pulses, very beneficial basically for the gut.
What is your view about eggs in the whole food plant-based diet? They're rich in omega, and a lot of people are given white omelets or whole eggs omelet. There's so much of various diets which are around just eggs. What would you say about that?
See, if my dairy industry is going to produce millions and millions of eggs every day, I need a channel to basically sell them to, right? All the nutrients that you get from egg would be available elsewhere as well. See, there are a couple of things maybe you might not get, but those things are not the ones which would cause us any disorder or dysfunction, like choline, for example, phospholipids. It's not a problem. If we maintain a healthy, nutritious diet with vegetarian foods, it won't be a problem. It's just all mass marketing. It's all lobbying. We don't need eggs to survive.
Sorry, I got on mute. I don't know how. Sorry about that. Uh, can I have soya chunks every day as a protein source?
So just today in the morning, there was a reel by someone on Instagram. Okay. And this guy was talking about how these companies are coming up with mock meats and stuff that looks like chicken and meat. He said, if you are wanting to go plant-based either for your health or for the environment or to avoid any kind of animal cruelty, why are you still looking for things that taste and look like meat? So the same concept applies with soy. See, soy, again, I already spoke about how soy is actually not good for us. If taken in moderation, it's okay. But why are you consuming the highly processed version of it? Try to consume it maybe in the raw form, if at all. I always encourage consumption of foods more in the raw to lightly processed or cooked form, because the body identifies those foods the most. Don't forget, we are, as part of the evolutionary cycle, we are gatherers by nature. Okay, even millions of years ago, we would go out into the wild. Okay, we would gather our food, bring it back to the cave. We would feast rather. Then we would sleep for 8 hours, 10 hours, 12 hours. Then we would go out again, look for our food, gather it, bring it back, eat, feast, go off to sleep. Okay, that's just how the human body works. The fact that we've created so many different versions of our foods, it's not healthy. It disrupts digestive health. Okay, you lose a lot of calories in digesting foods that are processed. At the end of the day, you're reducing your body's efficiency by doing so.
So Weber, we are almost like 4 minutes away from our next segment. So we'll try to keep it crisp. A lot of questions are there. I want to address everybody's questions. So let's try that.
Okay.
Let's keep it a rapid fire. Where do we get probiotics from? Buttermilk from A2 cow's milk is not okay?
Probiotics are already there in your gut. They have evolved. They were born with you. They evolved with you over a period of time. Keep them healthy. You don't need to replace the existing probacteria. It's like saying, okay, I've burnt my limb. Let me replace this limb with another arm. No, you don't do that, right? You take care of it, you nurture it, and you heal it to recovery. Similarly, your probiotics are already in your gut. You don't need to take more probiotics. Take care of them. Keep them healthy by eating the foods they need.
So you said that about prebiotics, which will help as well.
Absolutely. Prebiotic foods, fibrous foods, basically vegetables, pulses, rice. And rice is always something that's been made the enemy, but rice is not the enemy, trust me. And rice is not linked with weight gain and diabetes, just FYI.
What's your view on fermented foods and vegan curds that are available in the market, sauerkraut, all of these? What's your view on that?
They are so much better than consuming milk-based versions, because then you cut out the nonsense, you cut out the unnecessary lactose and the casein and the hormones. So the plant-based versions, they would be made from coconut milk, for example. It's absolutely fine. Coconut milk is good for us. Fermented foods, again, if you're fermenting things like rice and all, or any other carbohydrate-rich foods, it's absolutely fine. As long as the source, the original ingredient is a plant-based source, it's not a problem at all.
Great. So we do have some substitutes if somebody is looking to replace their curds. So we have a positive sign from Weber. Great. What is your take on pea and hemp protein? And there is another question that we got from somebody in the audience that he's a fitness trainer, and he wanted to know how can he give protein who exercise hardly. So he says, I have to suggest protein for people who exercise hardly, and when to take protein, preferably plant-based, for people who does not react well to whey protein. So I know you have your reservations on supplements, but if somebody does have to consider, what would you recommend?
I'll try to keep it crisp. It is so the science is all clear. This is not my take. Whey protein is cancerous. It is not my take. Okay, there are millions of papers out there that would prove this. Plant-based proteins are the sources, but for this gentleman, the fitness trainer or the lady, why do you need to give a protein powder to your client who's hardly active? Like I said, if you're inactive, you don't need to consume supplements. And even for an active person, you need to earn it, because if you're not breaking that much muscle down, what will you do with those protein supplements or those extra proteins? Your body will just store it away as fat. Body does not store protein. Please remember that. Only consume as much as required. Just focus on a good high fiber diet, and that's what you need.
Is there any calculation of how many grams of protein is required ideally per day? Is there some calculation based on our body weight? How do we ensure that we're taking enough protein every day?
So we first calculate what our basal metabolic rate is. So for example, if it's 1500 calories, so if one burns 1500 calories in a day, if you are inactive, take not more than 10-12% of that total intake. There's a simple calculation. So basically 1 gram of protein will give you 4 calories. Okay. So basically if you divide 1500, so 10% of 1500 is 150, you divide by 4, that's 25, 32.5, 37.5. So 37.5, 40 grams of protein is enough for you if you're inactive. If you're active, you can go up to 20%. If you're an athlete, you can go up to 30%. Not more than that though. So the stuff that the trainers are doing in the gyms, and they're advising their clients to take 1.5 grams worth the kg of body weight, twice the body weight. It's not needed. It's not going to get you the results you require. You're going to come back with bad clinical reports, and then you'll be coming to people like me to show them and get them right.
So regarding the protein powder, right? If we go back to that, there are a lot of questions about that. So plant protein powder is something that you recommend if you would want to?
I said more than 90% of the audience here listening does not require protein powders. I showed you images of those animals. They eat grass, grains, fruit, vegetable. The horse, the elephant, the rhinoceros, the gorilla. No one is taking protein powders. It's overemphasized. This is what we call brainwashing. It's an eye wash. Stop spending your hard-earned money on those boxes of protein. You don't need it. Focus on your food.
Sources of vegan protein sources, how to consume legumes. What about phytic acids that they have? Do we need to pair legumes with everything?
So that is a little technical. I think this person is referring to getting the whole profile of amino acids. Yes, different grains and pulses and legumes might not have the entire profile of essential amino acids. So pairing basically ensures that you get the entire profile. So hence it is beneficial. That's why we always eat rajma and chawal. Why? Because rajma and chawal together will give us all the essential amino acids.
Absolutely. And there's something called protein complementation. This is the reason rajma is not had on its own, or beans are not had its own. You have to complement it with a carbohydrate. So read more about protein complementation. This session is just about proteins, and I will give you the last question, which is about there are people who get bloating with pulses, sprouts. How to identify that inflammation, and is there something which is wrong if they're taking too much of that?
So people are not able to address the problem. The underlying cause, unfortunately, is not the pulses. Okay. There is underlying inflammation already. If there isn't, add some asafoetida, which is hing and garlic, to your pulses and legumes when you prepare them, and you will see that your bloating will considerably go down. Also, if you have a pre-existing digestive issue, try not to take anything sprouted. Okay, because the shoot, basically, once you germinate any pulse or legume, the shoot possesses an acid which basically leads to inflammation in the gut. It is a defense mechanism of the plant, basically, that when the shoot grows, traditionally it's supposed to grow in the soil. So the shoot is not strong enough to hold the seed in the ground. To avoid pests from attacking it, the shoot contains an acid which avoids it from being attacked. Once it goes into a larger root, it diminishes. But then while it's in the shoot stage, we consume it as a sprouted food. So we must avoid that.
Great.
Have it boiled. Yeah.
Great. Thanks, Weber, for that quick presentation. I know there's so much that you have to say, but I'm sure people can find you on your socials, your website. You're also paneled with us on PCOS Club India's approved healthcare practitioners. So if you ever want to consult him, our numbers are everywhere on the banners. You can get in touch with us and we'll be happy to schedule an appointment. With that, we would like to get on to the next segment, and thank you, Weber, for making time out of your busy schedule on a Saturday morning. I'm sure it must be very buzzing with your consultations. So thanks for making time, and thanks for
welcome.
Work and joining our mission. We wish you all the very best and have a great day.
Thank you, and all the best for the remainder of the summit. Thank you. Bye.
Thank you so much.
Thank you so much, Nidhi ma'am and Webab sir. We now have Mr. Kamal Nayak, who's the founder of Good Universe, talking about the journey of creating awareness about PCOS and the like. Sir, thank you so much for joining us here today.
Hey, hi. Good morning, everyone.
Hey.
Am I audible?
Great. You are audible, Kamal. Thank you, Priya, for. Yep. Go ahead, Olivia. Sorry.
Yeah, thank you so much, Mr. Kamal Nayak, for joining us. We're so glad to have you here with us on this day. So we are going to talk about, how you, as the founder of the Good Universe, started awareness and started talking about PCOS in general, and share your story as a PCOS ambassador.
Yeah, I think there's a little bit of internet or network issue, but I got it what you're saying. I'm really glad to be here today, and so excited to see that there is something called PCOS Summit is happening, and the association with Nidhi has been like 2.5 years. It's great to know that you guys have put in a lot of effort to create awareness around PCOS. Amazing work. Thank you for having me here today. Just to start with, there's a small story I would like to share from the year 2016. So 2016, I and my teammate were talking about PCOS, and it was very alien topic for me back then, but we did a little bit of research around it. And we decided that we'll do a program where we'll call people to talk about PCOS. Very little we knew back then. And the first question we had, or my team had, that who will be the audience, whom we are targeting, who we are calling. Then we quickly did a survey, and we understood that nobody has any clue around PCOS, at least in our network. And that message was spread across different groups, different college students, different IT, non-IT people having quite a good experience and educated urban audience. But we didn't get any response, and most of them were not aware about PCOS. So the challenge then was if we'll conduct a program, the prime thing is to have the right audience, and then whom we are inviting. But as a young organization, a new organization, we always take that leap of faith and do our awareness program. And we designed a program and designed a poster and spread it across. And we got only 25, registration. Then we did the program, and the outcome or the interaction in the PCOS program, the first time ever we did in 2016, was really amazing. The story came out from that program was quite insightful. Sorry, that's my cat. So while we are doing this first program, then we got to know that there are many people who are suffering with the PCOS issues, and they share their story and what they go through, from the diet to the body issues, hair issues to the weight loss issues, and from the mental health aspect. And it was quite shocking. We thought we'll just talk about PCOS and giving overarching knowledge. Okay, this is something you can face as a sexual reproductive health. But later we got to understand there is just not sexual reproductive health, but it's social stigma. At the same time, there is body positivity issues, there are mental health issues. And then we decided that we are going to do it in a larger way, on reaching out to the people who are actually not reachable from the right information and right knowledge. So at Good Universe, we always believe that people or women should have right information first. And From there, we decided that we'll be doing the program. Then we designed a curriculum to take it to different places, like the rural, urban setup, college-going student, corporate setups. In 2017, we did our first PCOS conference, and we invited people from alternative healthcare. We invited people from yoga, mental health expert, and we started discussing around the program. We had around 120 participation. But what was the key out of the conference was people who participated in that program wanted to take it to different level, to the different rural setup and rural spaces. So by now, we are working in 13 different districts in Telangana and different spaces in Andhra Pradesh, Odisha, West Bengal, and Assam, talking about PCOS, educating them around PCOS, providing them diet, providing them mental health support. We run a mental health support which is not free of cost, but it's quite subsidized, in a very, I would say, minimal cost for PCOS suffering women and those who are domestic abuse survivor and going through some issues. For them, we are having a counseling program running. And till now, we have reached out to more than 5,000 people in Telangana and Andhra Pradesh, working with them very, very closely. But most of the time, they come up with some health-related issues, then we do not deal with that. Our work is to create awareness around PCOS. So we refer them to various doctors, various hospitals, and ask them, consult with practitioners or alternative health practitioners. Yeah, so that's what we do at Good Universe, and it's quite an insightful journey for us, especially starting from 2016 to this year. We have been doing PCOS conference and having amazing participation in that, and creating awareness in the rural, tribal, and urban setup.
I think that's really important, because of the social differences we have in all sorts of society, and the practitioners, the lack of education, the lack of social awareness. So that was a really, really good session. Thank you so much. We have the next session right now as of.
So I would just take an opportunity to thank you, Kamal, for doing the work that you are. It's truly, truly amazing to hear this story from a man speaking about this topic openly, doing conversation, which we hardly get to see. So taking that initiative and being the flag bearer of the community that you have, it's truly inspirational, and we congratulate you for the work that you have done in the PCOS community by helping relentlessly and with all your heart. Hope people can only learn more and more from you. If anybody would like to join the conversation, you can definitely reach out to Good Universe page and learn more about their initiative. Again, Kamal, congratulations for the initiative, and I hope you achieve more milestones in the goals that you have established for your community.
Thank you so much. It's a pleasure being here, and thank you for doing this summit and creating more awareness around it. Thank you so much.
Thank you, and you have a good day. Olipriya, over to you.
Yeah, so we have the next session right now, and we have Dr. Vishaka Shivdasani from talking about non-pharmaceutical medications and drugs. But before that, we would like to talk about our sponsors for this session, which is Unived. Unived is India's leading vegan dietary supplement company since being founded in 2010. The company has been focused on research and manufacturing of a wide range of products. Unived has many formulations for women's health, specifically PCOS management, PCOS fertility, PMS management, women's iron, and a whole food women's multivitamin, all originally formulated by Unived India. We are so lucky to have them with us. Now, to talk about the speaker who is going to speak in this session, Dr. Vishaka aka Dr. V, is a medical doctor, an award-winning nutritionist, and an author of COVID and post-COVID recovery, a 6-point plan for COVID recovery. She has treated thousands of patients all over the world for weight management and helped countless other reverse chronic health problems like diabetes, heart diseases, and other lifestyle ailments by judiciously combining nutrition and other lifestyle changes with medicine. She's been a vice president of South Mumbai's Medical Association of Doctors, and she's a recipient of the Vogue's Nutritionist of the Year. Thank you so much, ma'am, for joining us today. Ma'am, you're on mute.
Can you hear me now?
Yes, ma'am, now you're audible.
Sorry about that. Sorry about that. Hi, thank you for having me. Fantastic initiative, Nidhi and the team.
Thank you so much. We see you a bit differently, horizontally. I mean,
Oh, you want me to change the mode? You want me to keep it this way?
Yeah, this is perfect, actually.
Oh, okay. I thought you wanted the landscape mode.
So happy, and the much awaited session with Dr. Vishakha, everybody. First of all, I would like to really thank you, Dr. Vishakha, again, for being so humble, for being so approachable when I called you to request you to come on board. And I'm overjoyed to see you as part of our summit today because you have been working relentlessly in the lifestyle medicine, which we want to hear more and more now, and doing some great work, especially in the COVID phase, where you wrote a book and it's been doing really great. So congratulations on the initiative. I'm sure it must have been a nightmare to put that out while your practice was going on.
It was. It really was. But thank you. And your initiative is no less great. It's fantastic. So thank you for having me. Happy to be here.
Great. So in this next 40 minutes, I will try to keep our conversation short because there's so many questions that people are asking, but we'll try to ask our questions that we decided and get on with our conversation. So first question to you is, while our community has observed the most highly prescribed medicine is hormone therapy, and you mentioned that you love taking people off medications as much as possible. Tell us more about your journey and what motivated you to become a specialist in the lifestyle diseases and your approach towards treating PCOS.
Okay, so at the onset, I would like to say I do prescribe medicine as and when needed, because most people, like you said, know me as the doctor who takes medicines off the prescription. Now, whenever possible, yes, I like to do that. But that's often possible in lifestyle diseases like obesity, like PCOS, what we're talking about. If somebody came to me with an infectious disease with malaria or dengue, I'm not going to say I'm going to give you a lifestyle approach and that's what you need to follow. So it depends on what the patient's coming to me for, right? As far as PCOS is concerned, because it's lifestyle, I mean, like you just said, I've treated countless patients who we've completely reversed. Yes, sometimes patients who have been on medication, I need to keep that medication on for a bit because I can't suddenly stop the medication. So I need to wean them off. And then, because lifestyle change takes a little time. Lifestyle change by definition means you need to change a habit. And to change any habit takes some time. So if they have been on a medication for long periods of time, I let them be on the medication, let the lifestyle change kick in, see how compliant the patient is, how well he or she's doing. And then I start tapering off the medicine with the intent that in a matter of a few months, we will completely be off the medication and we will be able to reverse their condition. How did I do that? Because I started practicing as a physician straight out of med school for a good 5 or 6 years. And I was doing fairly well, actually. But I realized that the medicines itself, while they were treating the patient of their symptoms, they were also giving them a lot of side effects. So it's like saying, somebody comes to me with a fever and I give you paracetamol to take care of that fever. Does it do the job? Of course, it will take care of the fever while the effect of the paracetamol is on. I don't know whether the fever was due to malaria or dengue or a viral disease or whatever it was due to. So I need to get to the root of the problem. which was not happening with conventional medicine. In conventional medicine, we treat the effect of the disease. In functional medicine, what I do, or lifestyle medicine, we get to the root of the problem and we treat the cause of the disease. And to me, that was way more fascinating. Also because the drugs weren't causing side effects. And then I was treating the patient with, with other medicines to take care of the side effects of the drug that was caused. Like in PCOS, we give metformin. Metformin is causing, it's a commonest given drug. And I love metformin. But it also depletes your body of certain, nutrition, which we can talk about later. And then I was trying to replenish that, which doesn't happen with lifestyle. So, just got me thinking. Then I took a sabbatical. It was difficult to take that sabbatical from a successful practice. And I decided to do a fellowship in nutrition, did that, came back. And then I started merging both of them. So I merged medicine and lifestyle medicine with fantastic results, even if I say so myself.
That's beautiful. And I hope more and more, doctors take up that, because in our community, we have seen that there is only one way of communication, that this is the medicine that you have, but the kind of hard work that you put in counseling and bringing other aspects together, educating people, this is what we need more. So I hope more and more people can take up this kind of practice. That's great. So there's somebody who also said that can a patient be PCOS free after being diagnosed once, or is it a lifelong condition? Because as you just mentioned, a lot of people are reversing their condition. What do you have to say about that?
It absolutely reverse PCOS. It is a lifestyle disease. Most lifestyle diseases, be it obesity, insulin resistance, PCOS, type 2 diabetes, fatty liver, you can almost always reverse these conditions. Yes, you have to be compliant. Yes, it's a lifestyle change. I have patients who will ask me, if I put up, because it's PCOS Awareness Month, I put up a series on my Instagram, and somebody, questioned me saying, okay, so if I take zinc that you recommend, how long do I need to take zinc to reverse my condition? I said, hey girl, no supplement is going to reverse your condition. It's a series of lifestyle changes. If you follow them all together, of course you can reverse it. And I want people to know that, especially women who think that they can't conceive because they've got PCOS and oh my God, that's their destiny. It's so far from the truth. You can absolutely conceive. You can get rid of your acne. You can get rid of your hirsutism. You can get rid of, the obesity, insulin resistance, most of it, and reverse PCOS. Most times you can, yes, without medication.
Loved how you reiterated that. So that really keeps the positive vibe going. So there's a lot of noise around going back to our roots, going back to what our ancestors used to eat. But on the other hand, we see that our lifestyle is not as what our ancestors had. It's truly very stressful. Some of it you can't really avoid in your lives. So do you think it's a right approach that just going by eating what our ancestors used to eat can help improving our health? What's your view on that?
Look, you can't take one part of a person's lifestyle and say that because they ate in a particular way, I should be able to eat in that way, right? Because when most people talk about what our ancestors did, they're mostly they're talking about food. They're saying, oh, but our ancestors ate mithai, and our ancestors ate ghee, and our ancestors, so it's mostly food related, diet related. Our ancestors also did a lot of hard work. They didn't have staff, they didn't have drivers, they woke up at a certain time, their lives were relatively stress-free. So if you can emulate that kind of lifestyle in totality, then can you eat the way they did? Yes, because it allows you to do that. You're burning so much more. You're sleeping at a particular time, you're waking at a particular time, you're eating food that's organic. You're having milk that's probably, your cow from your backyard has given you. It's so different. It's not fair. It's not correct to pick up one part and then say, I want to emulate that. Then you emulate the entire lifestyle. That can give you the leeway. So, this is misleading that because our ancestors did this, we should do it. No, then you follow everything. You sleep at 8 p.m., you wake up before sunrise, you do all of that.
That's beautifully answered. And this is the question we wanted to put, because there is a misleading statement always that you should do this because our ancestors used to. So that's beautifully said. Moving on to our next question is, a person with PCOS could be at various different phases. Someone who's newly diagnosed, while someone may have been living it for decades. How does your treatment be different in such cases?
Good question. So it's much easier to do a lifestyle change and to prevent a patient from becoming, completely PCOS for someone, say, who's just insulin resistant or just has weight gain, right? It's much easier to prevent them from going on medication with lifestyle changes, as opposed to somebody who's been diagnosed a decade ago and is on the pill, is on metformin or, medicines or anti-androgens for, the acne or the hirsutism or for ovulation. But those patients, because like I said right in the beginning, lifestyle change takes 3 months, takes 6 months. I allow for the support of the medication to happen while we make the lifestyle change, and then we slowly wean off. But even in those patients, in a matter of a few months, they wean off their medication. So even for somebody who's, say, a diabetic, even somebody who's on insulin, forget metformin, I've taken patients off medication completely and for life. And it's not like, I think my Instagram sounds more like a testimonial really, because it's always of these before and afters, and patients who are off insulin, whose acne is cleared and who've conceived normally. It's all possible. It is a lifestyle related disease. Yes, there is a small genetic component, but this is also what I say. Your genes only load the bullet. They load the gun. Your lifestyle pulls the trigger. And the lifestyle is completely dependent on what you do. So don't blame it on your gene. Don't blame it on my mother's diabetic, or my aunt had PCOS, or my other aunt couldn't conceive and therefore I can't. No. Then hold yourself responsible, take onus of the health and change it. Very possible. So if it can be done soon, if you're just newly diagnosed, or if it can be done over a period of time, which also can be done, matter of few months, but can be done.
Very nice. Truly said, Dr. Vishakha. What would be your advice for a person who's been on pill for years? Does your body need any special attention if one's looking to get off pills? There are people who are on pills for 8 to 10 years. What would you have to say about that?
See, why do we give pills for patients on PCOS? We give pills so that they ovulate, right? Because after estrogen, then they don't have that ovulation, which means the progesterone doesn't happen. So they're unopposed estrogen, and the unopposed estrogen is what causes most of the problems. So most of the OC pills that we give are progesterone based so that the patient ovulates, right? And because if you're just on estrogen, it's not just about conception. We can get endometrial hyperplasia, you can get endometrial cancer, those kind of things happen if you're unopposed. So you have to then mimic natural ways of producing progesterone in the body if you're trying to get a patient off the pill. Otherwise, how are you going to get the patient to get rid of the side effects or not go in for endometrial hyperplasia or endometrial cancer? How are you going to do it? You can either do it through medication or you can do it through lifestyle changes. Now, through lifestyle changes, I can't really produce progesterone in the body, but there are certain foods, certain nuts, certain seeds, certain things that I can give you. Again, because that takes 3 cycles, 4 cycles, while I'm trying to wean the patient off the OC pill, while they are on the OC pill, I will start that change. So the body is starting to now get the progesterone and the estrogen, depending on the time of the cycle, through those things externally. Then once I have built up that reserve, then I can pull off. And we see that a patient may not necessarily get a period immediately. We'll get it in 3 months. Then the next time we'll get it in 2 months. Then we'll start getting it every month. So there is a protocol we follow, depending, of course, also on the estrogen progesterone levels, FSH-LH levels, AMH levels. It's different for everybody. But to answer your question, yes, it is possible, but they have to follow a protocol of making sure that they are getting the hormones through their diet and then weaning them off.
Absolutely. And I think that not everybody sees the same difference or effects of the treatment because, see, everybody's different the way we feel, and the effects may come in differently for each person. So the reason why I'm reiterating is that as you also said, how much time will it take for me to get periods back? Or how much time will I, be able to reverse? It's no one answer for that, I'm pretty sure. And as you rightly said, it's a protocol. So we have to trust the process and just giving it our best and working with somebody who's a specialist. In the world where everybody wants to help with their whole heart, I feel certification and an experience can, somebody who has it can really, really help. So always look out for people who have experience reversing chronic conditions.
And you look at it from an integrated approach, right? It's not just, can I do just nutrition, or will only exercise help me, or will only my sleep patterns help me, or will only supplements, like the whole world, thinks that's only supplements. It's not the holy grail. It's an integrated approach. So you have to do it all.
Absolutely. There are a lot of questions on lifestyle change, but we'll get to that as people are asking. So there has been a lot of focus on eliminating carbs, resorting to diets such as keto, intermittent fasting. What is your view about diets that focus on calorie deficit or portion controls? It is truly very exhausting, focusing on so many different diets. What are the possible, what is your view, first of all? And if you could also tell us the side effects or downsides of these diets.
See, anybody who has worked with me, anyone who has watched any of my interviews over the last decade and a half will tell you, I don't believe in the concept of calories at all. Yeah, it's not the calorie, it's where the calorie comes from. Is it coming from a protein? Is it coming from a carbohydrate? Is it coming from a fat? You can be on a calorie deficit diet. You can be on an 800, 900 calorie diet, which, by the way, is very unhealthy. But you can be on that diet just having juices. You can still be PCOS for the rest of your life. You can still be diabetic for the rest of your life. You can still be overweight for the rest of your life because those calories are coming from liquid sugar. You can be on a 2000 calorie diet with the calories coming from good fat and protein and from complex carbohydrate. You can still drop the weight. You can still drop the fat, more important. You can still reverse your PCOS and all that extra weight and all the side effects that come with it. So this whole thing about calorie restriction, calorie in versus calorie out, luckily has been debunked a long time ago. A lot of people still believe in it. Please change. I'm hoping you're watching this for a reason that it's not worked for you. So try something different, and I promise you it will work. So don't focus on calories at all. What is the second part of your question? Sorry. Keto, intermittent, taking care of, these fads. Intermittent is not a fad. I really like intermittent. I think it has a lot of health benefits to offer. Intermittent has to be done A, under guidance, B, under certain protocol, C, a certain group of people should not do it. So there is a way to do intermittent. Keto is great. I have done it over phases. Personally, and for patients, I say it's not possible to do it long term. It's not sustainable. I didn't find it sustainable. I know 90% of my patients don't find it sustainable. Again, there's a group of people who cannot do keto for various health reasons. If you've got gallbladder stones, if you've got kidney problems, please do not do keto. With keto, the other problem is very often you can get nutrition deficiencies. So if you are doing keto, like I tell a lot of my Bollywood clients or patients, who are getting married in 2 weeks and want to look a certain way for a short period of time, we will do it for you with the understanding the weight is going to come back on because you're not going to maintain it, A. B, I will never do it for somebody more than a few weeks, no matter what the pressure. So I won't recommend it. And you have to take X number of supplements. Else we see copious amounts of hair fall. We see lots of other issues. The digestion goes for a toss. So again, to be done under guidance, and you need to have certain supplements when you take it. So what I say is do stuff that becomes a lifestyle. All of us enjoy our carbs once in a while. So it's okay to have your rice and your roti and your pasta and even your pizza, even while you're trying to drop the weight. It's all right. Some of us have a sweet tooth, some more than the other. It's all about the balance. And it's all about how you calculate those carbs. It's all about what your current parameters, your medical parameters are. And then you need to see what works for you. So what works for me based on my medical parameters may not work for you or for somebody else. But do whatever can be a lifestyle without causing any medical side effects. Vanity is second, health is first. I tell every single patient that if you're walking into my clinic wanting to look a certain way at the cost of your health, I'm the wrong person to come to. Health first, vanity later.
That's so true. And what you said, that we can't stop living our lives, like we can enjoy our pasta and pizza without getting guilty about it. In fact, we have a session today afternoon where we'll talk about eating disorders as well, because we go crazy as a community with so much of information, and not everybody is lucky to land up at the right place at the right time. I personally had to 4 years of my life, I was running around in circles. So I'm sure there are a lot many, but thankfully, hope people are listening to us and this message goes to more and more people.
And said, well, one moment. Since you said when you're eating, you eat without guilt. That is so true. Because, I do weekly sessions or bi-weekly sessions, and they'll call me up and they'll say, very shy or sheepish, and say, we're really sorry, we indulged and we had that extra slice of pizza this week, or we had that little piece of cake and we're feeling so guilty. And I tell everyone, if you are going to so-called indulge, do it guilt-free. Do it being in a happy space that you enjoyed it. It's okay. When you eat out of guilt, you raise a hormone in your body called cortisol. Now, the function of cortisol is to store fat. That is physiology. I can't change that. So you're not only eating, you're eating with guilt and you're storing the fat. If you eat that little bit, and this is another thing I say, you should follow the 80-20 principle. 80% eat clean, 20% if you want to indulge, it's okay, live a little. And that 20%, enjoy it so thoroughly that you don't miss it. It shouldn't feel like a forbidden fruit or a forbidden food. Then your hormones will play along with you. So if you are going to eat, just enjoy it, devour it, and go back to eating healthy. Don't do this whole, I'm eating out of guilt, my cortisol levels are going up, I'm storing the fat, I'm going to cry next day, and I'm not going to eat, and I'm going to eat 800 calories the next day. Rubbish. So
in the next segment, we particularly want to talk about the weight loss. So the research and PCOS guidelines and so many other papers that are obviously well researched say that 5 to 10% of weight loss helps. Now, as you said, there are people who have body image issues, they want to work on themselves. What do you have to say who are just driven towards losing that weight? I know you sort of spoke about the side effects of getting into a weight loss mode only. Also, what would be your advice for people with lean PCOS, which is truly different? So here you may be thin on the outside, but what could they do differently?
So lean PCOS affects a good 10-15% of people with PCOS per se. So not everybody who is obese necessarily needs to have PCOS. You can be lean like me and still be PCOS. You can have that belly, which is what we call tofu, thin on the outside, fat on the inside. And you can have that visceral fat. Even a thin, lean PCOS person can still have insulin resistance. They can still be put on metformin. And I'm saying this because there's a misnomer out there that's saying people who are thin should not be put on metformin. And oh my God, it's only the fat, it's only the obese people who should be put. No, wrong. Even the thin ones can be put. The lean PCOS patients have a few different symptoms. They have more menstrual symptoms as opposed to the overweight patients with PCOS who have more acne and more, the other symptoms with hair and hirsutism, etc. So we need to evaluate them differently. And lean PCOS should not do intermittent fasting because that will make you drop the weight. It's very good I think it works very well for overweight PCOS patients, and I do recommend that. I don't think weight loss should be done in the name of body shaming or because you want to look a particular way. You should aim at health, aim for your parameters to look different, aim for you to feel differently. Whether it is intermittent, whether it is keto, your energy levels should surge. You should feel good about yourself. The way you concentrate, your cognition, your exercise, your workout energy, at your workplace. Self-esteem happens as a byproduct. Once all that happens, I see this in patients who come to me who are young at 16, who have PCOS because they can't conceive, menopausal women with PCOS. And it's so gratifying to see not what the weight loss per se can do, but what the change can do. Because they suddenly say, we feel like a different person now. And it's not something that takes 5 years, it's something that takes 3 months, 4 months. So I don't want a person to think that, oh my God, I need to lose weight, I need to be fertile, or these names that we give PCOS people. That's just so wrong. Sorry, I just digressed, but I just feel that's so pertinent and that's so important. And I see this at the clinic every day. I mean, a PCOS patient is no different from a non-PCOS. Just take the onus and just reverse it. And it's not difficult losing the weight. It's just not difficult. People say, I've got hypothyroid, which very often runs hand in glove with PCOS, right? And so, oh my God, I'm hypothyroid, I can never drop the weight. I've got PCOS, I've got weight around my abdomen, but never goes. I lose weight everywhere, I don't lose on my stomach. These are the common things people come and tell you. All wrong, all incorrect. Whatever you're doing, then you need to change. So you can drop weight if you're hypothyroid. You can drop weight if you're insulin resistant, if you're overweight. If you're lean PCOS, please don't drop more weight. Just change the parameters, doing other lifestyle changes. So it's absolutely possible, but do it from a happy space, not out of a place of body shaming.
That's a great advice. And we've got getting a lot of questions, and I'm sure I can sort of ask it here. I know we have a different window. You talk about the lifestyle changes. And there is as we say, that we're just talking about weight and we were talking about other parameters. Do you want to very briefly say, what do you mean by lifestyle changes? What are these lifestyle changes?
Sure. So of course, one arm is nutrition. It's a very, very, very important arm. It's a very important pillar of lifestyle change. And we can get into specifics if you like later, but nutrition is one. Sleep is hugely important, especially for PCOS, especially for a diabetic. It's something that we don't speak about. Stress, again, like I said, stress increases cortisol levels, increases fat, changes your insulin levels. I mean, we only think of food, but what happens to your stress level? What happens to the way you're sleeping? Are you sleeping according to your circadian rhythm? Are you sleeping in a way, it doesn't change your hormonal parameters? So you need to address those. And of course, you need to supplement, right? So if you're deficient in certain things, even if you do things, the rest of it correctly, you do need for your hormones to work in a certain way, like vitamin D, like we say, we call it a vitamin, but it's actually a hormone. And it's a master hormone. So if you're deficient in a supplement like vitamin D, which by the way, 80% of PCOS patients are deficient in vitamin D, 80%. That's a massive number. So when you're low in that, you're going to get a cascade of other hormonal effects. So when somebody comes to me saying, I have done everything correctly, and I'm still not dropping the weight, I am still not, seeing a difference in XYZ symptoms, then I will say, have you taken the correct supplements? Are you getting your vitamin D? Are you getting XYZ supplements, which we'll talk about? So fill in the missing gaps and look at all 4 of these. So look at how you're sleeping, look at your stress levels, look at your nutritional parameter, look at your supplements, and of course, look at exercise, 5 parameters. Yeah. So you need to look at all 5.
And with the lean PCOS, I think there are a lot of people who avoid exercising, which is, I think, really, really big mistake. What do you have to say about that? So
in fact, like I said, lean PCOS also has insulin resistance. We need to make them insulin sensitive. So we need to make sure that the cells take up the glucose from the blood into the cell. And the way that happens is to build more skeletal muscle mass, which happens with weight training, with functional. So you need to make sure that your body fat is less, but your muscle mass is more. When you build that skeletal muscle mass, the uptake of glucose is different, and you actually make your cells insulin sensitive. So please, if you're lean PCOS, go and just use whether it's your own body weight and you want to do functional, or whether you want to lift body weights. Don't do cardio, not necessary, but you must work out.
That's truly informational. We would like you to talk about certain supplements that you definitely shared in the earlier segments. But here in this segment, what are the top supplements that you have seen in your practice work superbly well? And what are those overrated supplements that you see in the market just as a marketing gimmick?
So I think supplements, like I said, need to be used judiciously. I think toxicity of supplements. So that's one. B, and most important, remember, you cannot out-supplement a bad diet. So you might have all the supplements in the world. If you have a bad diet, if you've got bad lifestyle, you are not going to change your outcomes of PCOS. And I cannot emphasize on this enough. They're very important, probably even like a mainstay, but they cannot replace a bad lifestyle. So no supplement is going to outdo a bad lifestyle. That being said, there are supplements that hugely help depending on your PCOS symptoms. So if you have, say, I prescribe a lot of zinc. Zinc helps with infertility. Zinc helps with patients who've got insulin resistance, which is most people, or people who've got hirsutism, right? Like male pattern, like the beard kind of thing, and the chest on the back, thinning of hair. Zinc helps with that. You can get zinc naturally through most supplements which have protein. Protein is synonymous to zinc. So all your protein-rich foods are also rich in zinc by default. And how much should you supplement? Of course, depends on your blood work, on your parameters, but I would say about 25 milligram. I know a lot of people give 50 and 75. I'm against that. So that vitamin D, of course, like I said, vitamin D deficiency also, we've seen that in ovulation, there is a problem. In fertility, there's a problem. And a lot of PCOS patients who come with those issues, at the first thing, it's like a red herring. And I'm like, where are you at with your vitamin D? And then we need to change that. So if you're low in vitamin D, dosage, of course, depends on where you are, parameter-wise, on your blood report. But daily dose of about 1,000 IU is great for a maintenance. And I think everybody should take that. In fact, there are a lot of studies that say a daily dose helps more than a bolus dose of 60,000. So that is the other thing. There's not really enough vitamin D that you get through food at all, even the fortified food. So take the supplement and make sure you get sunlight, because nothing beats nature. So you should get that. Chromium. Chromium hugely helps with insulin resistance. So chromium is a great drug to take and a great supplement to take. And of course, you get all of these through your foods. But if you're deficient, I like to give them through supplementation, because you'll have to really eat big portions of food to get it through, a food thing. And a supplement is much easier and much faster. Magnesium. Magnesium is one of my favorites. I think I did a video on it yesterday on my Instagram. Magnesium is absolutely one of my favorites because it helps you sleep well. And like I said, sleep is undervalued in PCOS. It helps you take care of your stress levels. It helps with, multiple things. It helps with aches and pains. It helps with reducing blood pressure. It helps with, anxiety, which very often comes with PCOS. So I like magnesium a lot. Then with patients who have gut issues, I really like giving a probiotic. In fact, I think I give a probiotic to most of my patients, because the gut is, like we call it in medicine, we call it the third brain now. So most conditions originate from the gut. So I want to make sure that you're getting proper, your microbiome is in great shape and your good bacteria is growing well. So I like to supplement with a probiotic. And, with certain probiotics taken early morning as opposed to taken after a meal. So I give that. In patients who've got PMS symptoms, which also we see very often in patients with PCOS, those patients I like to give omega-3 or even evening primrose oil. So, so it depends on what somebody is really coming with. Inositol's another one, right? So inositol is also great, especially with patients who've got ovulation problem, with metabolic problem, with patients who've got high triglycerides. Inositols help with those. They reduce the triglycerides, they increase the good cholesterol. So they help with the metabolic profile. So there are lots of supplements, but I wouldn't prescribe somebody with like 15 supplements who come to me. Typically, my prescription looks like maybe 3 or 4 at best, but it depends on what they need, depending on individual symptoms. But these supplements, I may have missed 1 or 2, but these supplements are typically the ones that I used. Can't hear you, Nidhi.
Yeah, I'm on mute. Any overrated ones that you would like to mention, or any comments on that?
Overrated. Oh, by the way, I think I missed vitamin B, huh? So that's very important, B and folate.
You said folate and not folic. Can you tell something about that?
Yeah, you can take folic acid, take folate. It's the same thing, really. But B12 is very important because, like I was saying right in the beginning, with metformin, which is the most commonly used medication for PCOS, one of the side effects of metformin is that it reduces B12. So very often they'll come with depleted levels, and that's just because of the use of metformin. So everybody who gets metformin in my clinic will get vitamin B12 as a co-prescription. So that's vitamin B12. Being deficient in B12 will also reduce something called homocysteine. And being low on homocysteine is not, we need homocysteine, low homocysteines for reproductive function and to protect your cardiac health. So these are kind of co-prescriptions that I give. I'm not sure about overrated supplements. I kind of know which supplements I need to give. So I find a lot of these, should we take milk thistle for a cleanse, or should we do, bark flower for stress, or should we do those kind of things? Like, you want to do it. As long as it doesn't have side effects, it's not really going to provide you with any therapeutic benefit. If it's going to help you at a psychological level and not going to give you any side effects, if it's going to make you happy, do it.
And I'm sure everybody's trying to help with lots of natural therapy which is available. So I think that is something that cannot really do what a medicine or a supplement would. So it's always good to try it, but this is what is the basic about.
Give you side effects. So people who use curcumin, people who use cinnamon for insulin resistance, which is very good. You make sure it's good quality cinnamon, it's Ceylonese cinnamon, it doesn't, cause liver damage, those kind of things. Just don't arbitrarily do your homework when you're going to be taking something. You're still ingesting it, right, in your body.
Yes.
The one temp you have with you for life.
Absolutely. With that, we come to our almost last segment before we dive into the Q&A. Would like to ask you, COVID vaccine has had a tremendous effect on periods on women and menstruators. What would be your advice to recover from COVID? I know you've written an amazing book. Do you want to give some highlights and talk about your book as well? How can one reduce the post-vaccine effects? By the way, we have a lot of people in our community who have not taken the vaccine because they're afraid that they might lose their periods. And this is legit and very, very scary. So please, if you could address our audience on that.
That is scary. Oh my God, please. Just take the vaccine. I've been talking about this on every single television channel. Please take the vaccine. It's going to prevent you from getting to hospital. It's going to prevent you from getting the dreaded side effects. And more than anything, it's going to help us get back to normal life by giving us herd immunity. Yes, we see a lot of patients, PCOS or otherwise, who get menstrual problems post-vaccine. But we also see them get menstrual problems post-COVID. So whether you get COVID or whether you get it through the vaccine, you're going to get it one way or the other. It's very difficult to escape both, really, if it continues to be an epidemic. So a pandemic. So please take the vaccine. You're not going to get your period. You can get erratic period. You might skip a period or two. That also largely depends on where you are at when you take the vaccine, how metabolically dysfunctional you are. So I'm trying to see here. Sorry, I was referring to my book, so the bookmark. In my book, COVID and Post-COVID Recovery, I have actually dedicated a chapter which tells you how to prepare for the vaccine so you don't really get the side effects. And more importantly, you build the antibodies. In the book, I also talk about how to get, if you've got COVID, how to recover quickly from it. If you're a long hauler and who've got symptoms after 3 months, after 6 months, like you get copious amounts of hair fall, especially if you're PCOS, skin discolorations, ovulation problems. We talk about all of that. But the important thing in my book, actually, even if I'm sounding like it's not about just COVID. If you want to reverse PCOS, if you want to reverse obesity, you want to reverse diabetes, It's actually a guideline for it all. It's just a handbook, but it gives you the same 5 principles that I speak about. And I just talk about an anti-inflammatory diet, which is so important. So I will tell you what an anti-inflammatory diet is. It's a diet that is high in good quality fat. So don't fear your fats. Like I always say, just make sure the fats come from a good source. It's absolutely no space for processed food, no junk food, no refined sugars. And you eat your complex carbs, which means you eat a fruit, not the fruit juice, but you eat the fruit with the fiber, and you eat your vegetables. And it's a diet with medium amount of protein, not too high. We don't want very high protein because they also come with their side effects, but we want a good amount of protein to build the antibodies to fight against COVID. Or in this case, you need protein to stabilize sugars, so you don't get insulin resistant, so you don't get pre-diabetic, and you don't land up being polycystic. And if you have PCOS, then you reverse it. So that's what it is. So don't fear your fat, consume complex carbs, and eat medium amount of protein. And then, of course, I get into specifics, but that's the gist.
Beautiful, Dr. V. So that was a very intense session, and looks like people have so many questions. We'll try to address most of them, but if not, you know where to catch Dr. V. She's very active on Instagram, and she has a website. You should also get hold of her book if you've not already. And I will get to the questions now. Meghna Gaurav, she says, please talk about the chromium dose.
So it's about 1,000 micrograms, and mostly chromium I give in combination with other things. But if you are taking pure chromium, then it's about 1,000.
Got it. What inositol combination brands available in India? There seem to be barely any to purchase. So here in this segment, our speakers will not be talking about any brands, but we do have our own trusted brands on the sponsor lounge and some great exciting offers. In fact, we have a segment coming up with a supplement, a brand that you can ask your questions, but not in this segment. We talk about brands. There are many different school of thoughts with what time you should soak up vitamin D and for how long. Could you shed light here?
Yeah. So morning sunlight, typically between 10 and 2 p.m. is great. And you need to get about 20 to 30 minutes of sunlight. So look at the shadow. If the shadow is shorter than you, you're actually absorbing the UV. So you're actually absorbing the vitamin D. If you have a shadow that's longer than you, and the sun is far up, and you're not actually absorbing the vitamin D. So just look at your shadow and decide if it's a good time or not, and get about 20 minutes of sunlight a day. I've actually written that in my book too.
That's something that I've heard for the first time. So very, very insightful. What is a parameter to test insulin resistance?
So it's a blood test. You check for insulin. So you do a serum insulin fasting. You do how you do a blood sugar 2 hours after. You check for insulin 2 hours after. And then of course you can do your HbA1c, which is your blood sugar, but it's basically your insulin fasting and your insulin post-lunch. See, the insulin goes up before your blood sugar goes up. So it's actually preventive medicine, which is what I love. So it's you pick up something and you can tell a patient, hey, you know what? Give it a year or two and you're going to be diabetic, or you're heading for PCOS. Let's do something about it now so you don't get there. The real fun is there, where you actually prevent people from getting a disease, and you make them healthy at that point.
That's a lovely way to put through, and thanks for sharing the view on that. Vitamin D3 dosage per day, please. So I think Dr. V just mentioned about the vitamin D3 dosage. Do you want to reiterate again, Dr. V?
Well, vitamin D, A, D, E, and K, these are fat-soluble vitamins, which means you have to estimate and you have to prescribe only after doing a blood test, because if you arbitrarily prescribe them, then you're going to cause toxicity. So you don't want to do that. But 1,000 IU a day is safe for a maintenance, very different from replenishing if you've got a deficiency.
Great. And I think you said that it's easier to do, it's much better to do like a daily supplementation rather than a 60K of what you usually are prescribed.
I am going to give you a 60K. And if you're hugely deficient with single digits, I might even give you 6 lakh like an injection at the clinic. So it depends on where you are. Unlike a vitamin B, which is fat soluble, so it doesn't matter how much you take, you will just pee it off. There's no real side effect.
Okay. There's a space to take 3 more questions. So I'm going to take up what we have not covered so far. Can women who have attained menopause also get PCOD? How do you detect that?
Yes, absolutely. So there's this misnomer that PCOS is from menarche to menopause, which means from the time you get your period to the time you are done with your period. But the fact is that even menopausal women, postmenopausal women also have PCOS. And of course, we see this looking at their blood work. And, we have the Rotterdam criteria of the 3 things. You must have had speakers speaking about it. So it's not that you need to just be obese to have PCOS or just have cysts in ovaries. You have to have cyst in ovaries, you have to have the male pattern kind of, elevated androgens and testosterones, and be overweight if you have, elevated triglycerides. So it's 3 of those 5. And if you have those, then you have PCOS. And the same criteria works even for somebody with menopause. But yes, menopausal women can have PCOS, absolutely.
By the way, our website has some free self-help tools if you like to understand your PCOS better and ask the relevant questions to your doctor. So do check them out if you've not already. Regarding the insulin levels, there's somebody who's asked that my insulin levels are good, but my HOMA-IR still shows insulin resistance. Is that possible?
Yes, it is possible. You need to check it in combination with your blood sugar, with your HbA1c. And if you still think it's not matching, then do a glucose tolerance test, and that will give you the exact answer.
So there is another question which is about emotional well-being, emotional eating. We have a segment with Habit Coach where we are talking everything about emotional well-being. But
good friend of mine. Say hi to Ash.
Great. So this question is actually about chronic fatigue. Do you want to quickly comment on it? And emotional well-being part we'll cover with Ashton, doctor.
Yeah. So CFS, chronic fatigue syndrome. That's actually one more reason I missed why I like magnesium. We very commonly see in PCOS. Also because the energy levels tend to be very low because there is, hormonal fluctuation, and patients also get low and depressed. So it's not just physically being low, it's also mentally and emotionally being low. And that causes these non-specific aches and pains, inability to sleep well at night, daytime somnolence where you're sleeping, you feel fatigued. There's no real true interest to do anything. And there is no known definitive cause in medicine, in allopathic medicine for CFS. I find when you supplement with magnesium, because like I said, it's also a muscle relaxant, and omega-3, which is an anti-inflammatory, over a period of time, these 2 supplements hugely help. Again, with the lifestyle change, that's non-negotiable. But these 2 supplements hugely help with CFS. So try those.
Perfect. And the last question is, kindly shed light on how important breakfast is for PCOS.
So this totally depends on whether you're trying to drop weight, not drop weight, whether you are a candidate for intermittent fasting or not, whether you're somebody with IF who, wants to skip breakfast or skip dinner, what suits your lifestyle. I wish there was a clear-cut answer for this. There really isn't. If you're asking me, do you need to eat breakfast to be healthy? The answer is no. I skip breakfast thrice a week, though I'm a breakfast person. But I just skip it because I have I eat relatively late. I go out a couple of times a week. So something has to, balance out in life. So you don't need to have breakfast if that's what you're asking me. And if you're asking me for PCOS, then you need to figure out whether not having breakfast suits you or not, because not having breakfast very often will help you drop the weight, which more often than not is required for PCOS.
It's amazing. Thank you, Dr. V, for answering patiently so many questions. There is a lineup of more questions which are targeted towards intermittent fasting, keto, which already you said that it totally depends on what your case is. So if you've missed any part of this session, please do look at the recording, or you can also reach out to Dr. V for any consultations. If your question is about exercises, we do have those sessions lined up today in the rest part of our agenda. So do have a look on our agenda on the auditorium. If you have any questions, you can reach out to the help desk. And do check out Dr. V's book on COVID recovery, which is a 6-point plan to recover from COVID and prepping up for your vaccine. I hope, Dr. V, we could do justice to your time. And it was truly, truly an informational session. Thank you so much for your time. And thanks, Amit, for also waiting patiently on the lobby. I'll just bring you in. But Dr. V, thank you so much again. And I hope and wish you more and more success with the lovely work that you've been doing. I hope more people can get inspired by your way of working towards PCOS and other chronic condition treatments.
Thank you. Thank you for having me, Nidhi. And thank you for the great work that you are doing and helping out, hundreds and thousands of people. So we're all in it together, and more success to you. And hi, Amit. Good to see you after years. Okay. All right. I'm going to log out, but more power to the rest of the 2 days.
Thank you so much, Dr. V. Have a good day.
Bye. Bye.
Alipriya, over to you. Alipriya, are you there?
Hi, Nidhi. Am I audible?
Yes, you are very much.
Fantastic.
Great. So don't want to hold this session. Our MC is facing a bit of network issues in Kolkata, so I will take forward with this segment. There were a lot of questions in the previous segment where we talked about supplements, and thank you so much for supporting our segment on Dr. V's non-pharmaceutical ways of managing PCOS. Everybody who has questions about supplements, Amit is the guy. We're going to ask him about how he has been successful creating the most trusted supplement brand in India, which is plant-based. And he will talk more and more about what are the additives and what are the other formulations the additives that are present in the supplements that we can avoid, and what are the formulations that he's been working specifically for PCOS. So Amit, I would like you to give a small introduction about Univate. When did you start it, and what is your vision and goal when you were creating this trusted supplement brand in India?
Sure. Yeah. First of all, thank you for organizing this summit. I think it's been long overdue. Finally, we have someone to create a platform for PCOS and bring all the stakeholders and people who are undergoing PCOS together. So thank you for doing this, and thank you again, Dr. Vishaka, for your words. Nice to see you and hear from you after many years. I think the last time I met Doctor was 2013 or 14. So it's very nice to see that she is still so involved and one of the leaders in this space. Coming to Univad, we started in 2010, and we started as a vegan supplement company with the goal of researching and manufacturing plant-based products, offering plant-based alternatives to conventional supplements, and also trying to ensure that we adequately dose every product. There's a lot of supplements and a lot of brands that have long lists of ingredients. However, the quantities used in the products are very minuscule, and they don't really offer the benefits associated with the ingredients. For example, we see a lot of multivitamins that contain DHA, but only at 20 and 30 milligrams of DHA. Whereas we know that you need 250 to 400 milligrams of DHA to really experience the benefits associated with that. So one of the things that we've always done, and we continue to do with our products, with our formulations, and with our work, is to ensure that first and foremost, we maintain the integrity of the formulation. We maintain a mode of action in the architecture of the formulation, and we offer clinically validated ingredients in the dose that is required, not underdose the product just to include the ingredient on the list so we can make a marketing claim. So that was the intention, and that's the kind of work that we've been doing for the last 10 years. Hi, Nidhi. I see that you're back.
Yes, that's amazing, Amit. And one of the things that I wanted to also talk about, uh, there are a lot of supplements in the market, and it becomes, as a community, as myself, as a person who's dealing with a chronic condition, and so many others with us, it's always a battle finding the right supplement. There are a couple of supplements which are just a marketing gimmick, and you would see in the ingredients some of the additives which are really doing the opposite. Could you name any of them, without obviously naming a brand, but any of the additives that one could look out for while they're purchasing their supplements, especially like omega-3s, or any multivitamin that you see, binding agents? I don't know. I'm just curious to know.
Sure. Yeah. So with multivitamins, they're generally capsules. And the kind of additives that we see a lot of companies using in capsule-based products are magnesium stearate or stearic acid, silicon dioxide, titanium dioxide, and you will generally find these ingredients listed towards the end of the ingredient list on the label because they're in the smallest quantities, but they are added either as a filler to make up the empty space in the capsule, or they're added to make the powder a little more free flowing, which helps during production of the product. We don't use any of these fillers. We don't use any of these, unnecessary ingredients which don't really carry any nutritional value. You also mentioned omega-3s. A lot of the omega-3 that is in the market is fish oil based. And when we talk about fish oil, we know that it is in a soft gel. Soft gels, of course, are made of gelatin, so it's full of animal product. They use carrageenan in those products. They use coloring agents to ensure that batch after batch, the color of the soft gel remains the same. So these are things that brands follow or companies follow or are generally prevalent in the industry. And yeah, it's not true that every single company or every brand does it. There are a lot of clean label products and clean label brands. I think consumers now should be aware and read through the ingredient list on the labels to really identify this.
Sure. And why do you have a plant-based omega? Why not the fish oil?
So for us, the decision was, really simple. We're a vegan company, so by default, we wouldn't touch any animal-based product. But keeping the entire veganism piece aside, we really need to understand that the primary source of DHA is not fish. Fish don't produce DHA. Fish gain or get DHA through their diet because they're eating smaller fish, and the smaller fish are feeding on marine algae. Marine algae is really the primary source of DHA. So as a company and also as a consumer, why would you want to go to a tertiary source when you have the ability to go to a primary source? Why would you not consume DHA right from a plant, which is the primary source which produces DHA? So yeah, since 2012, that's when we launched our DHA in 2012. We launched with a 40% concentration, which at that time was the highest available concentration. And now, I believe a year ago, we've been able to increase that to a 50% DHA concentration, which again is currently the highest DHA concentration available across brands in India as far as vegan, algae-based, oil-based DHA is concerned. Another important thing to note is a lot of products use DHA powder or omega-3 powder. And it's a little bit of a labeling trick, because when you use DHA powder and you add, say, 100 milligrams of that powder in a capsule, a lot of companies write DHA powder 100 milligrams. So as a consumer, when you read that, you sort of understand that it's 100 mg of DHA which you're getting, right? However, that's absolutely not true. The highest concentration of DHA in a powder is at 10%. So when you add 100 milligrams of DHA powder, you're really getting 10 mg of pure DHA. So these are things that go on in the industry. Very few brands will write 100 mg DHA powder and then as a subset under that, of which DHA 10 milligrams. Very few companies will write that, right? Because they don't want to write that, because as a consumer, if you see that, you're not going to buy the product. So please look out for elemental values of every ingredient. And if you don't find elemental values of every ingredient on the label for whichever company, please reach out to them and ask them. You know, you guys are adding 100 mg of this. It could be zinc, it could be DHA, it could be coenzyme Q10, it could be curcumin. You get 95% concentration of curcumin, and you also get 20% concentration of curcumin, right? So if I'm adding 500 mg, but if I'm using 20% versus 95%, that's a huge difference to the consumer. These are things we should be aware of.
That is truly insightful and very, very surprising and shocking, because we as a person who's trying to take care of our health, we're looking for a supplement brand which is easy on pocket. Most of the times, I'll be very honest, we look out for and we, as I say, I'm representing the community and the conversations we have on our support groups. So we look for something which is affordable. We look for something which is, doable with what I earn every month. And at the side, we have all of this going on, where you have a lot of people trying to be a marketing gimmick while not being very honest, as you already said. So I think it is very, very challenging to find a true and honest brand. I do know that we have you because you were talking about your brand, because it's only that we've seen your work and research come out very honest. And some, if it is something that you will truly get, which is honest product, I don't mind investing in my health. So this is the whole intention, to bring you on board and talk about, and it's not only about Uniwave, it's about whenever you are making a choice. So I just want to put this out there before we, get ahead in our conversation. So that's very, very insightful, Amit. Thanks for sharing. Now, next conversation I wanted to do about inositol. In fact, we have questions from the audience where some people said that why do we not see a powder format of inositols in Uniwave, where it is something that we see usually now happening in the market. Do you want to share something about your formulations, first of all? What formulations do you have with inositol? What are those different products? And then we'll come on to questions from the audience.
Sure. So as far as our inositol products are concerned, we have two formulations. One is PCOS management, which is a 40:1 ratio of myo is to dechironinositol. And the other is PCOS fertility, which is formulated specifically for women with PCOS who are trying to conceive at the moment. Right? So not everyone with PCOS is really trying to conceive. You could be in your early 20s and conceiving may not be very important for you at this moment. So that's when you go into a 40:1 ratio, which is again clinically proven, validated to help manage a lot of PCOS symptoms. But for other women where they do have PCOS, but conceiving is something very critical to them because of maybe the age or the stage of life that they're in, we have a 3.6:1 ratio, which again is a clinically validated ratio, shown to have a 3x higher chance of a successful pregnancy, a higher chance of higher live birth rates, so very low miscarriage. And this is all through clinical trials and clinically validated as far as the ratios are concerned. So these are the two products that we have. To answer your question on why we don't have a powder-based product, we get that request a lot from a lot of our customers. We are working on it. But what we found so far is the inositols are not easily water soluble and dispersible, right? They tend to float a little bit, and it doesn't really give a good mouthfeel when you're consuming the product. And that's really important. Again, people want a good formulation, but they want it to taste good. They want it to, if it's not going to taste good, they are not going to consume it. So we're working on it. I can't promise, but hopefully in a couple of months we should have a solution.
Well, I wish you all the very best, and I'm sure there'll be a huge hit when you obviously launch that. Uh, but do you want to also share how inositols are manufactured? There's so much buzz around inositol. What are these inositols? How is it manufactured, and how do you do it differently as a clean brand?
Right. So it's myoinositol and dechiroinositol. You can get them synthetically. What we do is, the myoinositol is sourced from corn, but I would say the hero ingredient in our formulation is the dechiroinositol, because the dechiro that we use is a natural dechiro, which is produced through a patented water-based, aqueous-based extraction process, and it is sourced from the bark of a tree called the carob tree from Europe. So we launched the product with this dechiroinositol. This specific dechiroinositol is in both the formulations, the management as well as the fertility formulation, and it's been giving excellent results. All the people who use the product, most of them are seeing results within, early results within, I would say, 25 to 30 days. Again, results will vary person to person, severity to severity, but the kind of feedback that we receive is by day 25, 26, 27, they start seeing a change in emotional well-being, emotional health, and then one by one symptoms start getting addressed. We have a lot of feedback from customers on the fertility product. Some of them have conceived. So it's, when we get those emails saying, hey guys, I've been using this for 2 months and guess what, I am pregnant. It's like a wow day in the office. We try and celebrate because that's the end result of all the work, right? And
That
it's
is
not me, it's the team. I'm blessed because we have an excellent team. Amay, Namra, and everyone else at the company. They put in a lot of work and a lot of research and a lot of reading behind the ingredients and behind the architecture of the product, because at the end of the day, we want people to get the results. And
that's
again, it's not that our product will give the result to everyone. There are a lot of other brands as well that have good products, but supplements alone, like Dr. Vishaka said as well, supplements alone will not do the trick. You have to look at your diet, you have to look at your exercise, and then the supplement really becomes a complement, and it starts complementing all the other efforts that you're putting into your day with your food and your lifestyle choices, and then you start seeing results.
And I think what your tagline says, like inspired by nature and based on research. I don't see many brands talking about research who's truly invested in their research. So kudos to you that through you we are also able to get access to all the research. That's great work, Amit. And apart from the inositols, I think something that we have recommended, and there are people who are using your plant-based proteins as well, which are fiber rich. So I like how you've sort of put together the super greens and protein, because a lot of people with PCOS have gut issues while taking proteins, and there have been a lot of conversations this morning about protein and protein powders. What do you have to say about that? What does the research say? Like PCOS and proteins go really well. There are a lot of people who say that you shouldn't take supplements, but if so, there is a requirement of supplement with proteins. How has that worked along in your response with the community that you've been selling that?
Yeah, I mean, we do have a lot of customers who do use the proteins. We do not have a PCOS specific protein formulation as a product meant only for people with PCOS. But when you talk about co-supplementing with additional nutritional products apart from your standard inositols, we see a lot of people using the vitamin D3. We use a plant-based vitamin D3. We see a lot of people using the DHA. We see few people using the zincs. Again, Dr. Vishaka also spoke about zinc. So yes, there are cofactors and co-nutrients that will play a role and that will support the hero product, which is your inositol product. And again, all of this can be put together by an expert or by a nutritionist. If you're in doubt, please go to someone like Dr. Vishaka so that she can study your case, go through your levels, and then really put the nutritional regimen together, which suits you at the stage where you are and with the goals that you have. But yes, core supplementation, cofactors, core nutrition, along with the main product, always gives better results.
Super.
Also, the magnesium, I forgot to mention, we have a Aquamin marine magnesium sourced from seawater, 300 mg per scoop. You just put it in a glass of water, drink it at night. Gives you, you sleep like a baby, puts you to sleep, and does so many wonderful things in your body. So, yeah.
Thanks for reminding, Amit. I think that is super, super helpful. Magnesium is definitely really, really helpful with dealing with PCOS. Especially a lot of people have sleep issues, so that'll be helpful. And by the way, Univate is running a special offer for the summit and for this month. So go on to the sponsor lounge and you'll find exciting offers, the code that you can use, the socials of Univate, their website, everything is there. So if you want more information, you can head on to the sponsor lounge. And if you have any question, you can go on to the help desk. Amit, two more questions and we go into the next segment. How long can one take inositols?
I mean, I think Dr. Vishaka would be better placed to answer that. From our experience, we have people who've been, so we launched the product in November and we have November 2020, and we do have people who've been using it since the very first month of launch. So I think I mean, of course, the research says that yes, it is safe to continue using inositols for as long as you need. However, as with any supplement, we always say it's good to give your body a washout every maybe 4 to 6 months. Just do a 2-week washout, no matter which supplement you're taking. Of course, it's different if it's a D3 and a B12, but when you talk about things other than that, it's always good to do a washout. But inositols are safe. I believe the upper limit is 12 grams a day. So up to 12 grams a day is proven to be safe. Above that, you will start seeing things like experiencing things like dizziness and nausea, maybe a little bit of vomiting. But of course, that's at 12 grams. Our products are nowhere near that, right? So when you talk about 2 grams and 3 grams a day, absolutely safe.
That's super. And I think it all depends on what your health profile requires and what is the combination. There are a lot of formulations which are included with folate and vitamin D. So you have to check out what works for you. But I hope that could answer your question. Last question is, are Univate, this is by Neha. She says, are Univate products approved by FDA or an equivalent authority in India? I believe she's joining from outside India.
Sure. So it's important to understand that the dietary supplement or the nutraceutical industry is not governed by the FDA. In India and across the world, even in the US or in Europe, the FDA really doesn't govern the industry. What we fall under is FSSAI. And yes, FSSAI, I mean, anyone who's in the business does have to have a manufacturing license, which is issued by FSSAI. We do have to comply with all their norms. We do undergo audits by them. We do submit returns to them on just the same way you do tax returns. FSSAI has a very different format of returns and we submit returns to them. So yes, we are governed by FSSAI, which is under the FDA, but we don't produce drugs. We're not a drug manufacturer, so we don't fall directly under the FDA.
Great, super. So Amit, with that, we'll have to take your leave and we'll have to move on to the next segment. It was very, very informational, by the way, and thanks for taking time and thanks for supporting our mission with your whole heart, because I've seen how truly passionate you are about driving change and how we're doing similar things, bringing change into our communities. So good luck with that. And I hope you reach more milestones with the fantastic initiative that you have of doing clean supplements and being the most trusted supplement brand. Again, people, we have an exciting offer coming up. We have running right now, and you can go into the sponsor lounge and find more details on Univate and their offers. Thanks, Amit. Thanks again, Amit, and hope you have a beautiful day.
Thank you so much, Nidhi. Good luck with the rest of the summit, and thank you everyone for tuning in. Have a good afternoon.
So everybody, we'll take a 5-minute break and we're waiting for the next segment to start. So we are exactly going to start in 5 minutes from now. Till then, if you want to take a break, take a water break, do so, and we'll be back. Dimple, we start in 3 minutes exactly.
All right, perfect. So there are some ads going on, right? Which I was correct about.
Sorry?
The live stream right now is showing a couple of ads, right? It's a break.
Yeah, so it's a break. So that was the auditorium that you were in. So we have to go in the, sorry, you were in the lobby area. You have to enter the auditorium to see the presentation.
Ah, okay. All right. Well done, Nidhi. It looks amazing, by the way.
Thank you so much. Thanks a lot.
Very nicely done. I love how professionally it has been handled. And in fact, your email, I must appreciate you guys. So well researched on the language, on, making sure that there's no conflict between speakers. Very good instructions.
Thank you so much, Dimple. Thanks a lot. You're being live streamed right now. So we've just taken 2 minutes of break and then we'll dive into the conversation. I know we lost like 5 minutes. We'll try to make it up.
No worries. I've anyway scheduled my next appointment at 3:30. So. This will be recorded, right, Nidhi?
Yes, Dimple, this is being recorded.
Okay.
Are we ready to start, Dimple?
Yeah, all good.
Hello.
Nice.
Thank you. You too. Welcome, Dimple. Welcome to the first ever PCOS Summit. This is a 2-day virtual event that we've been doing, and it's been some great lineup that has happened in the morning. If you guys are joining fresh and you have joined just today or at this segment, do have a look at the recordings later. You will have access to recordings after the event as well. So look out for our email. Don't get panicked because it's a long event, so it might take some time to upload. So you can always reach out to us if you have any questions. The help desk is right at the bottom. The agenda is right at the left. And if you have any questions, it's right on your screens where you can share your questions. Welcome, Dimple. Very warm welcome. Dimple will be talking about managing PCOS and thyroid and taking care of your gut, supported by Ayurveda science. And this segment is supported by One Herb. One Herb is India's leading brand, bringing herbs which are very less spoken about, but have been there in our Indian lifestyle since ever long. There's a very well-researched team who's working to bring herbs such as red clover and yarrow leaves. Never heard about these herbs before, but they have been in our country for really long. So it is led by Shraddha and her husband Amit, who's doing some great work to bring all these herbs together and in the Indian market accessible. For more information, you can go on the sponsor lounge to get more details on their socials website. Amazing offers that they're running. One Herb is a subset of the Indian chai, which we all know about. We're doing some great work in the PCOS segment. Moving on to Dimple, who's done some amazing work recently being an Ayurvedic health coach. She's founder of Prana Healthcare Center and Prana Academy for Ayurvedic Life Sciences with Jane Online. She has been awarded Times Brand Icon 2021 for Ayurveda Health Coach, Gut Health Experts, 40 Most Coveted Under 40 by the Indian Achievers Club, Digital Women Entrepreneur Award for COVID Impact category by the She the People Digital TV, Google and Colors. The list of her awards are endless, and she's been the most trusted healthcare award as well, has treated over 2,500 plus patients from over 49 countries, and has introduced Ayurveda to 2,300 plus students from 56 countries. She has represented India at Ayurveda's Days Conference by Consulate General of India and Germany. That's a big achievement, Dimple, and many congratulations. And she is featured in 50 plus publications and has coached the likes of Juhi Chawla, Anjali Tendulkar, Keki Mistry, and many other celebrities who have been inspired by our work. So very warm welcome, Dimple, and we're going to ask you questions on PCOS and thyroid and importance of Ayurveda when we're trying to deal with a chronic condition.
Absolutely. I'm so glad to be here. And Hari, congratulations to the PCOS club and the entire team. Nidhi, fantastic job spearheading this operation, from the top. And I understand that you've actually built this platform out of personal experience, having struggled with gynecological imbalances and disorders, not calling it a disease, but you've actually battled it and you've come out like shining bright. And now you're trying to inspire all of the women up there who are struggling with this to overcome it. Now, the statistics are baffling, right? 1 out of 6 or 1 out of 7 women in India are actually diagnosed with several gynecological disorders like either PCOS or PCOD or infertility or, some kind of bleeding disorders or menstrual health issues, ovarian disorders, cysts. It's become very common now, fibroids. In fact, even I had fibroids many years ago when I did not even know Ayurveda as a science. And I've been able to clear all of it just through healthy living and lifestyle, right? Now, how does Ayurveda play a role here? It's very powerful science. It's 5,000 years old, and our goal has been to revive the science for the younger generations because there is a missing link during the British era. Of course, the link was broken and the colleges were all shut down. So our parents actually don't seem to practice Ayurveda. Our grandparents did practice Ayurveda. Our great-grandparents did practice Ayurveda. So because of that missing link, most of us haven't received the information on how to prevent diseases at home using food. So that's what I specialize in, and I'm going to share with you guys on how you can use food to treat all kinds of gynecological hormonal imbalances in the body. Now, let's first understand whether it's PCOS or PCOD, whatever it is being diagnosed as, because modern science doesn't differentiate between the two. Let's first understand how is it caused. Now, your body creates estrogen. A woman's body creates estrogen every month, right? But if the body is unable to digest the estrogen it is creating, then that undigested estrogen starts creating problems in the uterus, in the ovaries, in the fallopian tubes, and in all female hormonal areas, including breasts and uterus. If you're unable to digest estrogen of your own body, created by your own body, then it leads to gynecological disorders. Indigestion of food leads to stomach-related disorders. Indigestion of thoughts leads to anxiety, stress, and depression, right? So it's a very simple logic. Indigestion of estrogen leads to these disorders. What do we do when we are unable to break down the estrogen from our own body? You must support it with food groups that allow you to break it down faster. You need external help. You need to process the food outside of your body and then consume it. When I say process, it means cooked, steamed, mixed together in right proportion so that the right nutrients for the nutrients is provided. We need vitamin C and vitamin D to boost metabolism and immunity. We need iron and B12 to boost the uterus health. How do we get this and what food groups can we get this from? This is where we come. Now, let's start with the don't list. The don't list is very interesting. In Ayurveda, PCOS, PCOD of gynecological disorders is of the uterus, and the uterus is where all 3 doshas are predominant: Kapha, Pitta, and Vata. So you could have a skinny PCOS, PCOD or a fat PCOS, PCOD. You could be putting on weight aggressively, you could be losing weight aggressively. Okay, so you could oscillate between any ends and extremes. You could also be a Pitta Prakriti or a mesomorph body type, where you tend to put on weight quickly and lose weight quickly. All right. Now, besides that, what is thyroid? Why is it connected here? When the uterus gets affected, it starts causing a lot of hormonal imbalances, and the thyroid hormone gets mixed messages from the pituitary gland, and then it blows out of control. It leads to hypothyroidism or hyperthyroidism, and both are sometimes very common in women together at the same time. They get triggered by each other. Now, the food groups that I'm advising, by the way, are very good for both thyroid and gynecological disorders. It is not conflicting in nature, so you can be rest assured if you have either of these symptoms or these symptoms, you still have the same food groups to diet on. Let's start with the don't list. The don't list is something that I'm very passionately, campaigning, and Nidhi knows about it, and Nidhi has been campaigning too in so many of her posts. If you can't digest the estrogen of your own body, please don't consume estrogen from another animal. Your body cannot deal with alien estrogen elements in the body. So that means cutting out meat products completely. Meat products have both estrogen and testosterone. Lots of hormones in it. You cannot remove the hormone from an animal. It also has a lot of cortisol and stress and anxiety of that animal stored in its body in the form of cortisol, which triggers hormonal imbalances and interferes with the brain and the pituitary gland, which is trying to send you messages. The animal has complex memories stored in its body. And for your body to break down those complex memories and then be able to digest that food is a 72-hour process. Meat spends 24 hours in the stomach, 24 hours in the small intestine, 24 hours in the large intestine for digestion, absorption, and assimilation before it is ready for elimination. It takes 3 days for it to come out of your body. And in that meantime, it starts impairing the gut lining, which is a small intestine, large intestine, and colon. It starts rupturing the gut lining because these foods are dead, difficult to digest, and they cannot be broken down very quickly. You need some acidic saliva for it, like the one that cannibals or carnival animals like tigers and lions have. We don't have that. So it takes a very long time for us to break it down. What happens? The gut lining gets, excuse me, the gut lining gets ruptured and the food starts leaking in the bloodstream, causing toxic blood. And the blood is now carrying all these undigested food, heavy metals, toxins, and diseases from that animal, by the way, into different organs like heart, liver, kidney, intestines, gallbladder, colon. And if the colon is affected and the gut is affected, the uterus, my dear, is a next door neighbor. It's sitting right next to the gut. And this is my favorite quote. The colon and the uterus are like neighborhood aunties. They love gossiping. Aapke ghar mein kya bana hai? They love gossiping and knowing what's happening in each other's house. So if there's something wrong with the colon, the uterus cannot function properly because the toxins from the colon will get absorbed by the uterus. There's a very thin lining. There's no steel wall or a brick wall that separates these two organs, right? So they start absorbing toxins from each other, and the ovaries are now beginning to malfunction with so much misconduct and misinformation from other toxins that are interfering. Right? So do not have red meat, do not have white meat, do not have seafood that has high levels of mercury nowadays because of the ocean level pollution, and do not have eggs. There are a lot of misconceptions out there. People consume a lot of eggs thinking it'll fix their eggs. I'm sorry, your eggs are malfunctioning. You can't take the eggs from another animal hoping it'll fix your eggs. A chicken's egg is not going to fix a human egg. Doesn't work that way. It's an easy source of protein, but again, by the ways, eggs are linked to long-term constipation because it's a very difficult, hard to break down protein because it's alive. And that protein is the first source of life. So that protein is not easy to break down. It causes constipation in the long run and also irritates your estrogen levels. Do not consume, next product, if you've come so far to become a vegetarian, one step further, because I've seen miracles happen when diets of these types have been followed by my patients. And I'll tell you some of the success stories from the recent days. The next step is do not consume milk and products that come from a factory. Unfortunately, in this given day and age, what has happened is, I'm just going to switch off the video for just 1 second while I plug in. Excuse me. Sincere apologies for this. Just reconnecting. And I am back. All right, I hope you guys can see me and hear me clearly. I'm so sorry, I just needed to reconnect to the electric point so that I could continue with the summit. Now, coming to milk, why do we not consume milk and products that come from a factory? Listen, you were not born in a factory. You were born in the womb of Mother Nature. So you must not consume foods that are manufactured inside a factory with human intervention. Cows used to be raised on farmlands by farmers, fed with the hand. And when they were fed with the hand, the cows would lick the palm of the farmer and would get pheromones. Pheromones are signals from the farmer's brain, released through his sweat and through his, aura and through his smell. The cow licks the palm and knows exactly what nutritional deficiencies his master has. And it actually reformulates its milk based on the deficiencies of his owner. Unfortunately, now we have a disconnect between us and the cows. In fact, mothers, human mothers, when they're feeding the child, they smell the pheromones from the child's brain, and that message goes to the brain and then goes to the breast factory, telling the mother what kind of a formulation of milk to produce today. Did you know the milk from a mother for 2 different children are same, for 2 different children are different, and for the same child on 2 different days are different? It's never the same. The formulation keeps changing. Imagine a newborn fetus, a newborn child from this small can grow up to like this big using just mother's milk. How's that possible? right? It's possible. So do not consume milk if it's come from a factory, because if the cow has been confined and tortured and, what do you call, slaughtered, and, and its calves have been slaughtered and deprived of milk, the cow releases a lot of stress into the milk, a lot of pus and blood and hormones. The cows have been injected by estrogen and fertility drugs to make it give birth every year, which ruptures the uterus and can be cancerous for the cow. And all that antibiotics and drugs and steroids that the cow has been injected, where does it go? It goes into the milk. So don't consume any dairy product unless you know the cow don't drink the milk. There's a very old saying in Indonesia: if you know the cow, drink the milk. If you know the cow has been treated well, if the cow lives in your house, even better, because it actually boosts your immunity, by the ways. The dust that the cows release actually helps in boosting immunity. But until then, if it is coming from a factory, do not touch it, especially the Tetra Pak based milk. They're literally coated with estrogen. Please do not consume it. I have been through a phase of consuming foods from Tetra Paks in the beginning of my career, and I can tell you it really did affect my health and led to fibroids. The minute I left animal-based products like milk and yogurt and buttermilk and paneer and cheese for some time, my body fixed itself magically. We in fact have a patient from New Zealand who came to us saying she was scheduled for a 4th surgery for cysts. We prepared a diet plan. We didn't hear back from her. 2 months later, she wrote back to us saying that her 4th surgery went successfully, but she's in excruciating pain and cannot even get out of bed. And they've scheduled her for the 5th surgery, April and June. And I was like, oh my God, when's the surgery? She's like, 2 weeks from now. I was like, okay, let's give it our best shot. We couldn't send the medicines to New Zealand at that point in time because of, the lockdown situation. The government was returning all the couriers. We put our faith in the Ayurvedic diet and we did a food fasting for 3 days. She could barely get out of bed, mark my words. 3 days of chronic pain, she could barely get out of bed. We put her on a fruit fast, first to flush out all the waste from the small and the large intestine and the colon. We gave her fruits and vegetables that are suitable for the uterus only. After the 3-day fruit fasting, she went on a 2-week diet, which was purely for her uterus and cyst. When she went to the doctor said the cyst has started healing itself and canceled the surgery in 2 weeks with just food. 2 weeks later, another test, the cyst had completely dissolved.
So, Dimple, I have a quick question here. So, we are in this conversation, say we're talking about our hormonal health. Now, somebody who does not understand Ayurveda, right? What are the so you talked about the diet and everything. How do you first understand that you have thyroid? What are the smaller steps towards making these changes? Could you also highlight that? Or maybe a sustainable lifestyle change, what would that be for somebody who has both these conditions?
Right. Now, how do you first identify if you have these conditions, right? If you start experiencing symptoms like, constipation, diarrhea, irritable bowel syndrome, these are the first signs that the body is malfunctioning. The colon is the first sign that something is wrong in the body. If you have unexplained weight gain or unexplained weight loss, even though you're having the same diet and the same kind of food that you've been eating for many days, and if you're having sudden mood swings, irritability, malnutrition, sudden hair loss, or loss in texture and the color, or the smoothness and the brightness of your skin, and you suddenly start showing pigmentation. Now, ideally, the face is a visual map of what's happening inside the body. It's a visual representation. If you start having imbalances and disorders in this chin area, especially, it could be hair growth, hirsutism, it could be pimples, acne, whiteheads, blackheads, or pimples in the lower part of the chin, then that means the uterus needs attention. If it's on the top part of your cheek, it's your stomach. If it's the lower part of your cheek, it's your lungs, and so on, right? Now, usually, the symptoms start like this, and then you must definitely go to an Ayurvedic doctor or an allopathy doctor, whoever you place your faith on, to first get yourself diagnosed. Are you suffering from any kind of an imbalance? Ayurveda defines health as a state of balance. When you're comfortable with your physical body, mental body, emotional body, it's called healthy. But if you're in a state of imbalance in any of these levels, it is a state of imbalance and state of disease. Disease means not at ease. So that's how you find out. Now, what are the lifestyle changes we can do? For both thyroid and PCOS, we do not recommend dairy products at all. So milk, yogurt, buttermilk, paneer, cheese is out of the picture. The one product we do recommend is ghee. Now, ghee is clarified butter, which has gone through several processes before becoming ghee, and it has left the milk solids behind. So it doesn't have the milk solids and it doesn't have the estrogen interference in it. Ghee is one of the very few ingredients like moringa that can pull heavy metals out of your body and aid in the detoxification process. It also lubricates your GI tract right from your mouth to your stomach, to your intestines, to your colon, allowing smooth elimination of waste. You need to lubricate your intestines from inside, and oil cannot do that as much or as well as ghee can. So you can take half teaspoon or 1 teaspoon of A2 organic cow's milk ghee, if you're in India, sourced from a cruelty-free happy cows farm. These are some restrictions. Put it in half glass of warm water and drink it in the morning, empty stomach. It'll help in detoxification process. There are some more foods that are extremely rich in iron and B12.
I think we lost Dimple, so we'll just take a moment for her to be back. Sorry about the inconvenience. And she is back.
Can you hear me?
Yes.
Apologies, I think I just got locked out for a second. Now, coming to the foods that are rich in iron and B12, these are the foods that will support your uterus. Remember, your body has a self-healing mechanism. It heals itself. It creates new cells every 4 seconds. You don't remind your heart to beat. You don't remind your uterus to create periods or, release blood, right? It's doing everything on its own. We need to support the process. How do we support it? Now, the body needs iron levels to generate RBC, red blood cells. And especially for a woman, during periods, you'll notice your hemoglobin levels start dropping a little bit, right? Because we lose a lot of blood and our RBC count comes down, and then it leads to hair loss and pimples and acne or whiteheads and blackheads in the skin, because the body is now using up all the iron levels to rebuild RBC, right? So now how do we consume iron? There are some foods that support the uterus like carrot, beetroot, spinach, celery, cilantro, curry leaves, moringa, fenugreek, that fresh methi, and then, of course, the spices like fenugreek and ajwain. These are the 10 vegetables and spices I'm recommending to you. Any fruit and vegetable that's red, yellow, green in color is your go-to vegetable and fruit. Okay, so in fruits, pomegranate and black grapes are essential in your diet every single day. So this is what I recommend to my patients. Having a big bowl of carrot, beetroot, spinach soup with moringa powder every day for dinner, compulsory for 21 to 28 days cycle, and see the difference in your next period. Having a bowl of steamed carrots and beetroots just before lunch, compulsory every single day. See the difference in the texture of your hair, and that's a sign that you're recovering from PCOS, PCOD, right? Having a glass of pomegranate juice or black grape juice, or having it in the raw fruit form, is actually better than having it in the juice form. Will dramatically improve your blood circulation, allowing fresh oxygen and fresh RBCB to taken to the uterus to heal the damaged tissues, muscles, and nerves. Having spices like ajwain and methi also stimulates the estrogen level to be digested faster in the uterus. You can also have moringa, excellent source of B12, excellent source of iron. It's in fact a superfood. You must also ensure to have shatavari in your diet. Shatavari is a beautiful herb. I think one herb definitely has a shatavari product. I was just going through the products for women. Excellent collection. Congratulations on that. Shatavari root is basically an amazing root that helps in reducing pitta imbalance in women and men. And especially for women, it helps in stimulating the uterus recovery and healing process. You can have it in the powder form. You can have it in the gridam form, which is ghee. You can have it in honey. You can just take shatavari powder, mix it in honey and have. That's also excellent. You can mix it with ghee and have. Even that's an excellent way of having. You can have like about 5 grams, don't overdo anything, 5 milligrams, I would say, in the morning and again in the evening, and see the improvement in your health. And replace cow's milk with almond milk. See the texture of your skin and hair improve. You'll thank me later for not having to visit a dermatologist or buy expensive products for your skin.
That's some great advice, and I think what you mentioned is a diet which is more based on foods which are high in antioxidants. They are fresh and wholesome in terms of they're plant-based. So something that we've been hearing since morning, and an affirmation that a diet has to be more towards the plant-based diet. Anything for thyroid that you feel works great in terms of coming from the Ayurveda practice? any special treatments? Of course, this is something that one has to come and get assessed. Do you recommend any treatments as well in your clinic?
Yes, yes. So there are two ways of doing it. If you have access to my clinic in Bandra, Bombay, you're most welcome to come. If you have access to any other Ayurveda clinic also, you can do that. There's a treatment called Panchakarma treatment. Panchakarma is basically a 5,000-year practice. 5 actions. It basically means 5 actions, 5 ways of removing toxins out of the body. You must flush out the toxins out of your body once every year at least through the Panchakarma process. So there is no buildup of toxins and causing long-term organ damage or aging process. It literally reverses aging process. It knocks 15 years of your aging process, and people can actually become 20, 30 years younger by doing this every single year. There is vomiting, which is called Vaman. You don't have to do that. That's only done for kapha imbalance, someone who has too much mucus or phlegm in the bronchial region or the chest region. There is Birachinam oral medication. You might also be given ghee to consume for the first 10 days, starting from 10 ml to 100 ml. In your case, it could be Shatavari Rhythm to recover from PCOS. Then we have Raktamokshan, bloodletting. It's only done for skin disorders like alopecia and vitiligo, where there is a ringworm infection. And then there is, of course, the Nasim treatment, where we introduce medicine through the nose. Now, see the beauty of it. There are patients who come to us with gynecological disorders and imbalances that leads to lack of sleep and mood swings and irritability and dysfunctional period cycle. Introducing medicine through the nose actually fixes it. And how? When we introduce medicine through the nose, we obviously massage the sinus glands, steam it, do hot fermentation and release the sinus, and then introduce medicine here, which stimulates 20 nerve fibers that are here between the nose bridge and the skull, where there is no bone, by the way. There's a point here where there is no bone. You cannot feel it, but there's no bone there. There are 20 nerve fibers here that directly connects to the pituitary gland. So when we introduce medicine here, just 1 drop to 6 drops, it stimulates those nerves and sends messages to the pituitary gland, which, by the way, is in today's day and age is highly fluoridated. Fluoride in the water has caused the pituitary gland to literally turn white in color instead of being pink. And pituitary gland is where your strategic, reasoning, logical abilities come from. And it sends messages to all your organs, especially the uterus. It tells the uterus how much hormones, how much estrogen, testosterone to release. Now, pituitary gland, the microchip processor is not functioning. You cannot uterus from malfunction. So nothing from the pituitary gland, and thus helps the uterus. And people have seen magical benefit in the skin. It's the best facial. Can you imagine introducing medicine through the nose reduces dark circles and pigmentation and freckles? The next treatment, which is the most powerful, is Basti treatment. Basti treatment is basically introducing medicine through the colon. There is Matra Basti, Kada Basti, Miruva Kashaya Basti, it's called, or introducing medicine through the vagina, which is slightly uncomfortable, not at all painful, because remember, these organs stretch well and use a catheter to introduce a medicine. There are 1,700 formulas of medicines to be introduced to the colon based on your unique body type, your genetic coding, your family history, and all your symptoms, and your geographic, topographic condition, and which city you come from, and everything. 1,700 formulas made from 3,000 different herbs. So no 2 human bodies, no 2 female patients will ever be the same. Please remember, you're unique in your own way. When the medicine is introduced,
I just want to get on to the next question, and I'm sure if this looks like that there's much more than the lifestyle change. Of course, you bring in more treatments which are obviously evidence-based. So if there's anybody who's interested, they could reach out to Dimple going to her website. I want to also leave enough time for questions, and I see overflowing.
Yes.
And at 2 o'clock, we have a next segment. So I want to make sure everybody's questions are answered. Before we get on to the question, one last question is that what are the, it's practically impossible for people to sleep early. And in the world that we live in, we are not living in a very perfect world where we sleep early and we wake up early. Sometimes life happens. What are some of your tips in a world where we are chasing deadlines? What would you recommend to your people that you work with in terms of the patients?
Following the circadian rhythm, we've spoken about this several times, Nidhi, is very, very critical and important for the body, because there's an external clock, the sun, the moon, the stars, and the planets, and there's an internal clock. If these 2 clocks are not in sync, it's going to create havoc inside the body. Waking up before sunrise, consuming a lot of healthy foods, doing some yoga, meditation, chanting, by the way, is very powerful. It helps in calming the body organs down. Sound has a more powerful effect on the body than even medicines and herbs do. And then making sure that you finish your meal before sunset, because after sunset, the body doesn't produce digestive juices or, saliva or metabolic fire. It comes down to a standstill. Making sure you eat foods before sunset and sleeping before 10 o'clock, because 10 p.m. to 2 a.m. is when the body repairs, broken tissues, muscles, and nerves. It's the period for repairing and rejuvenating the organs back to good health. You must take advantage of this clock and sink in. Circadian rhythm is very powerful. Follow the position of the sun, and based on the position of the sun, your meal changes. Small breakfast, big lunch, small dinner.
That's nicely put, Dimple. What if we are not able to sleep before 10 p.m.?
Okay, here's my recipe. Try it starting tonight. I have struggles falling asleep too, and I just forced myself to start waking up at 4:30 with an alarm. It's been 30 days. I've been doing it continuously. It forces me to sleep early now, because I cannot function for first day or second day, right? You can take half a glass of milk, half a glass of water, vegan or organic A2 cow's milk, put a pinch of nutmeg. Jaffle is a very strong herb, a spice that helps in giving a calming effect to the brain. Just a scraping, don't overdo it. It knocks you like a baby elephant. You fall asleep.
Okay, great. And I think it totally depends on how everybody's tolerance is as well. If you want any specific guidance on Ayurveda, Dimple runs some really nice self-paced courses and also does a lot of live courses, which some of us, like from our community and myself, have availed. And I would say it's life-changing on how you see foods, because it's not always Ayurveda or allopathy. You want to do everything which is what you can do from your kitchen. So whatever is in the kitchen, I think you need more education about it. And I think those programs have been truly beneficial. So I would highly recommend to check out her website and her work that she's done. So with that, I'm going to head on to the questions. So many questions are coming up. Okay, so how to get the benefits of good bacteria of curd or buttermilk to fix gut if we avoid it?
Of course, you need the probiotics because it helps in enhancing gut flora. Yogurt is considered one of the heaviest foods in Ayurveda. It's not easy to digest. Please do not have yogurt at all if you have thyroid, PCOS, or PCOD. Instead, you can have buttermilk. That's the only exception that I make besides ghee, but make sure to put a tadka onto the buttermilk to break down the complex structure of yogurt. You can put hing, curry leaves, hing is asafoetida, curry leaves, ginger, chili, some mustard seeds, jeera powder, cilantro, pink salt onto the buttermilk, and then only have it with a little ghee. Or you can even have coconut milk with grated cucumber in it and the same tadka. It gives you the same probiotics as a buttermilk does. Let me tell you, the first source of good bacteria for your gut is fresh fruits. They're brimming and alive with microorganisms. Make sure to have the first meal of the day as fruits. And again, the evening snacks should be fruits. That's your first source of probiotics.
Great. So Pratyusha asked, I'm a vegetarian since birth, hardly had dairy apart from curd and ghee. My gut is not healthy as I have autoimmune condition. Does stress cause gut issues and how can we fix it?
Stress and anxiety has a direct impact on the gut. The gut is called the second brain. That's where you feel your emotions, by the way. When you're scared, anxious, excited, nervous, butterflies in the stomach, you feel the runs in the gut, right? Gut is where intuition comes from. Gut is where memories are also stored. You have a gut-wrenching feeling if you do something that is haunted or something, or has a bad voodoo for it. Gut is directly connected to your skin, hair, neurological health, and the gut bacteria is directly connected to your mental and emotional health. If the gut bacteria is not balanced, it causes that. Now, even though you're having yogurt, there's a good chance that yogurt doesn't suit you. Instead, you should have buttermilk and ghee. And autoimmune disorders has to be treated at the root cause with the right medication. You can take Ayurvedic Aushad, you can take allopathy medicine, but there's a saying that if you take too much drugs and steroids and antibiotics, you have to go through another set of medication to recover from the side effects. So take medicines that have side benefits instead. Go to the root of the medicine, not the molecular form, but the root of the medicine. Where did this medicine originate from? If it's from turmeric, have turmeric in your diet. Don't have curcumin amara tablets. Doesn't make sense, okay? Autoimmune disorders is this thing. Second is stress and anxiety has to be reduced, which cannot be, physically done. So just following the circadian rhythm can reduce your stress by 80%. I'm not exaggerating this, just following the circadian rhythm, syncing your clock to the main power, because you are a combination of earth, water, fire, air, space. And if you don't follow the rules of the 5 elements that you're made of, your body is going to be in chaos. You need to plug back to the motherboard. The motherboard is nature's clock. Plug back to the motherboard and let the motherboard control and tell your body when to eat, when to digest, when to sleep. Your stress anxiety levels will be gone in 3 days.
Right.
And that will improve your gut.
Great. And I think the next segment is lined up with the habit coach, Ashton Doctor. And I think he's going to tell more about, how we can build habits which are sustainable and can help. So I'm sure it's a tough journey, but we do have a lot of resources. So stress does have an impact, but we need to find ways. Which is another fruit apart from pomegranate? Somebody asked. I think that was some time when you were telling about fruits.
Which fruits? Pomegranate is excellent. Black grapes is excellent. If you want more fruits, I would recommend a lot of fruits with vitamin C in it. So your tangerine fruits like oranges, lemons, grapefruit, they're excellent source of vitamin C. And amla. Please incorporate at least one amla in your diet. One amla is equal to, this is like, just another product that I have. I don't know if you can see. This is sweetened amla. Excellent. I just started this morning. One amla is equal to 20 citric fruits, 5 glasses of orange juice, that is, which you cannot drink every day as a habit. Just have one amla. It has anti-inflammatory, antibacterial, antiviral, antifungal properties, and anti-carcinogenic properties. It helps in preventing cancer. Absolutely. So please incorporate this.
Is mixing Ayurveda and allopathy harmful? Can we do that?
No, it's not harmful, but you must ensure to keep half an hour gap between your allopathy medicines and Ayurveda medicines. In fact, when patients come to us, we do not take them off the allopathy medicines that they're having because the body can have withdrawal symptoms. You need to wean off it. You can't live on medicines. Even Ayurvedic herbs, you need to wean off it. So when your body starts responding and improving, you slowly start reducing the dosage. There's another thing I want to share, Nidhi. Seed cycling. Very powerful. I want everybody to start practicing starting today. The first 15 days of your periods, from the day the period ends, that's the full moon cycle, you go up to ovulation period. You have 2 teaspoons of pumpkin seeds and 2 teaspoons of flax seeds. Soak for at least half an hour. Don't directly add it because they're like hard and dry and rough, right? They can cause constipation. 2 teaspoons pumpkin seeds, 2 teaspoons flax seeds for the first 15 days after periods. And the next 15 days from ovulation to periods, 2 teaspoons sunflower seeds and 2 teaspoons sesame seeds. Easy way to remember, PFSS. PFSS. PF, pumpkin flax seeds will improve your estrogen levels. SS, sunflower sesame seeds will improve your testosterone levels and thus cause balance in your hormones and support your uterus. Please start incorporating the seed cycling.
Great. There's some question about Sendha Namak. Is Sendha Namak good for people with thyroid PCOD?
Absolutely. Do not have white salt or white sugar at all in your diet. Anything that is refined oil, refined ghee, refined flour like maida is extremely injurious to the gut. It causes holes in the gut. You must have instead original form of salt like Sendha Namak, pink salt, rock salt, Himalayan salt. It's up to your taste. All of them are more than good. You can get your iodine from vegetables instead. You don't need to get it from salt. And instead of white sugar, incorporate brown sugar or misri or kadi shakkar or date syrup even. Another very powerful dry fruit for women with gynecological imbalances. Please soak dates, 2 dates or 2 prunes, 10 black raisins overnight, and next morning consume the water and eat the date, the raisins and the prunes. It'll flush the waste out of your colon and uterus, and it'll support the uterus healing process. So this is another dry fruit that absolutely recommend having.
Sandhya asked, Ayurveda is not easily available. How do I start practice with the right guidance and information? I think this is something where I shared that you can get hold of Dimple's programs on her website, which I can share shortly on my screen. And you should definitely figure out more information that you would like to access to be able to start practicing it. Dimple, is enema good for detoxification of body?
Oh, yes. Enema is a first step process for detoxification, but of course you have to combine it with a series of abhyangam, full body massage that increases blood circulation and stimulates the toxins towards the gut and prepares it for elimination. So enema is a must, but please do not engage in water-based enema, black coffee enema, and all these herbal tea enemas that are coming out in the market. These quick fix solutions are dangerous. Enemas are done with Ayurvedic herbs and medicines and concoctions that are made. Usually every enema has 60 to 70 herbs in it. Dry coffee or water-based enemas or coffee-based enemas actually strips the colon of its natural oils and thus causes long-term constipation. You might feel an immediate relief, but the long-term damage is very bad. Do not do enemas at home. Please don't get into that habit. Go to an Ayurvedic doctor, a Vaidya, a naturopathy expert, and then get it done.
Priyanshi asked if I have to take chicken as I'm a non-vegetarian since childhood, how much and how many times in 15 days?
My answer is no. If you're still struggling, please don't have meat, seafood, eggs for breakfast or dinner. At least start off with 2 meals that is pure plant-based and wean off the hormones that you're consuming. You're basically consuming hormones that's going to slow down your recovery process. And in fact, it could make it worse. I definitely don't recommend it.
But if you do say, for example, if somebody is trying to make a sustainable change and it's not like tomorrow they'll take out all the chicken, but what are the sustainable ways they can start reducing it at least?
Chicken actually doesn't have a taste of its own, right? It's a protein and the texture that people miss, right? The breaking down texture. If you can replace it with some powerful foods that I tell you, which are powerful sources of protein and doesn't give you that craving, is you can have paneer, you can have tofu, you can have sattuka laddu, which is made with chickpea, black roasted chickpeas. You can have sattuka milkshake. Excellent, that's only milkshake advice. And you can have 300 varieties of dals to choose from. Have a lentil broth, a thick lentil broth if you want for dinner or lunch. That will replace your craving. And definitely don't touch it for breakfast or dinner and try to wean off the consumption of chicken eventually. That's the advice I would give. Don't try to make it part of your diet and lifestyle.
Okay. What if the testosterone level is really high? Shall we still take sesame seeds as per the cycle you recommend?
No, if your testosterone levels are high, stay away from sunflower and sesame seeds. Remember, SS is equal to T, and PF, pumpkin flax seeds, is equal to estrogen, E. So instead have pumpkin flax seeds, stay away from sesame and sunflower seeds. They increase your body heat.
If I go to, so this is more about sleep, and we are covering sleep very extensively in tomorrow's session with Dr. Manveer Bhatia, who is a sleep expert. But it is more about getting rid of anxiety and sleep disorders without pills. Do you want to comment on any lifestyle changes? And Ashton is waiting on the side for the next segment. Sorry, Ashton, but we'll start another 1 minute.
Good. So the last question, like I said, circadian rhythm. Force yourself to wake up early for the first 2 days, 4:30, 5 o'clock, before sunrise, at least 10 minutes before sunrise. It'll force you to fall asleep early in the evening. Try to do a nice 40-minute workout in the morning. 10,000 steps per day is compulsory. Don't do late evening workouts that irritates your mind. Don't consume fruits, yogurt, or buttermilk after 4 in the evening. That also activates your mind and prevents you from falling asleep. Do not have caffeine. Replace coffee and tea with herbal teas. This will help you get into a more normal sleeping routine pattern and reduce your anxiety and stress.
Great. So with that, Dimple, I think there are a lot of more questions coming in, but Dimple is also on our panel. If you'd like to get any consultations with her, the number is down on the slide, and you can also get more details going to her website. This is her YouTube link, which has lovely videos, a lot of information, a lot of chai recipes, a lot of herb recipes. And you can get more information from there. But for this segment, thank you so much, Dimple. We're so proud of what you've achieved, bringing Ayurveda to homes and making it so accessible. And we also want to thank One Herb, who has made this segment possible. So thank you so much for your support. If you do want to take more information about our sponsors and exciting offers that they're running, you can head on to Sponsors Lounge going into the lobby. If you do have any questions on our agenda, the agenda is on the bottom of the screen. And if you have any questions, the help desk is at your service. So thanks, Dimple. Thanks for your time. And thank you so much for being so humble and easy to approach and always ready to help.
Thank you so much, Nidhi, and congratulations and all the very best for the mammoth effort you put together. All the very best to the team. Lots of love and light always. This is me signing off.
Thank you so much, Dimple ma'am. Thank you so much, Nidhi ma'am. So next up, we have Ashdeen Doctor. Ashdeen believes that having an awesome life is easy. All we have to do is identify and create the right habits, routines, and rituals that will make us awesome. After having personally gone through this journey 5 years ago, he was unhealthy, overworked, stressed, and sleep deprived. Till it caught up with him and he found himself collapsing on the floor in a puddle of sweat, unable to move. He realized his life needed change. In this pursuit, he had informally studied various perspectives on health, nutrition, fitness, exercise anatomy, nervous system, habits, motivations, lifestyles, meditations, healing practices, and sleep. Please welcome Asheen Doctor. He's going to join us right now. For more details on the agenda, it's on the left side of the screen. And thank you so much for joining us again.
Thank you so much for that. Lovely. I'm so excited to be here. So the whole thing, when people look at me and say, you're a habit coach, what is a habit coach exactly? So let me first tell you a little bit about what is habit coaching and a little bit about why I started this. So like Olipriya was saying, that I went through my own journey. I was nice and overweight, tubby, and very, very stressed out. The point where my life was collapsing around me. What happened was that at one point of time, I decided that, you know what, after this whole episode with falling down, feeling my heart almost jump out of my chest, not knowing what was happening, and all this in my early 30s, I realized that something had to change, right? I couldn't continue living this way. And I made up my mind that so much and no further. And from this point onwards, I'm going to make a change in my life. And that's when this whole journey started off. Now, I started making these changes. I started learning. I started seeing my body adapt. And, that is one of the best drivers. When you start making a change and you slowly start seeing a change take place and you start seeing yourself grow a little bit. Oh my God, that is one of the best things that pushes you. And I just got deeper and deeper into it. So like I said, I was nice and tubby. So I said, what is the only goal that I can give myself? Remember, I was a type A person, a typical go hard, go home kind of person. I said, the hardest goal I can give myself is get a six-pack. And I was like, all right, I'm going to get a six-pack. So I started doing every exercise program known to man. I started doing every diet plan known to man. And just like what you guys are going through, tons of advice started pouring in, right? Throughout these 2 days, you're going to get so much advice. But the important thing is, how do we implement that advice? And what I figured out was the way that I was implementing it. And then, when you make a big change in your life, people start noticing, people start asking you. So every time I was at a wedding, every time I was at a party, people would say, wow, Ashton, you made such a big change. Tell me, give me one tip, yaar. Tell me. And I would like, okay, fine. And I would very diligently tell them that I did this, then I did this, then I did this, then I did this. And they would all look at me and politely listen for exactly 3 minutes. And after 3 minutes, they would stop me and say, wait, listen, I don't think I can do what you did. I don't think I have it in me. I don't think I have the motivation. And I don't think I have the self-discipline. And the reason I'm telling you this story is because I know some of you will be listening to all the things that are coming in today, all the information, and saying, really? Can I do this? And that question starts. And because the question starts, people don't even begin the process of change. And that was the reason why I started habit coaching, because I realized that people were just so scared of starting that they never actually got to the finish line. You cannot get to the finish line unless you start. And you will start and you will fail, and you will start and you will fail. But imagine if I could make this whole process smoother and easier for you. That is my goal. So how do I make this whole process easier and smoother? So the way to think about it is that we all rely on this one word, which according to me is a very bad word. And, it doesn't fit into my entire vocabulary. And that's a word called motivation. Very often I'm called a motivational speaker. My podcast, the Habit Coach podcast, is called a motivational podcast, and it makes me cringe because my entire war is against this word called motivation. And many of you all will be saying that, how do I get motivated to make this change? People are telling me to eat differently. People are telling me to exercise. People are telling me to sleep differently. How do I keep myself motivated? And motivation is the starting point for all our problems. What we need to do is we need to learn that motivation needs to change. And how do we change it? We change it by not using motivation at all. Instead, what we use is a word called intention. All right. If you have your book out right now, write this down. Intention. All right. If you got the chat box, write down the chat box. Intention. And how do you get your intention? Your intention is nothing but that deep reason that is unique to you on why you want to make this change. All right. I have PCOS. Fine. But why do you want to change it? Right? Many often people just don't have that strong enough why. So they think, the doctors told me this, this person's told me that. But if you don't have a strong burning why, it's very, very hard to make that change. So the way to do this and find your intention is to ask why 3 times. Okay. And I want all of you all to do this privately in your own heart. Right? Why do I want to get rid of this PCOS? And whatever answer comes, ask why again. Because I want to feel more energetic, because I want to feel better, because I want whatever it is. Why do you want to feel more energetic? Why do you want to feel better? Why do you want to? And then you slowly start peeling away the layers till you come to something that is very, very deep and very, very unique to you. Now, without an intention, there is no point starting a habit, because your intention is the powerhouse behind it. The intention is the driving force behind it. And if you don't have that, right? So what you have to do is you have to spend time introspecting and thinking, why do you want to change? And then if you have a strong enough why, then I can guide you and I can help you out. Because then all we have to do is figure out what are habits, because habits are nothing but things that make up your entire life. The way I like to define habits are actions. We normally think of actions as habits, right? Brushing teeth, tying shoelaces, going for a walk, all habits. But what we don't realize are habits are our thoughts. Our thoughts are also habits. And we don't realize that, right? If every morning you woke up and said, oh my God, life sucks today. If you wake up every morning and the first thing you do is open the newspaper and find out, oh my God, so much depressing news. Those are all thoughts. And those are also habits. Now, as soon as you understand that thoughts are habits, now look at the kind of habits that you have in your life. What is the quality of your life? Because the quality of your life is nothing but all the actions and thoughts that you input in it, right? And whatever has got you to your life today is nothing but all your past habits. All the habits that you've done so far has got you to where you are today. And I'm with you to tell you that wherever you want to go consists of all the habits and changes you're going to start making from now onwards. Okay. So join me in this journey, because you can start making this change. I want you to remove all doubt from your mind. Can I do this? Really? I've seen other people do this. I've seen Nidhi do this, but can I also do this? Everyone can do this. Hell, if I could do this, and I'm the most indisciplined person on the planet, if I could do this, you can do this. You just have to understand 3 simple guiding rules of how to make a habit. All right. So with me, excited? Let's do this. If you got your intention right, and if you've chosen any of the things that you want to start off with, and I normally think of starting off with something that you can change easily, right? Because the whole idea of habits is make an easy change in your life. So if you can find something that is easy to change, typically when we think about PCOS, we think about 4 main categories in our life that we need to change. Like when we're talking about lifestyle change, right? So one is sleep, one is nutrition, one is de-stressing, and one is movement or exercise, right? These are the big 4 that we talk about. Now, which in these 4 are the easiest for you to start off with? Right? Now, imagine if you have a late night shift kind of a job, obviously sleep is not going to be the first one that is so easy for you to start off with. So don't try taking that on, right? Start with the easiest one first. And then what we want to do is we want to follow the next rule, which is don't self-sabotage. What is self-sabotage? Self-sabotage is nothing but, because earlier on we used to use motivation, because we used to use all of that. We needed a very big goal in order for us to feel worthy, So like, for example, you will listen to the talk today and you will listen to an exercise specialist that will come and you'll be like, yes, from tomorrow onwards, I will wake up at 5 a.m. and I will run for 5 kilometers. Having never woken up at 5 a.m. or never run 5 kilometers in your life, you're now going to do both of these. This is my definition of self-sabotage, because now you've given yourself an unrealistic thing and you're setting yourself up for failure. Instead, with habits, what I want you to do is not set yourself up for failure. What I want you to do is instead focus on what you can do, And hence we have 3 golden rules of habit change. All right, 3 golden rules of habit change. If you have your book, write it down. If you're on the chat, write it down in your chat so it stays in your mind. The first golden rule of habit change is make it stupidly simple. And I've chosen my words carefully. I said stupidly simple. That means that it is so simple. It is so small to do that if you don't do it, you feel stupid doing, right? So what would a stupidly small habit look like? So for example, if I told you that, you have to start a yoga habit because yoga is really good for PCOS and all of that, and you're like, yes, I'm going to do 1.5 hours of yoga, I would say, no, that is self-sabotage. What is stupidly small for yoga? All I want you to do is I want you to roll out your yoga mat on the floor and sit on it. Now, that everyone can do, right? That you can do in a day, right? You have 24 hours, that much you can do. That is your habit. Your habit is not sitting on it for 1.5 hours. Your habit is just rolling out your mat and sitting down because you're starting. And it has to be so small that it has to make you feel stupid if you didn't do it. Okay, that is what we're talking about. If you want to start running, what is your stupidly small habit? Make sure that you wear your shoes at the time that you want to go. After that, if you want to sit and watch TV, bindas, you have my full blessings. But wear your shoes. The habit is just wearing your shoes. Okay. If you want to start sleeping, what is your habit? It's just set a sleep alarm. That means it's going to ring half an hour or 1 hour before your bedtime, right? If you want to hit snooze after that, theek ache, but at least let it ring. Okay. So we start that small, because every time we start big, what happens is we start off with full gusto and then we somewhere along the line peter off and just like fizzle off. So that is not what we want to do. Okay, so whatever change that you're going to decide, first figure out what is the smallest step that you can do for this particular change. And that is the start of your habit. The second golden rule of habit change, write this down, put it in the comment box. Second rule of habit change, make it extra easy. Make it extra easy. What does extra easy mean? Extra easy means that I want you to remove all the friction from doing that exercise or from doing that particular habit. All the friction. Friction means anything that in your mind could become a possible excuse why you don't want to do it, right? Anything that could become an excuse that you can generate in your mind. Like just this morning, my dad was telling me that, Ashton, I don't think I should do yoga today because I have to shave. No, we have a puja at home. I think I have to shave, so I don't think I'll do my yoga class. I'm like, you're not going to do a 1.5 hour yoga class because you have to shave? Like, completely mindless, but we come up with these kinds of excuses all the time. I have known people who said that, Ashton, I can't come for the run today because I'm not getting my matching socks. You don't have your matching socks. That's why you're not going to go on a run. So we come up with all these strange excuses and then we become masters of these excuses, which I'm going to tell you about in a bit. But what I want you to do is I want you to remove all friction. That means that if your simple yoga habit is roll out a yoga mat on the floor and sit on it, don't put the yoga mat on top of a cupboard in a box where you need a staircase to go and climb and pick it out, right? You're going to add too much friction to this process. Whatever you're going to do, make it as easy as possible to do so that you don't have to worry about it and even give your mind an opportunity to make an excuse. Because we are all masters of excuses by now, right? That's where we typically fail. And I don't want you to fail. I want you to succeed on this journey. And I know you can. All right, because there's a third golden rule of habit change, and this is the most important golden rule. The third important rule is never miss 2 days in a row. Never miss 2 days in a row. Now, we've all heard of people saying you have to do a habit for 21 days, and all throughout this COVID, we've had 21-day challenge this, 21-day challenge that. Forget all of that. Okay, it doesn't take 21 days. There's no proof. None of my clients ever have managed to get a habit in 21 days. It always takes longer. Why? Because life comes in the way. Look, as your habit coach, I don't want to make you a robot. That's not a fun life, right? But I want to make sure that you remain consistent. And this third rule of habit change is nothing but consistency, which is what? Never miss 2 days in a row. So now Monday, you did the habit that you decided. Tuesday, you did the habit that you decided. Now on Wednesday, you had to go for a party, or you had to, ask people, or somebody fell sick in your family, something happened, you got distracted. You didn't do it. No problem. Don't beat yourself up. Don't even spend a second more thinking about it. But whatever happens on Thursday, make sure you do it. Never miss 2 days in a row. 1 day, perfectly fine. 2 days, nah. Because when you miss 2 days in a row, what happens is you start getting into the habit of making excuses. The habit of excuses becomes stronger, and the habit of what you wanted to actually change disappears. Okay, so never miss 2 days in a row. So now we've got the basic structure in mind on what your habits need to be like, right? If you want to create a habit, and I'm sure you all have been taking notes. I hope you all have been taking notes, because that's the most valuable thing about these kind of conferences. Take notes. Now choose only 3 things to focus on. All right. I know you're going to be tempted to do every single thing that you said, right? Soak these seeds, do that, do this, do that, everything you want to do. Please don't. Focus only on 3 things at a time. Make these a habit, then move on. So choose 3 things that you feel are going to be the easiest for you to do and the ones with the most impact in your life. And then start making these habits. Make it stupidly small, extra easy, and never miss 2 days in a row. All right. This is the basic way of starting to think about habits. Now, what I wanted to do was I wanted to share some of my favorite habits with regards to those 4 categories that I told you about, which are important with PCOS. And you can choose any of these, because what I wanted to give you was I wanted to give you something that was actionable from today onwards, right? You decide to do it, so that today onwards, you're going to end up doing it. So these are the 4 categories. So let's start with the first one, which is sleep. Okay. So the first sleep habit that I want to tell you about is never ever sit in your bed unless you're going to sleep. So never use your bed unless you're going to be sleeping. Very often we spend our time sitting in bed watching Netflix. We sit in bed working. We sit in bed doing this. We sit in bed doing that. What is happening is that our mind is not being primed. Our mind needs to be primed, saying that if I get on the bed, it is now time to sleep. Many of us have sleep issues because we lie in bed and then we're like, where is the sleep? Where is the sleep? I said today I'm going to sleep at 10:30. No sleep, no sleep, no sleep. And that makes us even more anxious, even more awake. And that completely screws up not only the sleep, but your stress levels as well. Okay, so as a result, we have to make our sleep so peaceful that we don't need to struggle with it. That as soon as we put our head on the pillow, the sleep comes to us. Okay, so the first way of doing this is priming the mind so that we know that bed equals to sleep. The second thing with sleep is, like I mentioned earlier, set up a sleep alarm. This is one of the most important habits to start. Set up a sleep alarm saying that if you want to start sleeping at 11, set an alarm for 10:30. So I'm not being ambitious by saying 10 o'clock. Fair enough. 10:30. At 10:30, you do the following. You put your phone away. You change into your pajamas. And then you put off all the lights and then you bore yourself to sleep. Very often we think that sleep is about being exhausted and then we go to sleep. But actually, sleep is actually about not allowing your mind to have so many thoughts that it starts going to sleep, right? And then you'll say, but Ashton, I have so many thoughts in my mind. Don't worry. That's why we have the de-stressing part to worry about. So we'll come to that. But for sleep, follow these 2 simple things. One is no sitting on your bed. And the second is a sleep alarm. All right. You're with me? You got these down? Written them down? All right. Then the next one, which is about the mind, right? Now, very often when we start thinking about stress and we start thinking about the mind and we say that, I'm just overthinking and I can't stop thinking, right? Because one of the big issues with PCOS is adrenal fatigue and excess adrenal in our body, right? All the stress hormones. When we start thinking about this, I keep telling people that if your mind doesn't think, what is it going to be doing? Right? It's like you telling your heart, "Arey, you know what? My heart is beating. I don't know what to do. How do I make my heart stop beating?" No, Baba. Your brain was supposed to think. Your heart was supposed to beat. Your brain is thinking, is doing its job. The only problem is that you've given it the wrong information. And as a result, is thinking the wrong information. Now, what you put into the brain is what it's going to think. What you put into the brain is what it's going to process. So now if you spend your entire day putting in negative thoughts, negative belief systems, negative interactions, what kind of thoughts are you going to get? you're going to get negative thoughts. Now imagine if I told you this, and I really want you to do this. If this is a problem that you face, constant negative thoughts, I want you for the next 2 weeks to listen to at least half an hour of positive information. That means talks by, fantastic people like Jack Canfield, Jim Rohn, super podcasts like the Habit Coach podcast, anything that is going to make you start thinking about life in a very positive manner. Because positivity in equals to positivity of life, positivity out. So if you don't get that cycle in, you're screwed. Okay. So it is not that you're thinking too much. It is that you're thinking about the wrong things too much. Imagine if you're thinking about positivity too much. Would you complain to me about that? No, you would not complain to me. Or at least I hope you would not. I think some of us can complain about everything. But the whole idea is fill your mind with things that are positive, and you will see that change taking place in you. The next thing, like I'm giving two habits for each of these. The next thing for the mind is I want you to have your gratitude practice in place. Okay. Gratitude practice is one of the most important things, because what happens is that whenever we are in a state of gratitude, we're not in a state of fear. And when we calm our fear response down, we feel much better, right? Fear is nothing but your cortisol, adrenaline, all of that. So as a result, what I want you to do is I want you to get your gratitude practice in, which means I want you to do this every morning. Whenever you sit with your tea or the new beverage that we're going to be doing for our PCOS, every morning you sit down and I want you to take your journal out and I want you to write 3 things that you're grateful for. Okay. And I want you to write the full sentence. I am grateful for XYZ. I am grateful for XYZ. So the full sentence is out. And you can be grateful for a person, a thing, or a situation. Person, thing, or situation. So don't be stressed about, oh my God, I don't know enough people. Yeah. How will I be grateful for? It can be a situation. It can be a thing, right? So the way to think about this is for the next 30 days, I don't want you to repeat a single thing that you've written down in your gratitude journal. That means by the end of 30 days, I want 90 things that you would have thought of that you are grateful for, right? Some of you might be thinking 90 things. I can't even think of one thing. How do I think of 90 things? That's the power. Okay. So start thinking about the gratitude part, putting it down, and you will see a big change. You can write, I'm grateful to Ashton, I'm grateful to Nidhi, I'm grateful to PCOS Club India. All 3 things, right? You will find enough things. And they don't have to be mind-blowingly big things that you have to be grateful for. Okay. It can be something even small, like today in the vegetable market, along with Nimbu, he gave me one little thing of pudina. Perfectly fine. I got this 2 extra mirchis. Perfectly fine. Even that small is part of our gratitude practice, because we just want to feel that, you know what? Life ain't so bad. There is so much that is happening for me. And if you can get that feeling in, you're going to live your life with love, and fear is not going to exist. It's not going to exist as a word in your life. Isn't that powerful? Okay. That's the mind. Now let's talk about something that is definitely spoken about all the time, which is nutrition, right? Nutrition. What are we going to eat? What are we going to eat? Anti-inflammatory foods, inflammatory foods, high in lectins, high in sugar. There's so much, right? The way to think about it is that very often we find it difficult to eliminate because we don't have enough of the good stuff already in our diet plans. Okay. So if you find it difficult to eliminate because you're saying, you just took away everything I eat, right? And I know many of you all would have thought about that, especially listening to some of our nutritionists. The idea is first add in the good, then take out the bad. Okay, so you start adding lots of the good stuff that we're talking about. Lots of the good stuff. Eating clean at least 1 meal a day. If nothing, just add one big salad to your bowl. Something that is going to make a difference. And that habit will slowly start. Remember I said start stupidly small. So what is the smallest thing that you can add to your meal that is not going to completely affect you and make you feel like you're a deprived child, right? Add those things in. And then slowly you will notice yourself that you're going to remove all the bad stuff. Okay, that is one beautiful way. The other, more hardcore way of doing this is to completely eliminate sugar. Right? Sugar is one of those things that is very, very bad for us. And it's found in all our processed foods. It is snuck into this, it's snuck into that. And we keep doing these no sugar challenges. Important to start doing that. In fact, tomorrow we're discussing that as well on Instagram. it's important to start doing these no sugar challenges and getting rid of it, because only then do you understand what your dependence is. Only then you understand how dependent you are on these things. Getting it out of your system makes such a big difference. And you suddenly find, oh my God, it's in my ketchup, it's in my mustard, it's in places that you didn't even expect it to be. Like the other day I saw a post with a friend of mine I put up, and he said that this is your cola and this is your milkshake, Tetra Packs both. I mean, one Tetra Pack, one can. The milkshake had more sugar in it than the Coke did, or the cola did, right? So it's so interesting to understand that where is the sugar hidden, and identifying this is a very important part of what we need to do from a nutrition point of view. I'm a self-proclaimed sugar addict, so for me it was very difficult to do it, but this is the way that we did it. So there are times for habits, and there are times for just like khatak, making a change, and then slowly turning that into a habit. And that is the way to do it with sugar. So following this is very, very important. You can, of course, then add up things like, haldi chais and stuff like that, which are anti-inflammatory in nature, because inflammation is an important part of what we want to get out of our life. The final part is, and how are we doing on time? We good on time? Yeah, perfect. The last part is with regards to our movement and exercise, right? Everyone says exercise, exercise, exercise. There are two aspects that I think that are extremely important that are missing. Okay, one is weight training, because if you understand that a large part of PCOS is sugar, insulin, our insulin response and all of that, then what we need to understand is that what are the ways in which we can utilize all the glucose in our system. And the way to do this is, because muscle uses up and soaks up more of the glucose that is free flowing in our bloodstream, having more muscle is good. So putting on muscle is something that is important for us. So don't fear the weights. Do a lot of weight training. In fact, I was on another workshop just the other day where we were talking about this. For women, weight training is so important, because not only does it increase your muscles, but it increases your bone density, and all these things are very, very important for us. Right? So please start our weight training. Don't fear the weights. I know it. I remember the first time I ever went to a gym was in Bombay when I was just out of college, I think. And there was the weight section, and then there was the cardio section, and the weight section was only open for 2 hours for ladies during the entire day. And I was like, what? This doesn't make any sense, right? It didn't make sense at all. And it doesn't make sense now. So please don't fear the weights. Go pick them up, do something. It's very, very important. And the last movement habit that I want to talk about is a slow walk. We're so used to telling people saying, I go for a brisk morning walk. Right? So a brisk morning walk affects your cardiovascular system, because you start breathing heavier and you start panting more. But when you don't do a brisk walk, when you walk as if you're walking with like a 3-year-old or 4-year-old in your hand, which is very, very slow, what happens is that you're consciously now using your entire muscle structure to move. There is no momentum, right? You have to overcome the inertia every single time. And as a result, you're working your muscles. And because you're working your muscles, you're using anaerobic, which means that you're using up the sugar that's stored in your muscles. So the way that I would do it is I would go for an early morning walk in a fasted state. So I've not eaten anything. I've not spiked my blood sugar. And now, because of this slow walking, I'm actually using up all the glycogen that's in my muscles. And then the sugar that's there in my bloodstream is now going into my muscles. So that is one very, very good way of getting rid of the blood sugar that's there in our system. Now, you see, these are very, very simple things to do. These are easy things to do. And I wanted to make this easy for you and doable for you. Now, like I said, don't try doing all these 8, right? I said 2 for each 8. Choose 3 things that you're going to focus on and start with those. Because once you see that momentum, like I did in my life, when I saw that little change taking place and I was more eager, I was more driven, that's the cycle to get on. And I wish we all get onto that cycle. So as always, I'm always available. Let's get into our Q&A section. I think there are lots of questions coming in. So let's take all these questions and let's get cracking. How are you doing, Nidhi?
Very well, Ashton. I really liked how you made this session so fun. We all know we want to make all these changes, but the humor was nice. I know the way you put it across that life happens, and there's so much to be felt grateful about, little things. And I think with PCOS, if we talk about the condition, it is a chronic condition which affects your whole endocrine. So it's not just the lethargy that comes in. We all want to make change, and you'll be surprised. Our community faces a lot of discrimination, like you're a lazy fat girl, you don't want to work out. It's not like that. We all want to be perfect, we all want to look really nice, but how do we get the motivation? So very, very nice habits. I think this is what sustainability looks like. And kudos to you, the kind of work that you're doing. By the way, people, the Habit Coach podcast is currently one of the top 10 podcasts, if I'm not wrong, on the and you also can catch him on Apple Podcasts, and you have the website on my screen right now. So do have a look at the articles and podcasts. Ashton has been doing some great work and is working with so many people through his coaching program. So do check that out. With that, I'm going to ask the questions that we have got from the audience. And by the way, just want to say that Ashton Doctor is part of his surname. So he's not a doctor, because I see a lot of technical questions coming in here. That's very, that's one of the rare surnames that you come across, but that's what it is.
Yeah, we need to keep those questions for people who actually did those 5 years. I got it at birth.
Okay, so we have a question from the audience. She says, I'm not sure PCOS and insomnia are related, but I'm suffering from sleep issues and they're chronic. How should I get proper good night's sleep without pills? I cannot sleep more than 2 hours.
So it's very interesting, for most people who believe that they have insomnia, it's actually not insomnia, because we cannot function on 2 hours of sleep. It is just that we feel that we have 2 hours of sleep. Now, I know this is a very dangerous thing to say, because everyone's like, how dare you say this? I know how much I sleep. And I was like, and I've done a lot of reading on this and spoken to a lot of experts. And a large part of the way that we would diagnose clinical insomnia is different, right? You might have different conditions. Speaking to a sleep expert definitely helps you in this. With regards to PCOS and sleep, the reason why sleep is an important aspect of it is because sleep is the time when your body regenerates. Right? The sleep is the time when your body is recovering. Sleep is also the time when all your stress hormones come down. So this is the reason why sleep is such a paramount thing. If you're sleeping 2 hours a night, figure out what it is that you can do to increase it to 2.5 hours a night, and then slowly take it to 3 hours a night. It's all possible, because when I work with my clients who again tell me that, I only sleep 45 minutes. One started with 45 minutes a night. And then when I spoke to his wife, he said, he's fast asleep. He just doesn't know it. Don't listen to him. And the thing is that you cannot survive on 45 minutes of sleep, right? You will die. That's why you don't have Guinness Book of World Records of not sleeping for multiple days in a row. People die. So as a result, what you have to do is understand that you do sleep, but you're not satisfied with your sleep. And that is the way to frame the sentence. Every time when we say, I don't sleep for 2 hours, you're again reprogramming your mind saying, I don't. Now it's become an identity tag on you, saying, I don't do this. Right? Just the way, Nidhi, many people have the identity tag of I don't exercise or I'm lazy, because like you said, people have told them this. It becomes an identity tag. And it's very difficult to take out that identity tag. So start using the right words and you will start noticing a difference in the actions that take place. So it's not that you're lazy. Maybe you just haven't found what works for you, right? It's not that you don't like exercise. It's just that you don't like gymming kind of exercise. You might love dancing. Have you tried dancing? Right? So the whole thing is choose the labels correctly.
Great. And I think just to add on, there are a couple of very interesting sessions just on sleep that are lined up. In fact, one is CBD oil, which in India nobody talks about, but we are here to break barriers with the latest research. So maybe you want to check that out with Dr. Piyush with some research-based guidance. And tomorrow we have a session with Dr. Manvi, who's a sleep expert. Well, moving on to the next question is, sometimes if I see positive talks or videos of people getting success with all the hurdles, I start feeling even more depressed that I'm not able to do or achieve the same.
What a lovely question. So the thing is that you're comparing. And as soon as you got into comparison mode, right, you have no idea what struggles those people went through They probably went through the exact same thing that you're going through right now. It's just that that part of life is hidden. People look and say, wow, this person's so lucky. This person's so lucky. I, in fact, had a person message me the other day saying that, why do you only interview successful people on your podcast? It was like, I was like in my mind, I didn't even understand how to answer that question. And then I thought about it and I said that the thing is that you haven't seen the struggles that that person went to get to where they are. So when you see positive talk, understand that what you're seeing is the tip of the iceberg. There's a lot of work that went into it. The way to think of positive talk is not about comparison, but as more inspiration or a goal or learnings. What can I learn from this person? There's so many people who write into me saying that, at my age, Elon Musk was already a billionaire. And I was like, good. But like what? No, I'm completely useless. Now you made it your mind to say that you're completely useless. Did Elon come and tell you that you're completely useless? Nobody told you you're useless. But the point is that you're comparing yourself to Elon Musk. Your journey is different. What can you learn from Elon Musk's journey that you can put into your life? Similarly, what can you learn from other people who've successfully defeated PCOS from their life? What can you learn from them? So don't just think of it as positivity with a blanket statement. That is what we call like toxic positivity. Don't think about it that way. Instead, ask yourself, what can I learn from this situation?
Sorry, I was on mute. We have so much distractions. Even if we start good habits, we see other people who enjoy life fullest without putting on any discipline in their life habits. And this makes us more depressed and deprived. Any thoughts on that?
Lovely. The reason why you are doing what you are doing is very important. As soon as we see others doing things, what we feel like is like we get into that the grass is greener on the other side syndrome. But the point is that if you have a very, very clear intention on why you are doing what you're doing, then whatever happens outside doesn't matter. If you're not clear on why you're doing what you're doing, then you're constantly looking and saying, oh, I wish I was doing that also. I wish I was doing that also. I wish I was doing that also. And that is a trap that I don't want you to get into. So remember, any habit that you wanted to create, and probably you did not do this the last time you tried creating a habit, was ask yourself why 3 times. Get that intention really, really deep. Why do I want to do this? And then whatever answer comes, ask why for that answer. And whatever answer comes again, ask why for that answer. Just keep going deeper and deeper and deeper till you get to one spot where you're like, yes, this is it. And that is now your intention. Now, whatever the other people do, they're jumping out of airplanes, they're going to and chilling on the beach, they're having 35 pina coladas. And you're saying, I also want pina colada. No, my intention now is very clear. I want to get rid of this PCOS thing. That is what's going to keep you on track.
That's beautifully answered. And I wish this session could never stop. Love your energy, Ashton. As always, been addicted to your podcast and love the work that you've been doing. So thank you so much for making time. And we're already ready for a next segment. But I would like to give a moment to you to talk about your programs that you do as part of Awesome 180.
Lovely. Thank you so much. So apart from the one-on-one coaching and the group sessions that I do, we put out a lot of content for free. I would suggest everyone first come and try that out. Right? We put a lot of content on our Instagram channel, which is called Ashton Doc. We have a YouTube channel called Awesome 180. And of course, the podcast, which is called The Habit Coach. So in fact, in a couple of months, you're going to be launching our book and we're doing all sorts of fun things. So please come join, ask lots of questions. I'm very, very active on our DMs and Instagram. I'll answer everything. So please come join. Let's have a fantastic time. I'm here to support all of you.
Thank you. And I particularly liked your conversation, especially around the COVID time when you talked about relationships. And there is so much that you can talk in this half an hour, but love your conversations about how you can, better your relationships, take care of yourself more, because a lot of negativity also comes from around us. So I highly recommend Ashton Doctor's all the content that he's been creating. And when you go on Google, you'll find him everywhere. So I don't have to talk more about that. But with that, Ashton, thank you so much for your time and you have a lovely day.
Thank you. Same to you. Thank you. Thank you, guys. Best of luck. Kill it.
Thank you so much.
Thank you so much, Nidhi. Thank you so much, Ashwin sir. Next up, we have a session with a very eminent person who's a member of our community and is going to talk about her journey with PCOS. So, Jain is an HR professional who is diagnosed with PCOS. She got diagnosed back in 2015 and she's here to share her story with all of us.
Welcome, Surbhi. I would request you to put on your video.
Can you see me, Nidhi?
Yes, I can. So welcome, Surbhi, to everybody who's watching us. We've been doing a lot of sessions with the experts. And as a community who's going through this condition, who's trying to absorb everything that we're talking about, it is also very, very inspiring to hear the real stories of how it actually, is living with this condition. I don't want to call words like we're suffering from this condition or we are really like going through a disease, because this condition is going to stay with us. And to look at more positively, we have people like Surbhi on our communities who have, been part of our community very actively, consulting experts, sharing her journey constantly and being very consistent. So I want to take this opportunity for Surbhi to present her story. Surbhi, you have about 10 minutes to share your journey so far, right from your diagnosis to how you have been managing so far. What are your goals and what have been your achievements so that our community can get more inspired? Over to you.
Yeah. Thank you, Nidhi, for giving me this opportunity to share my story. So, from the birth, I've been an obese person. So from then, my mother used to consult a doctor that why she's obese, and since a child is obese, so parents already have certain problems already there in their head, that might be she has some medical issues. So she used to take me to many doctors. Okay, that what is the reason that why she obese and all, and they used to do certain blood tests which were normal for me. Okay, eventually what happens was I started my school, and then I hit a puberty. So at that point in time, I also started my periods, and my periods were irregular from then. At that point also, I used to my mother used to consult many doctors and try to find out that what is the reason. Again, her periods are irregular, then reports used to come normal, but then doctor always used to advise me that go with a hardcore exercise, इससे घर का काम करवाओ, इसको कम खाना दो, that way. And I was too young. So at that point I had these body shaming issues. Also at that point, clothes didn't used to fit me, so that was also one challenge that I faced. Things were going on. Then I joined my engineering college again with the friends group and all. I used to eat junk. I used to have I used to indulge in lot of uh, junk foods, and I so things becoming worse at that point of time. After my graduation, that was in 2015, I was diagnosed with PCOS. And at that point in time, my mother consulted one doctor, and she has putted me on 6 months of contraceptive pills, along with metformin and other tablets. At the same time, to reduce the weight, I was also taking this some supplements. Okay, and eventually, what happened was my blood pressure, it shoot up. It was beyond 190. At that point in time, again, I immediately stopped all the medicines, but just it was always in my mind to reduce weight, because our society is like this, that people used to tease you if you are obese. And from the very beginning, like from a very young age, I always have this thing कि ये तो मोटी है, इसकी तो बीमारियां लग जाएगी, that sort of thing. So I always had this thing in my mind to reduce weight. Then what I did was I did extreme dieting wherein I was not including carbs at all. I was only eating plant based, and and all this paneer and all. No, and some I also did a water fast. Okay, now that point, what happened was there was a lot of nutritional deficiencies that happened, and I did it for 2 years. Then I went to a MBA college in 2017, and again my all dieting and all it stopped because the food they used to offer was completely different what I was eating, and again I started putting off on the weight. My PCOS problems start becoming worsening, and I had acne all over my face. My stress level went up like anything. I had sleep issues. Then, to again reduce my weight and to get back on track, I have again consulted a dietitian after my MBA. Then this dietitian has given me certain diets, but although weight was reduced, but things were still worsened up. Okay, I had a bloody stools. We can call it piles. Okay, I mean I was highly constipated. Entire face was full of acne. Extreme case of this mood swings. I was feeling good one day, not one moment, and bad another moment. Then every day I was either I was overeating or I was binging, and then I had this guilt that I have eaten a lot. These 6 months were terrible. Then in 2020 August, I stopped her diet. Again, I was trying to cope up with things, but I couldn't. Then in 2021 January, I come across PCOS Club India, wherein I have taken a help from a healthcare team of this community. They have suggested me certain lifestyle changes, like to replace a food. Also, they have asked me to do certain medical tests, which I have done, and according to that, they have suggested me supplements like inositol. My vitamin levels were very down. My B12 level were down. So certain supplements on the basis of that. Also, they have insisted me to work consistently, which I was not doing earlier. I was completely on diet. Okay, so I have started my workout. Then lifestyle changes, not to have a dairy. Okay, that has also improved a lot. But now I can say that I don't have a body shaming issue. It's been almost an year, and I'm totally a different personality. I don't My stress levels have reduced a lot. They are I barely have any stress right now. Okay, and my sugar cravings have reduced a lot. Then my energy levels are really super se bhi upar. I don't feel lethargic at all. Even if I'm working whole day, I'm running all day, I don't feel lethargic. The, Still, I'm working on my period cycle. They are little irregular, and I have certain acne on my chin. I'm working on that. But if you see the cheek acne and all have reduced. So they are. I mean, this journey has been really amazing. These 8 months have been really amazing. At the same time, I was struggling every single day to be on track because the food we are used to eat in our homes are little, we need to have a little different diet. But these all efforts were really worth it. I have certain takeaways which I would like to share. One is that the one who wants to improve a PCOS, that person should seek a right guidance, because there are thousands of platforms promoting this PCOS helping. But you should see what that practitioner has actually done, and also the experience that person has. So that is very important. The second thing, your efforts and your discipline should be 100%. every single day, because you will be coming across a challenge every single day, and you have to overcome that challenge. So your effort and discipline. Now, do what makes you happy in terms of the workout. It could be a dance, it could be a gym. There are 100 ways. Just don't go with the people saying that go to gym or go to this, and please don't do that. Do what makes you happy. It could be yoga, it could be strength training, it could be Zumba, anything for that matter. And also, I personally don't like these fancy foods or expensive foods. I'm a person who eat local and think global. Okay, so easy to cook food, because I have come across many questions like foods which are being suggested for a PCOS lifestyle is little bit expensive, but I don't support that. I take normal food, home food. It's just that the ingredients are a little different, and these are very very available at our own home. So please go with that. And it's absolutely okay, which I have observed. It's absolutely okay to have sugar cravings or going off track some days. Absolutely fine. Please don't find a guilt around that. It's okay. Now, one more thing to add here is there are thousands of platforms that are promoting weight loss and PCOS recovery. Because I got trapped in one of those. That's why I'm telling. Don't go with the presentation they are doing. That okay, somebody is asking question. I'll take that. What they are showing on their pages, but try to get more insight about that particular person, the experience that person has. So that's all about my journey.
Sylvie, thank you so much for being so courageous to talk about your journey. I remember when you came to PCOS Club India earlier in the year, like a few months back, you were a different person. You were not ready to talk about your struggles, and definitely there has been a lot of change in how you've come across speaking about it so openly. So it does mean that you are able to overcome these, and there were really difficult battles that we together fought. I remember you calling and just asking for help. I feel it just makes it more beautiful when you have somebody to guide you, and this is the whole point of having this community with the support groups. We have our website that we are actively promoting. By the end of this month, we'll be fully functional with all our support groups and all the resources. But Survi is one of many people in our community who have benefited from our resources, the recommendations that we have been sharing. And it all depends at the end of the day to you as an individual, how you are able to make that change. And we can't have an easy answer to that. As we learned from Surbhi directly, that jumping on a weighing scale and looking at the number to go down is not your goal. Your goal is to balance your hormones, and weight or any kind of goal is just a subset. So with that, Surbhi, I would like to thank you again for being courageous enough and sharing your story. There were a lot of people who shared love on our streaming platform, and there are a lot of people who are sending positive vibes your way. With that, I wish you all the very best, and thank you for being a very active community member with PCOS Club India.
Thank you so much, Nidhi. Thanks a lot.
Thank you. Have a great.
Thank you so much, Nidhi ma'am. Thank you so much, Surbhi ma'am. We're really sorry for what you had to go through, especially about the body shaming part, the acne shaming part. You're really strong for having the strength to fight through all of it. Next up, we have Miss Ishi Khoshla. Miss Ishi Khoshla has been an active clinical practice at the Center for Dietary Counseling in Delhi, where she deals with a wide range of nutrition-related health problems, including obesity, PCOS, diabetes, cardiovascular diseases, food allergies, digestive, immune system, neuropsychiatric, and endocrine disorders in adults and child. She founded Whole Foods India, first health food company, initiated Celiac Society of India and launched www.weightmonitor.com, the first of its kind in India, a fully online weight management program. Ms. Khosla, we welcome you to the summit for 2021. Thank you so much for joining us. The details of the agenda are on the left side of the screen, along with the helplines, which are at the bottom of the screen. Thank you so much.
Thanks, Olapriya. We're just waiting for Ishi Khosla ma'am to join in. And till then, Ishi ma'am, are you
Okay, that's all.
I think Ishi ma'am is facing some audio issues. Team, can you check, please? Hi, Ishi ma'am. Are you there?
Hello,
Ishi ma'am, can you hear us?
I can hear you now.
Great. Thank you so much. I'm not sure if you were there while the introduction was made, but
No, I'm sorry I wasn't there, but that's okay.
Okay, great. So we did tell our audience that this is a very special section where you're going to talk about gluten, where in our community the conversation is all about going gluten-free, and let's hear the evidence. And no other than you, who are president of the Celiac Society of India, and your immense work, active clinical practice, and so many years of work around the subject. Thank you so much for making time out of your busy schedule to join us.
Thank you. Thank you so much, Nidhi. Thank you for having me. It is an important area.
Thank you for being so comfortable.
Yeah.
The format of this segment is going to be a Q&A as the questions we had presented to you earlier. There will be a segment of people asking some questions. So I'm going to dive right into the questions, and then we can see how we want to address the questions. I hope
that's perfect.
Okay, now speaking about PCOS as a chronic condition, what is the science behind gluten intolerance and PCOS? There's so many people who say that there is no science behind gluten and it is all a marketing gimmick. While there are people in our community living with PCOS saying that we feel better when they leave gluten. So what is the science, first of all, behind this theory?
Well, first of all, anybody who says that there is no science around it needs to read up the literature. Having said that, this is a relatively new area and an evolving area, which obviously is not, it's not a part of medical textbooks yet, and obviously not a part of the training conventionally that is given to medical professionals. So yes, it is not, the whole issue of gluten, gut, and the issue of inflammation. These are relatively newer areas of conversation in health, and therefore the confusion, the chaos, and the kind of, I would say, poor compliance on these issues. So I see it all the time, and the science is actually pretty clear, and it's been almost, I would say, 15-20 years since this is happening. And let me tell you another fact about science, that anything which is a new sort of a discovery or a hypothesis or a theory, whatever the new aspects of any kind of disease emerge, that science takes about 17 years for it to come into mainstream. So if it is 17 years, you can imagine that we are just about having these conversations. So we'll have to wait for some time. And hopefully today, with technology and the way things are moving, pretty rapidly, information is being shared at a, just at a click of a button. That's all viral. So I think this 17 years should be a much shorter time. But certainly this is there. It's a science which needs to be understood at a different level. So far, most diseases have been addressed as specific organs. If it's ovary, so let's look at the ovary, the reproductive organs. Let's look at heart when there's a heart problem. Let's look at the joint when there's a joint problem. If you have asthma, you look at the lungs, and you look at the hair when it's a hair problem, and you don't go beyond into finding out the root cause. We just treat the organ itself. Today, so many women, men and women are suffering from thyroid disorders and autoimmune problems. So we just look at that gland and say, okay, now this is what we need to do, supplement or, replace the hormone, and that's your fix. But where and why is this happening, and why the numbers are growing? Specifically to talk to you about PCOS, when we were young, when we were in those years, 20s and 30s, we had not even heard of PCOS. And if we had, it was post our 30s, where it was the obese woman or the obese girl who was suffering from polycystic ovaries. It was not something which was known. It was an odd exception. And today, if you say, if data is to be believed, it's 1 in 4. It's huge. The burden is huge. So something is triggering it, something is causing it. So we just can't treat it without looking at where it's coming from. And that's the fatal mistake that's happening, because when you just treat PCOS with hormones and the usual pills which are given, we are really not treating the problem. We are in fact making the body more and more vulnerable to other problems and their side effects. So certainly the whole issue of polycystic ovaries needs to be understood from the root cause. And the science is clear in the sense that polycystic ovaries, like most other conditions today, is an inflammatory condition. And the inflammation is coming right from the gut. What is the connection with the gut? The gut is disturbed. That means when I say the gut is disturbed, it is the microbiome in the gut, which is the gut flora, which is literally an organ in itself. But these live creatures who we cannot see with the naked eye, they are 10 trillion. An average person has that many microbes, and these microbes also have their own genes, their own 150 times more than the host. Now, their genes, these microorganisms, along with the host, that is our genes, they interplay, and the good and the bad bacteria, when there is an imbalance, there is a problem. It's what we call dysbiosis. And that is what causes the inflammation, and that is what is causing several problems, including what we call a leaky gut. And when we have the gut lining, basically it's like a cheesecloth. When that becomes porous, it leads to a whole cascade of further inflammatory reactions. So the science is now pretty clear, and there is something what we call the estrobolome. The estrobolome is nothing but the microbiome which is connected with the production of these hormones like estrogen, etc. And like that, there are many more. Now, when there is dysbiosis, which means an imbalance between the gut and the good and the bad bacteria, this estrobolome is disturbed as well. And obviously, it is it's common sense to believe that there will be an imbalance, and that's pretty much what happens in PCOS. There is a hormonal imbalance. We have an excess of the male hormones and the the deficiency of the female hormones, and that plays up into many other symptoms and manifestations, which is what we call polycystic ovaries. So the connection with the gut really gives us the answers, and therefore whatever disturbs the gut microbiome, whatever disturbs this balance, is going to disturb the balance of the hormones. And gluten has been one of the most I would say important and the most common factors which we find as disturbing the gut microbiome and causing the leaky gut and further inflammation. So what is wrong with gluten and why it was not causing a problem earlier is a very common sense question which comes out of this conversation. And yes, I can answer it maybe in due course of this session. But certainly the gluten is one of the key factors, along with a genetic predisposition and along with other lifestyle factors, which are the other things like the processed food and the chemicals and the environmental pollutants. All of these add up. but certainly the role of gluten and is critical.
Ishi ma'am, this is very, very helpful. Could you also give a very brief view of what is gluten and where do you really find it before we get deep into our conversation?
Well, gluten is the storage protein of wheat, and that has always been a trigger for certain kinds of people, which means what we call celiac disease. It was known to have immunogenic properties, and these immunogenic nature of this grain can also cause what we call wheat allergy. But celiac disease and wheat allergy are very well-known entities. There's nothing new about them. So 1% of the population suffers from celiac disease, and in celiac disease, we do find women who are not able to conceive, miscarriages, and frequent, issues with the reproductive, with the menstrual cycle, are all very closely associated with celiac disease. However, the new form of wheat sensitivity, which we are seeing today, is in the absence of celiac disease, and to that, the common question is, oh, you don't have celiac, then how come you are gluten sensitive? So, well, that's what we call non-celiac wheat sensitivity, which is bothering most people today, because when we changed the wheat in the perhaps in the 1960s, there was a green revolution. The chromosomal changes which happened in wheat made this immunogenic grain in itself even more immunogenic. So there was a shift from what we call a diploid to a hexaploid variety, etc., etc. Now, we cannot go into that science right now, but all we need to know is that wheat itself has changed. It was an immunogenic grain to begin with for certain people, and when you tamper with it, it has become even more immunogenic to certain people who are particularly genetically predisposed, or they already have a leaky gut for other reasons. Either they've been very sick and taken too many antibiotics, or they have other reasons for feeling, the leaky gut, and then it hits them harder. So certainly wheat storage protein is gliadin, and gliadin is the protein, the part of wheat gluten, which causes the biggest problem. And according to research, no human really digests gliadin completely. It's not broken down by anybody, and that's what causes a leaky gut in every individual. But in a person who is healthy, who has a robust immune system, this leaky gut gets corrected. It's a transient phenomena, and it gets corrected. It doesn't bother people. But when there are other issues, this becomes a problem, and then the whole cascade of reactions begins. I'm unable to hear you.
Sorry. Thanks, Ishi ma'am, for that explanation. And I think a lot of us could relate to it, that you may not be celiac resistant, but you may be gluten intolerant, and both mean different things. Now, could you help us understand, are there any tests that can help us diagnose this sensitivity? And also, can tests be negative and you may still have gluten insensitivity?
Yes, that's a great question, Nidhi, because before you go off gluten, it's desirable that you rule out celiac disease. So there are good tests for celiac disease which are fairly reliable. And if you have other symptoms like anemia, or the other autoimmune problems, or skin problems, or hair problems, or whatever, so do rule out celiac disease before you go off wheat. The other is, okay, if you suspect, if you have been diagnosed with PCOS, you don't have wheat and some other grains I'm going to just tell you about, and then see how you feel. And then, you can decide if there was any difference or no, and then take it forward, and then go to a qualified professional. The tests for non-celiac wheat sensitivity are very, very, they're non-specific and not very accurate. However, it's called the IgG food intolerance test, and that test is now being done in India very, very freely, and there are Indian companies who are doing it, and then there are these German labs who are being represented in India. So we can get these tests done. The IgG delayed food intolerance test can give you a fair degree of information about your sensitivity, but a test having a negative result does not mean that you don't have it. We do have many times cases where the test is negative and yet we know the problem exists. So then you need to correlate your symptoms and your other markers, and then go through a professional consultation with somebody. And the best is to just go off for a few days or a few months and see how you're feeling, and then you reintroduce it and you see how you feel, and then you'll get your answers. And so I think that's pretty clear. There are really, the food allergy is not what we are talking about. So for polycystic ovaries, etc., we can very easily do it with tests. But it's like the virus, the COVID virus. Sometimes you do the test and you have a negative, and sometimes you have a positive, and it's so there is, these contradictions are there, and you have to correlate clinically.
Great. And I guess when we move on to the next question, it says that how do you understand that you're gluten intolerant? I think you already explained. But does everybody have to leave gluten if they have PCOS?
Well, for sure, if you have PCOS, you are reacting to wheat, and I see that in almost every patient. And I'm going to give you two examples here. I had a patient who came to me for weight gain. She was gaining weight, and she wanted to lose weight. She was in her 30s, and she had not had a period for 3 years despite being on the pill. And she was, really, she got used to the idea of not having a period. And she was, because of this pill, she was bloating up and becoming bigger. And the doctor kept telling her, you have to lose weight to correct the insulin resistance that is developing. And therefore, she had come to me. And in the first week, we changed her flour. And it was just a flour. We've had a low glycemic index flour. We gave her a chane ki roti and whatever. And in her next visit in 10 days, she came back and she said, I'm feeling much better. And of course, I'm having a period. I said, what? You're having a period? She said, yes, for the first time after 3 years. She's saying, I said, so can you make some correlations? So she said, oh, does the diet have anything to do with it? I said, what would you imagine has happened? So she said, oh, I thought the pill has started working. So that is how profound the effect is. And she had done nothing else. We had just given her a few supplements. So 3 years of amenorrhea and 1 week, and she got her period on the 10th day when she came to me. It was something so clear. And this is one of the most dramatic ones, when you don't have. So, but usually 6 months down the line, you don't have a period, and you just change the diet and everything just changes. Then, of course, a lot of other things for her got resolved. She had digestive issues and nail issues and hair problems, and all of those got sorted out. Recently, one of my nieces was just who told me very casually that, and she's ultra thin. She has no weight problem, ultra thin. And she said, I've been having a pill for the last 8 years. I said, why? Why are you having a pill? You have been here. I'm helping patients get off there. So, but my doctor has told me, etc., etc. Anyway, I got her to follow the diet, and I said, you have to get rid of the pill. But she says, how will my acne behave? I can't afford acne, and it'll all come back. And I said, nothing is going to happen. Just do what I'm saying. And I put her off some grains. And after about 9 months, she's got an ultrasound done. And the doctors told her, I have never seen this kind of a picture in your entire history of ultrasounds. For the first time, you're making eggs and there is a 0 cyst. And she was off the pill for all these months. And today she believes that this is possible. Now, what is the way forward for these girls? What do they do in future? Do they have to remain like this? When certainly, if they have to address gut health, they have to understand that it is critical to eat foods which work for them. And any insult to the gut microbiome will mean an insult to their immune system and to increasing inflammation. So if you are able to heal your gut, if you're able to correct the balance and maintain a good nutritional status, we can only guess that things should be all right. But if it doesn't work for them, then it is for life. And my experience says that mostly women who are sensitive to wheat or are reacting to wheat, usually whether it's even other conditions not concerning PCOS, the sensitivity remains, and the guidelines are not there so far for these conditions. But like celiac disease, where you have to have a strict elimination for the rest of your life, it is pretty much the same in PCOS. But like I said, this could be case to case, and maybe if you've really healed your gut and you've really done some specific treatments for your colon, maybe that it's transient and you can go back to eating it, but that's theory.
Thanks, Ishi ma'am. What are the advantages? Okay, so we talked about the advantages, but what are are there any downsides of reducing gluten? Do we have to do this all our lives? And what is a sustainable approach to going towards gluten-free grains, as you have mentioned, that you usually prescribe to your patients? So could you give us a view about the approach?
Yes, Nidhi, that's a fabulous question again, because just elimination is not what we're talking about. We need to get into what we call a healthy diet which includes plenty of vegetables and plenty of good fats in nuts, in seeds, in coconut oil, in mustard oil, in olive oil, in butter, in ghee. All of these are good fats. So reduce your carbohydrate intake, reduce the high glycemic carbohydrates, which include rice and alternative grains. They're all mostly high glycemic. So reduce the grain intake, improve the choice of your grains, lentils for that matter, whether it's besan or whether it's chickpea flour, kala chane ka atta, or whether it's any moong dal atta. All of these are low glycemic, high carbohydrate, high protein flours. So these are what work for people like who are sensitive. And mind you, it's not only about gluten, it's also about insulin. It's inflammation and insulin. So you need to work on correcting insulin resistance, because that's one of the first things that happens with PCOS. And therefore, whether you're thin or you're overweight, if you're lean or overweight, you need to cut down on sugars. You need to, plan a diet which is with controlled carbohydrates, better selection of carbohydrates, and lots of vegetables, some good fruits, but not too much of fruit, and good fats, and adequate protein. Things like lentils, sprouts, all of this are also protein rich. Even quinoa is protein rich in its as a grain. And then you have all the, things like fish and chicken and eggs. But dairy can be questionable. Certain people, maybe too much dairy will worsen insulin resistance for sure. So too much dairy is not an option. Controlled dairy, and some women who have acne, etc., dairy can be counterproductive. So dairy will be a case-to-case recommendation, and maybe a certain quantity is tolerated, and at certain points nothing is tolerated. So it depends on who you are. But the other factors are extremely important, and only then you will get the benefit of elimination. And it's not only wheat, certain other grains also mimic what we call molecular mimicry or cross reactions. So a lot of other things cross react, like soy, like your corn and amaranth, which are a part of the gluten-free offerings, but they usually don't work very well for people with gluten intolerance.
Oh, that's something new that I learned today. Very, very insightful. And you said that, I wanted to ask about, is it something that we have to do this all our lives, or is it an elimination protocol? Do we bring wheat back? The reason why I ask is that people with chronic conditions, especially PCOS, often also go through eating disorders with a whole restrictive diet culture that it can come along with, especially when you see a calorie deficit diet or an aggressive weight loss culture. My question is coming more from that standpoint, that obviously I would like to talk about these disorders as well, but do we have to do this all our lives? And if there's any sustainable way to go about it?
Yes. First of all, I would say you must seek professional advice if you do have any of these conditions. Number one. Number two, it's important to realize that the gut is not only all about hormones and the immune system, it's also about mental health. The nerve center is located in the gut. So it has, in fact, scientists are today calling it the second brain. And most of the happiness hormones, which like serotonin or dopamine and tryptophan, there are many hormones which regulate our mood, melatonin. These hormones are basically secreted in the gut, mostly not in the brain. So this is one reason why I would say eating disorders could be stemming from a dysbiosis, and it usually is a reflection of a mental health issue rather than a just an eating issue. So once you go deep dive into the gut, you are able to manipulate these areas, and you will find women who are depressed or have OCDs or other anxiety problems, all of those getting corrected also. So, so certainly once you deal with the gut and go down to this, form of healing, you will be getting the benefit from for other conditions as well. So eating disorders can be perhaps, resolved, or at least what we call a multidisciplinary approach. So with psychological counseling and with nutrition intervention can be treated. So, and let me tell you something about the risk. You're talking about the deprivation or the fact that you are not eating these grains and feeling depressed. That's not true. The sense of well-being is so much enhanced, is so powerful, and is so compelling that you don't want to eat something which is wrong. So it's not that the taking away of those grains is causing the eating disorder, but it's the other way around. It's the grains themselves which are the culprit, perhaps. And I do see that in my practice.
Thanks, Ishi ma'am. Very insightful. What are these eating disorders? Could you share a bit more light, very briefly, if people would like to understand that more?
Well, the most common eating disorders include anorexia nervosa and bulimia. And then there is orthorexia, etc. But essentially, these form, they are extremes forms of eating, where either you just don't eat, or you eat too much and then you give it, you just vomit it out. So those are what we normally see most commonly. And there is a huge role of mental health in this, and body image issues, etc., etc. So yeah,
I'm sure, like, if anybody would like to get more information, definitely to seek an expert, mental health expert regarding this, and of course a nutritionist and somebody like Sheila, who's practicing these at Delhi, if you need more information. So Ishima, with that, we jump onto the Q&A window. We have about 10 minutes, so I hope that's fine with you.
Yes.
Okay, so first question which has come up is, so there's a member in our community. She says, I've been consuming thyroid tablets for nearly 12 plus years, and I have regular periods. Later, I have developed a chronic condition, psoriasis. It is really stressing me. I don't know how to manage both, especially diet-wise.
Yes, the psoriasis is just telling us that you are developing autoimmune problems. Thyroid is already one, and the psoriasis is the other. So you certainly are a candidate for testing and for taking food supplements under supervision. And let me tell you, we see these problems every day, and these are very treatable through diet and exercise. And I think you should seek help.
So we've already answered questions on the presentation regarding getting tested for gluten resistance. So I'll move on to the next question is, could you please mention some of the low glycemic grains, alternate rice and wheat?
Well, I have already mentioned lentil flours, moong dal atta, you have chane ka atta, chane ki dal ka atta, which is besan, and then also you have quinoa, which is low glycemic. And then you can make your flours low glycemic by also adding nut flours like almond flour. And sometimes you can just add vegetables. So if you have 50% atta and 50% vegetables, also you can change the glycemic index of the chapati.
What is your view on bajra, ragi, jawar? And you recently said that amaranth may mimic the way wheat does. So what is your view on that?
Well, bajra, jawar are millets. They have a high glycemic index, but they have no gluten, so they are definitely a part of the offerings. But if you are severely sensitive, just make sure that whatever you buy is ground in a dedicated flour mill and not in a contaminated flour mill, which is also doing wheat, because you're bound to get traces of wheat, and then you never get your symptoms 100% clear. So these are wonderful grains, and they have extra good fiber. They have extra nutrients, like in ragi, you have more calcium and iron. And they also, because they don't have gluten, they help in the absorption of other nutrients. Otherwise, with this, like what we have a leaky gut, with wheat, we have a severe burden of deficiencies and malabsorption. So when you move to alternative grains, you do, so the grain may be as nutrient dense as wheat, but it improves your ability to absorb nutrients because of the fact that it's not got gluten. So these are good grains, but if you are trying to reduce the glycemic index and correct insulin resistance, mix something with them. Mix vegetables, or mix some your other grains, lentil flours and besan, etc., etc.
Great. We have a question from Kanika. She says, what about the phytate content on lentils? How do you reduce that?
Phytate content is something you really can't do very much about, but as long as you eat healthy, but certainly to some extent, soaking helps in reducing what we call lectins, which are anti-nutrient factors as well. And they can also be, causing digestive problems and hitting your, causing inflammation in the gut. So that soaking the grains and soaking any lentil certainly is a good way of consuming it.
Somebody asks, can you suggest somewhere we can get the test done for the food intolerance? There are many available. So Chehek, you can go onto the PCOS Club India website and book a test. There are a couple of options where you can do food tolerance test, and you can definitely avail that. Ishi ma'am, what's your view on the soya flour?
Well, again, soya is a wonderful food. It's high protein and wonderful isoflavones and great benefits. Unfortunately, it has the same quality of molecular mimicry with wheat. So for those who are trying to get off this, it also goes off the charts.
Great. There are a lot of questions on the millets, like little millet, foxtail millet, barnyard millet, and all of that. Are generically millets, are these good options at all?
They're very good options. Okay. But combine them with some lentils, it becomes even better.
Great. How to know that you have an eating disorder?
How do you know you have an eating disorder? Then you just don't eat normally. You will know that your relationship with food is affected. So either you fear food, or you're all around food, and then you take it out. So you also will have body weight issues. You will become extra thin. So when your relationship with food is affected, I think it's time to look at an eating disorder. Too many extremes with food.
Absolutely. We'll go with the next 3 questions before we go on to our next segment. This is about oats, and this is very debatable when we read about oats as well. Is it gluten-free at all? And is it a good replacement of other flours?
Well, oats again is a very good food. It is low glycemic, lower than the others, and great fiber. But in my experience, it hasn't worked well with people who with gluten intolerance, even though it's gluten-free oats. It doesn't hit you as hard, but it certainly, for people who are struggling with their issues, removal of oats really helps. So I am tempted to believe that it also cross-reacts.
what are the symptoms really that tell you that you are gluten intolerant? What are the main key symptoms you can look out for?
Just about anything, Nidhi. Just about anything, head to toe, from hair, nails, eyes, to skin problems, to digestive issues, constipation, reflux, joint pains, breathing issues, autoimmune problems, fatigue, um, just having low energy, mood swings, depression, anxiety, panic, sweaty palms, you name it. There are too many for me to list here.
Yes, but personally, I can say when we talk to our community, the bloating aspect, fatigue, energy levels, these are the first.
Digestive issues, but digestive issues may not be there. So you may have symptoms outside the gut. So many people say, oh, I can't be having a problem with wheat because I have no problems in digestion, but that's sometimes not the case. But you could be suffering from constipation and not calling it a digestive issue. You may be having reflux, you may be having acidity and taking antacids and feeling normal and forgetting about the fact that, yes, it is a part of your digestive problems. So it could be IBS related symptoms, but you may not have digestive symptoms at all. And sometimes not being able to lose weight or not being able to gain weight are also signs of gluten problem.
Yeah, so until and unless you don't eliminate, you would not know it. And that's what we've seen most of the times. We are reluctant, and once we see the results is a confirmation. So
yes, and neurological problems, you huge bunch of neurological problems, and then psychiatric and psychological issues in women. There, I spoke to you about the depression angle and the brain fog and concentration, inability to focus. All of these can be signs.
absolutely. And I think when we are digesting any information relating to gluten, because there is so much of information these days on the social media, which can be positive and negative, always believe the science, learning from Miss Ishi Khosla herself, who's the president of Celiac Society and with vast experience in the nutrition world. I think wherever there is an evidence, that is what you must believe, because everybody has a different experience. So it all depends on what's working for you. So that's the advice that I would like to give along this information. So second last question is, can we get multi-grain flour, or you suggest just a single grain?
As long as the grains are compliant to the grain science, which I just shared with you, that's fine. But if the multi-grain flour has the grains which are not good for you, that if it has soya and if it has amaranth or it has oats or corn, then it's a problem. So you need to know what is going into it.
Great. There are a lot of questions on the diet and what is the best time to have food. So you'll be happy to know the next segment is with Vinita, where we are cooking live and it's going to be everything about the food. So you might want to just stick for another few minutes. Last question, Ms. Ishi. How do you heal gut dysbiosis? Is it through diet or medical interventions?
Well, medical interventions only if needed, but that won't heal your gut. Anything to do with medicines or chemicals are going to be something which are counterproductive. They're not going to heal you. So you have to get away from chemicals and you have to get away from meds unless you're very sick and there is a problem we can't deal with. But certainly healing the gut means getting rid of the trigger foods and then adding the supplements back and restoring the gut flora. So it's 5 steps which happen. So we regenerate, restore, rebuild, and all of that is part of nutrition, diet, supplements, and also lifestyle, which means positivity, yoga, meditation, and physical activity, and sometimes even fasting.
Okay, great. So with that, we're at the end of the session. Thank you so much, Ishi ma'am, for taking time out from your very busy schedule. Thank you for being so down to earth and humble when we approached you. And this means a lot to us from our community. So thanks again for giving your precious time to us today. And I hope we could implement all the good things that you said. Any last words that you want to say before you leave for our community? And if somebody wants to approach you for consultation, how can they come along?
Oh yes, I'm. My contact is pretty easily available, and you can write in to me on an email or contact the numbers that are there on my website. And there are books which you can pick up. Eating at Work by Simon and Schuster. That's the latest one. And then Is Wheat Killing You was one of my first books. The Diet Doctor talks about insulin resistance. So the first book actually I wrote was on cholesterol, which is not the subject today. So you can go for Is Wheat Killing You was the first book dedicated to wheat sensitivity and explaining all the dimensions of it. Then it was a Diet Doctor, which talked about insulin resistance and metabolic syndrome, which is very much a part of what we are talking about. And the third was this Eating at Work, which is a combination of everything put together. So do pick up the copies, and it will give you not only information but also recipes and practical tips. And for your customized solution, the idea really is the last words would be, you are unique, and one man's food can be another man's poison. So don't paint everything with the same brush. You need individualized approach in making a difference to your health. So you need to customize these solutions. And so if you do suspect something which is wrong with you, then seek professional help. And like I said, if you want to do self-help, you can begin with self-help and then take it from there. But don't ignore these things, because these are only signs and symptoms that the body is telling you that there is something wrong. And then once you don't address it, it can manifest in ways which are very, very different, which you may not want to know. So it's inflammation at the end of the day, and work at it. And trust me, it's today is a time where there is so much conversation on this and so much available in terms of alternatives, that it's not a very hard road to walk on. It's far more easier today. The path is easier, and with alternatives and help out there, and everything. When maybe 2001, when I started Whole Foods, it was we were probably the only ones who were making gluten-free food. But today there are, you can see on the Instagram what all is available. So today it's a an offering which was like never before. So don't have to stress about it. And you have to I would just say, just with one line, that eat the food that you love. Of course, we all love food, and it's a very happy relationship with food. It doesn't have to be fraught with guilt, and it doesn't have to be fraught with fights with your willpower. But also eat the food that loves you. So that would be my last takeaway.
That's a beautiful message, Ms. Ishi, ma'am. And thank you so much for your time. I know you've been speaking while you were riding in your car. So thanks for making the extra effort to be on this session today. And
My pleasure. Thank you for having me, Nidhi.
Thank you, ma'am. Thank you so much.
Welcome.
With that,
Thank you, Nidhi, ma'am.
we are ready to dive
Now, before we go
into the next
um,
and can I request Vinita, if you're online, if it's okay to take a 5-minute break while we dive into your session?
Absolutely, yes.
Okay, great.
I hope I get the 5 minutes later, though.
Yes. So in
Yes.
5 minutes, catch you. Thanks, Olapriya. We'll take it in 5 minutes.
I think we have reverted from the break. So before we start the next session, this session is sponsored by True Elements, which is a healthy food brand, a world which promises and claims aren't made out of lies, half truths, and bargains, where 100% taste is achieved with zero chemicals, preservatives, and zero added sugar. Our brand has the core communication anchor of food that does not lie to you. With that as our sponsor, we also would like to welcome Vinita ma'am. Vinita ma'am is a holistic nutrition and lifestyle coach. She's certified holistic nutritionist from American Fitness Professionals and Associates US and has completed the plant-based nutrition certificate from E. Cornell and T. Collin. Campbell Center for Nutrition Studies, New York, US, as well as other courses in wellness culinary, nature cure, and Ayurvedic diet. She's been featured several times in publications such as Mumbai Mirror, Midday Asian Age, The Hindu, Hindustan Times, Vogue India, Vegan First, LBB, etc. Vinita offers nutrition and lifestyle coaching programs which focus on various aspects of health, such as providing a sound health and nutritional foundation to all of our clients, reversing lifestyle diseases such as cholesterol, hypertension, diabetes, obesity, PCOS, and thyroid, improving overall health and energy levels, preventing health problems from appearing in the future, and improving autoimmune conditions and gut issues. You can read more about her on www.vinitacontracted.com, which is her website. For more details about the agenda of this session, please look at the left side of your screen, and for the helplines as well, which is at the bottom of the screen. This session will be on secrets to daily hassle-free cooking for PCOS.
Thank you, Olipriya. A very warm welcome, Vinita. Vinita and I have done a lot of work before in this community, talking about cooking, talking about lifestyle changes when it comes to PCOS. This is not the first time Vinita is coming on board, and with the response that we had in our earlier session, it had to be her again, of course. And with the vast knowledge that she's attained, having gone through a lot of problems in her own life, coming from personal experiences and the science and education that she went on to pursue, all of this comes together very beautifully the way she coaches. So very warm welcome, Vinita, to the first ever PCOS Summit, which is patient focused, and we talk about in this segment everything about food, which is the much demanded session where we're going to talk about reading the food labels, cooking for your family, and cooking for yourself when it comes to PCOS. So very, very excited for this session. So very warm welcome.
Thank you, Nidhi. Very honored to be here and so delighted to see such an event come together. Yeah, very glad to be a part of the PCOS Summit 2021.
Great. So I just want to highlight again that this session is brought to you by True Elements. True Elements is a fantastic product, a fantastic brand, which is bringing some really honest products, and they're also available on our sponsored lounge for exciting offers that they are currently running. This couple of things that we will which Vinita will be also telling, very beautifully aligns with what the brand is doing. So very excited to partner with True Elements. Thank you so much for helping us putting this together. And with that, Vinita, I'm going to give you the reins. This is your session, so I'm gonna put my video off and please take it forward.
Yes, so do we have an idea of how many participants we have at this point?
There are close to 50 plus, but I think we're just seeing the change in that. We have a real-time data as of now, but yeah, this is what.
Just so that I could welcome people and kind of see their faces if they were here. So I think I'll just get started because I have just an hour and I've been given a tall task of covering many, many topics. So I'm going to try and do my best.
It's interactive, guys. So as we have been doing, pop up your questions, and Vinita, we will keep sharing that. Olipriya will be keeping you busy with the questions. So as and when you want, you can keep answering them.
Sure. I need to be able to share screen.
Okay, are you not able to yet?
Not yet.
Okay, I will try to make you a co-host. And,
So while Nidhi is doing this, if there were more people, I would have asked from where everybody was joining in. So if you hear this recording later, please share with me.
But yeah, people can put in in the Q&A window, people can put in where they're joining from.
Okay.
Can you share your screen now? Are you able to?
Yes, I'm able to.
Okay.
So that's our session today. And honestly, I'm going to be covering so much more than just cooking because there are lots of topics that the subtopics that are there. So I'm very happy to be here with the PCOS Club on the PCOS Summit. This is just a little bit about me. I've already been introduced, so I won't waste my time. This is just some of the training I've undertaken, some of the media features I've had. And this is what I do, work with people on a one-on-one basis for weight loss, for disease prevention, and reversal of lifestyle diseases, as well as hormonal diseases or autoimmune conditions. So PCOS, thyroid, diabetes, cholesterol, hypertension, all of that with the power of nutrition and lifestyle changes is what I work with primarily, and something I really love because I love seeing the personal journeys of each person. I have a e-academy on my website where you can learn 2 online courses at your own pace. One is on dairy alternatives and the other one is on fermented foods, great for our gut health. So those are 2 options of e-courses that I offer. And every month I do a juice cleanse, which is a program, a group program or WhatsApp, where recipes are shared, support is given, daily videos are sent, and it's done over a period of 3 days. It's a very popular program of ours, and I run it every month. I'll share details of that later, and I conduct workshops for individuals and corporates. All of these points, all of you would already know. It would be great whoever can put their camera on, so it's nice to see people on the other end rather than black screens. This is just my personal, it's not really a before and after, but when I switched to a plant-based diet, I had no health issues per se, but I got a lot back for the stand I took. I did it for the environment and for the animals, but I felt younger, felt more energetic. I lost weight just by eating clean and a little bit of exercise. And it's something that I've been doing for the last 6 years, and that's what I love sharing. I believe in making healthy simple. So on that note, we start with our agenda today. How are we supposed to meal plan for a busy life? How to simplify grocery shopping? How to plate your meals and portion control? How to cook for your family in such a way that you don't have to cook separately for different people? How do you include protein and good fats? We'll do a little bit of label decoding and importance of seed cycling and role of different micronutrients. And of course, then we would have a demo of 2 dishes that I'm going to share with you today. So here are some tips to help you prep better and plan better. So schedule your snack and meal times. That really helps, so you can backtrack and know that if I need my snack ready at 5 o'clock, if I need to soak something, blend something, cut something, how do I do it? Meal times also, when you plan, it makes a big difference rather than just half an hour, 1 hour before a meal. Even if you have a helper, it helps to plan everything. And if you're doing it yourself, obviously you always know that planning helps. And remember to eat at the time set. Avoid long gaps. This is specifically, now we're talking from PCOS angle, that getting hangry or making bad food choices when you've kept a long break between the 2 meals becomes a problem. So even if you're not very hungry, you'd rather have a small portion of your regular sized meal rather than skip a meal and then overeat the next meal. Avoid keeping junk food at home, even as a treat. And that's where we are with True Elements today, because their food is absolutely clean without any preservatives. It's all healthy, and that's the kind of stuff you want to stock your pantry with. Now, the next point, which will help you to organize your kitchen and to always have enough in the kitchen, so that meal prepping and planning for the family becomes easy, is making sure your kitchen always has the staples. So your dals, your grains, your millets, your rice, some flours, like, your standard ones that you're likely to use, millet flour, for example, and your masalas and, flavorings, herbs. Those are things you should always have stocked. So even on a given day, for example, you run out of vegetables, it's not like you have to run around last minute to put a meal together. Avoid stocking sugary drinks at home. I would say invest in good herbal teas, which are non-caffeinated, and then whether you have them as a cool drink or a warm drink, that helps you to add some flavor to water if just drinking water is not the most fun thing for you. And you also get the benefits of the various herbs that are there in the teas then. So stock up on those. And I think snack time is where most people go a little haywire. They don't know what to eat. It's that 4 o'clock dip, which we're going to hit very close. We're going to come to very soon now, where the glucose levels have dropped. You want something quick, like a pick-me-up, and you reach out for food, which is not the best at that time. So if you're someone who needs namkeen, plan accordingly. A hummus with cucumber and carrot sticks work really well. Peanut butter with a little bit of fruit work very well. If you like something sweet, you can get these bliss balls, which I'm going to show you later. My favorite thing is to stock them in the fridge. There's always a batch in my fridge. So whenever I feel like I need a sweet, that's what I'll pick up. Cutting down on caffeine also is something to consider, not only because you'll miss adding the milk and the sugar, but by itself, we don't need stimulants. We don't need to have our senses all the time, pushed. So limit it. I know most people have a very dear relationship with their tea and coffee. So completely stopping may not be an option for many people, but cut it down. It interferes with sleep. It interferes with the absorption of nutrients. That's something many people don't know of. I get this question asked very often as to, can I have my tea with my breakfast? So I always say, if you must have your cup of tea and coffee, have it at least half an hour to 1 hour after you've eaten something, so that it doesn't interfere with the nutrient absorption, especially of the vitamins. And then, of course, limit sugar, salt intake. This is, again, across the board, great for the family, great for you. Eat protein at every meal. So whether it's breakfast, lunch, dinner, snack, if it's very light, maybe you could go easy on that one. But having dal-based breakfasts are a great idea. Having some form of tofu and dal at every meal will really up your protein content, and that will give you a great satiety. And if you're somebody who's also, whether or not you're active, whether or not you're exercising, I'm not saying go overboard with protein, but make sure you're getting at least the minimum amount, because very often as a country, India is more carb heavy. We are not as conscious about our protein intake. So be mindful about that. And before eating, ask yourself, are you hungry or craving? So to know, I always give an example. Keep a cucumber in front of you and see if you feel like eating that. If you feel like eating that, that means you're hungry. And if you keep a samosa in front of you, or whatever is your favorite pani puri or whatever in front of you, and you feel like eating, that's no big surprise, right? Because who can say no to that? So the way to know is literally ask yourself, am I hungry enough for a cucumber? And if you are, then you really are. And counting calories, many people don't like to do it, but I sometimes feel, because we think we are eating healthy, even it's obvious, things like ice creams, cakes, confectionaries, fried items, we already know that these are calorie dense. But even things like nuts and seeds and coconut yogurt, they are so high on calories and we don't realize. And we think we're eating healthy and we're still ending up over consuming. So there are many apps that are great to keep a track of your calories if you want to go that route. There's MyFitnessPal, there's Healthify Me, there's Chronometer. You can use any of these to track what you're eating, especially if you're trying to lose weight in a sensible way. Staying hydrated, of course, like I said, either drink water or sip herbal teas at least a couple of times in a day for variety. Very often people are thirsty, but they think they are hungry. So a good idea is to stay hydrated, which reminds me, I will have a sip of water now. planning your meals for the week in advance and prep over the weekend. Now, this is a time that you can get your family involved. If you have children, get them to plan with you, teach them how you want protein in every meal, teach them how we need fiber in every meal, and make a family menu. I'll share what it can look like, so that usually if people have been democratically kind of arriving at the menu, they're more likely to be happy with what is made. And prepping over the weekend helps. Keeping your kitchen organized where you can read labels or at least see what's in all the jars. Keeping them in glass jars makes life easier as well. And get into the habit of saving your ordering of food on a day, whichever day that is. If it's a weekend, great. If it's any other day, so that every Sunday, you will have fresh groceries and fresh dry groceries and fresh fruits or vegetables. And then middle of the week, maybe you might need to buy a replenishment kind of round. But don't ad hoc keep ordering, because that can waste a lot of time. And you know how Amazon and all of these have started playing on our mind. There are deals for the day. You want to keep ordering as you see things. So these are just a few things. At this point, I just want to see if there are any questions. Joining in from Colombia, lovely. Joining in from Haryana, struggling with PCOS. Hopefully this summit will clarify a lot of things. I, for one, would love to see all the recordings of all the sessions. Nidhi, I hope people have access to those.
Yes, absolutely.
Yes.
So just to reiterate, you are on a streaming service. So we have 50 people, I think more than 60 people watching right now to you. So we're trying to get all the questions to you. We will have a special place for you to interact as well, and everybody will have access to recordings.
Great. So yeah, obviously you're here. Most of you who are here are dealing with PCOS, and that's why you're here. But I would say take every single session on this summit. Try and look at it, make notes, and I think not only will you come out of this more enlightened, but I'm sure you'll be able to find a roadmap to follow after this. So what are the things that you can prep for? You can do green leafies, which can be washed, cleaned, and kept in cloth bags or lined in containers in the fridge. I, for one, if I'm doing them for smoothies, I like to freeze them as well, because they don't wilt like that. Making tomato paste or puree, making ginger garlic paste, making our good old green chutney, which can be like a last minute, addition to any quick snack or even for breakfast. Making nut butters like peanut butter, because they're just so easy to do. And when you make them yourself, you know that there are no harmful, additions to them. There's no hydrogenated fat, there's no sugar. Get into soaking dals and sprouting them over the weekend, because that's something that you can soak on Friday, and by Monday you can have a good batch of sprouts ready. If you are someone who's really pressed for time, then you might want to batch cook your say rajma or chole and freeze them. Again, many households prefer making fresh, and I highly recommend that. But if it makes life easy, you could do this and soak, boil, and then cool down and freeze your bigger legumes like rajma and chole. And roasting peanuts and keeping them as a snack. Makhanas, home roasted, have far less oil, far less sodium, and you can choose masalas as per your taste without them being overly spicy, which then makes you want to crave something sweet. So this is all that you can do over the weekend. And to keep a track of your app, of your requirements, you can use apps again. See, we have so much technology. You might as well make use of it to serve you, and manage your time better. And of course, be mindful, because other apps also keep us very busy. But the idea is to use it to your advantage, so that meal prepping, ordering groceries, having your staples becomes far easier and not random, where you can plan it better. And once you see a trend, you can make a standard list. So every 15 days you need XYZ, or every month you need X kilos of this, and it just makes life that much easier. So this is how you can make a weekly meal plan, and this is how you can involve the family. And as long as you have good fiber, as long as you have good protein, and you have a variety in your meals, you're pretty sorted. Carbohydrates will anyway come, fats, if you cut down on oil and you add seeds and a little bit of nuts, you've got more than enough fat than you need. You don't need extra fat. You don't need to overdo avocados or coconut. Just regular usage of like 6-7 nuts a day and a tablespoon of seeds are more than enough. So you've got your micros and your macros sorted. And then what you do makes, if you make it creatively and democratically, then the family is happy. So how do you plate and how do you visualize your food? So I believe in the breakfast starting with some fruit. Fruit can be had by itself or as a part of a green smoothie, which has green leafy vegetables and a little bit of fruit. As a part of the cooked breakfast, I like adding sprouts to whatever we eat, veggies to whatever we eat. So if you can have a salad in the morning, like a sprout salad with lots of veggies, that would be great. But not everybody likes that. So if you like your traditional poha or upma, make sure there's a lot of vegetables in them. And if you are somebody who likes, like a Sheila or whatever, then those are also great options because they're high in protein. So you can do Sheilas, you can do besan omelets, all of that. So when you have to plate your meals, your lunch and dinner meals, your plates, make sure visually, if you divided your plate into 4 quadrants, one would be for salad, one would be for sabzi, one would be for dal, and one would be for rice or roti at any given meal. And make sure you consume at least 2 bowls of dal to get enough of the protein, and your fiber and your micronutrients you will get through your salad and sabzi. And complex carbs are great. If you can add some veggies into the roti, into the rice, that would be even better. And hand polished rice if possible, rather than complete white or complete brown, because that might be hard to digest. Now your dinner plate can be very similar to your lunch plate, just that you could add a little more soup if you wish, to add to the the goodness going in, the hydration going in. And you could slightly reduce the carbohydrate if you can at night, especially if you're eating later at night. Early dinners are always a great idea. And the dal has to, or some form of protein, so whether it's tofu, whether it's, because I believe in plant-based nutrition, so I will focus around legumes as the main source, and your sabzi. So just in addition to what I've said, some stuff by which you can access or benefit from the produce that you get is try and buy local and seasonal produce, and wherever possible organic. Always choose the fruits that are sold in the local market. You usually have these vendors selling, say, just guavas or just pineapples or just a particular fruit, and usually those are the ones that are seasonal and they are less sprayed as compared to a dragon fruit or a kiwi coming from really far away. Try and buy local varieties. Try and choose smaller fruits and vegetables, as they're less likely to be injected with growth hormones or other chemicals. Bigger is not better in this case. Avoid vegetables and fruits that are too dark. Pick the ones that have a slightly lighter hue. So because I have been a regular at buying organic produce, most tomatoes from the farmers market, again, I won't generalize, most are not like perfectly bright. There are a bit of yellows and greens in the tomato, even though they are completely ready. And if you have a chance to taste them before buying, then avoid buying the ones that feel unnaturally sweet, because they are most likely injected if they are from a non-organic vendor. I'm going to take a few questions. I need to know which is the best food or drink to start my day and the best time to have a good bowl of salad. So any time is a good time to start your have a salad. There's no bad time, except maybe having too much salad at night may not suit people, but for breakfast, lunch, snack, any time is good. I'm a big believer in starting your day with a little fruit or a smoothie. So that's what I would say you could start your day with, and maybe a herbal tea, just if you like something warm. Examples of protein sources in South Indian breakfast, because they are carb heavy. Pesarattu, that's like your, you can make it with, I think, moong dal also. You can do anything like a, like a dosa, but do like an adai, which is a mix of 2-3 dals, and you can make that. And in that, either in the batter, you can grate vegetables, or once you have made it, you can roll it up and stuff it with grated vegetables. That way you get your protein and some fiber.
So Vinita, sorry, I'm coming in here.
Yeah.
Let's do Q&A at the end, because
Sure.
we're already at 4:15. So
Sure.
but let's make the most of it, and then we'll get
Sure,
into
sure. I just thought it'll be otherwise like a monologue with only me talking. So, okay. So I'm going to move on to label reading. And so a lot of people who are either gluten intolerant or are choosing to not have wheat tend to buy gluten-free atta. And I have purposely put the picture of the ingredients that are there. And there is an emulsifier added to it. There is potato starch added to another one. Now, potato starch is the equivalent of maida in terms of very less fiber, in highly processed and no fiber. And here in atta, there are milk solids, which is so strange to find. Xylem husk is okay, but there's an emulsifier and a thickener. So you're better off, rather than buying this mix of everything, just buy your plain millet atta. And if at all you need to mix your own, rice flour to it, and then you have something easy to manage. If we had more time, I would have actually had you in advance to get certain products in front of you. And in fact, if you want to run across to your kitchen and get some products, if you're watching a recording and you have the time, pause it, go bring your favorite biscuit that you think is healthy, or favorite drink that you think is healthy, and check the ingredients. So if you look at, I'm not again bashing any brand. This is across the board. Most brands, very few are very transparent with what they're using. So if you see the soy milk box, there's thickening agent, there's an emulsifier, and there is, in the other one, there's a vitamin premix and a stabilizer. This is for the dairy-free milk. And they've added extra fiber. For our healthy snacks, this is where I want to come back, rather refer to true elements. They do breakfasts, which are healthy. They do snacks, which are without preservatives. All the ingredients are mentioned at the back. There is nothing artificial or synthetic added to it. There are no preservatives added to their products, and which is why we're very happy to have them as our sponsors, because they resonate with what we're trying to say here. If you read on any of these three labels, there is so much stuff that ideally need not be there. There's hydrolyzed vegetable protein in this one. There's maltodextrin. There's in the other one, on the left is not so bad. So you should know which ones seem better and worse. The biscuits down have palm oil. They have sugar. They have invert sugar syrup, leavening agents. I mean, the works, okay? We also tend to use ready-made sauces and dressings. Again, you will find flavor enhancers, permitted preservative, liquid glucose, permitted flavor enhancers, contain class 2 preservatives. And this is something that struck me when I was much, much younger, and saying, why are we class 2? Like, today who looks at second class as a good option, whether it's traveling by train or by whatever. We are not class 2, so why should we eat class 2 preservatives in our food? And these are the names of sugar which you will find on most packaged items. So feel free to take a screenshot. These are the 50 odd names that you will find in the name of sugar. But at the end of the day, they are all sugar. And all packaged foods have them. Not all of them, at least one of them. So coming back to low fat, high fiber is the way to go for PCOS. So like I said, limit it to 5 to 7 nuts in a day, minimal oil, go easy on coconut, there's no harm in eating coconut, but not coconut through the day, and seeds about a tablespoon or max a tablespoon and a half, and making sure with that you're getting in enough fiber through fruits and vegetables and whole grains and protein. So this is typically what your chart would look like, where the base is fruits and vegetables, whole grains, legumes, leafy greens. And I already shared how the plate should look like. And for many people for whom things like chole and rajma become heavy at night, you can choose to have them for lunch, and for dinner, always make sure your dals are a little lighter if you have a sensitive stomach. So this is how I would roughly plan the plating. And while we're at it, I'd like to slip in also that all this is also important from the gut health point of view, because our gut health and our overall health is very connected. If you reduce your refined inorganic foods, packaged foods, and consume more probiotic rich food and fermented food, and generally eat clean, avoid use of antacids on a regular basis, whether it's Eno or Gelusil or what else do people have? Hygiene. These are all antacids which actually affect our gut health. And we don't realize how much it's impacting our overall health. Even with our hormone production, gut health plays a very important role. So coming to a very important topic about seed cycling for hormone health. Many of you might have heard about it. I'm jumping to this because we're coming close to the demo part where I'm going to show you something which is connected to seed cycling. So the first 14 days is your follicular phase where there's an estrogen boost, and that's the time you want to have your flax seeds and your pumpkin seeds every day. As you might know, with flax seeds, it contains cancer-fighting lignans, they contain fiber, they contain omega-3, as well as antioxidants. And with pumpkin seeds, they contain manganese, vitamin K, and protein. So that's for your first 14 days. And for the remaining days, which are your luteal phase, where there's a progesterone boost, which is day 15 to 28. Of course, these are not watertight because not everybody has an exact 28-day cycle. So for sesame, we know it's a great source of calcium, of magnesium, and manganese. And our sunflower seeds are great for selenium, calcium, and magnesium. So how do we actually use them is what we need to see. These are believed to have a balancing effect on the hormones, and you can also kind of interrelated to the new moon and the full moon. I'm going to take Q&A later. I'm just going to finish the PPT so that I can move on to the demo. So if any of you would like to have a one-on-one consult with me or learn any of my course, online courses, you can contact on the website. I also have a juice cleanse coming on 1st to 3rd of October. There are many, many people who have benefited. You can read the reviews on Google. You get recipes, detox tips, shopping list, and WhatsApp support. And those of you who like this session, I would love for you to follow me on Instagram and Facebook. I share a lot of tips, a lot of information, videos, all supporting health, and of course, many of the things you would find relevant to PCOS as well. I also have a YouTube channel, and if you'd like to contact me, that's my contact number, my email, and website. I'm going to stop sharing and I'm going to move on to the recipe part. I'm just going to put off my camera for a quick minute while I just bring everything in the front. Yeah. I'm going to now tilt the camera downwards so you can see exactly what I'm showing you here. So for the recipe, the recipes will be shared with you. I will send them across to PCOS Club and they will make sure you get them. These are walnuts. roasted, almonds roasted. Again, a great way to get in nuts. I'm going to add dates as the sweetener, cocoa powder or cacao powder, whichever you have, some rock salt or pink salt, and a seed powder. So how do we make the seed powder? We use whole seeds. So I'm going to show you the seeds that are being used here. Like I explained, we're going to use true elements, and if you read their labels, they just say raw sunflower seeds. No artificial flavors, color, or preservatives, and they stay true to that. So these are the 4 that we're going to use. There's flaxseed, quinoa will come in the other recipe. There's pumpkin, and there's chia. So these are the 4. You just take 1 each of each seed. You can either do 2 tablespoons, 3 tablespoons of each, however you like, and then you powder them after roasting them individually and make a powder. So for this recipe, I have taken all the 4 seeds together. Okay, but if you would like to make phase 1 separate and phase 2 separate, that's also an option. So in the first phase, the follicular one, you could do flax and pumpkin, and the second one, you could do sesame and sunflower. I have put all of them together, but you can decide how you want to do it. And now I'm going to bring the blender here, and I'll show you how I'm going to do this. So I'm going to put in the dates. And put in some walnuts and blend all of this. I'm just going to put it on mute because it will make a lot of noise. So here we have the dates fully disintegrated and powdered. Make sure you de-seeded them. I'm going to add the rest of the walnuts and all the almonds. Again, I'm muting it. Just going to show you how it goes. All nicely come together. I'm going to add the seed powder, like I mentioned. So if you're doing this for the family, this is how much of seeds you would add. But if you're doing this for yourself, feel free to up the seed quantity. I'm adding the cacao and the salt. A little bit of salt just brings out the sweetness better of the dates. And I'm just going to use the spatula and just scrape the sides down a bit. If you keep overdoing this, it will become butter, okay? And that's extra bonus tip that I'm sharing with you. If you did any one seed like this, any one nut, whether it was walnut, whether it was almond, whether it was peanut, it would become butter. Same with the seeds. If you take any seed, lightly roast it and grind it like this, dry, and just scrape the sides, you would end up with butter. Nut butter or seed butter. I was on mute. So this is our chocolatey bliss ball base. And I'm now going to roll this dough almost into balls. I'm going to transfer what was in the mixer into a mixing bowl. And again, to keep it family friendly, you can make a batch, like I said, with more seeds for you and less seeds for others in the family. For children, you could also add a little bit of jaggery, or you could put some chocolate chips just to make it interesting and getting kids also to eat the seeds. My kids have no idea what's in the bliss balls. I just tell them they're chocolate bliss balls with nuts. And they have them without knowing. So there's enough oil from the nuts and seeds themselves. So you really don't need to use any extra fat. And you just do this with one hand and then roll. Now you can get creative with this. You can definitely roll these into raw cacao or toasted sesame or pista slivers, and that's your seed cycling bliss ball with cocoa. If I get to it, I'll finish rolling the rest later. I want to stay on time and I want to finish question and answers as well. So I'm quickly going to move on to the next one. Just a quick thing that I wanted to say about the next recipe is that since the focus is cooking for PCOS, but not having to make something separately just for yourself, this next recipe, we're going to use quinoa, and we can use this for the rest of the family as well. And for quinoa, yes, when you look at quinoa, I'm using again the one from True Elements. The ingredients just say quinoa, nothing else. So this is the food. What True Elements talks about is how their food doesn't lie. It doesn't tell you something and do something else. They believe in using whole and natural foods, starting your day with a balanced breakfast, making sure there's protein in every meal, not to skip meals, and avoiding highly refined foods. And that's exactly what I'm sharing with you as well. So here the protein content is 15.3 for 100 grams, which is a decent amount of protein. And I've already told you how protein is very important as a building block for recovery, for repair. And if you're working out or wanting to get more toned, this would be a great addition. So this recipe is a Buddha bowl in which I'm adding quinoa. And what you need to understand, the concept of a Buddha bowl was how to use up, say, leftovers, or when you have very little of everything at home, how do you utilize that? How do you utilize it? So I'm going to share what my ingredients of the Buddha bowl are. And do a wonderful dressing as well. So this is our quinoa. The instructions will come to you in the recipe once they share it with you. So I like to soak my grains before doing, working with them, like cooking them. So I soaked it for 6 to 8 hours, and that cooking hardly took 10 minutes. This is 1/4 of a cup of quinoa. I've taken just plain boiled chickpeas for protein. I had some tofu left over from another dish. This is fresh tofu, but a little bit left over in a raw form. So I just cooked it quickly. Carrots, let me just turn this and so you can see everything. It looks so pretty and colorful. So this is like eating a rainbow, taking care of all the, how to utilize everything that's in your kitchen. There's purple cabbage. I had organic spinach, so I've taken it raw, but if you don't have organic, you can also cook and use a bit of greens. I've taken carrots, toasted sesame seeds. You can use any seeds that you like. And I'm taking mixed herbs. And what we're going to do now is I'm going to put all this into a plate. and also work on the dressing. So here is our Buddha bowl, and I'm going to start plating. So I'm going to put the the quinoa as one part of the Buddha bowl. Then I'm going to add the tofu. The cucumber, I won't take all of it. So be creative. If you have, some leftover rajma, leftover chole, leftover sprouts, or if you want to do this very purposefully, where you actually, cook all of these in small portions to make your Buddha bowl. It's completely versatile. You can use sweet potatoes, you can use pumpkin. So that's our chickpeas. Some carrot. Some purple cabbage. You can also use regular cabbage. I had organic purple cabbage, that's why I'm using it. But if you don't have access to that, please do not bother, going out of your way to buy purple cabbage. This is some spinach. And I had some zucchini as well, so I'm going to add that just a little bit here. And now I'm going to work on the dressing. You can look at the Buddha bowl while I'm working on the dressing. I have some mixed herbs here, which I'm going to add to my dressing, and some sesame seeds. You could actually just at this point sprinkle the sesame seeds all over all the ingredients, and I can use some herbs directly because I haven't really put any seasoning other than salt. I'm going to put this herbs on this, yeah, and I'm going to add the remaining into the dressing. Now for the dressing, I'm using a seed butter. You can use any seed butter that you want. You can also use a nut butter. I'm using peanut over here, or you can use sesame butter as well. Some haldi and dates for sweetness if you like. And now I'm going to put all the ingredients into the blender. I don't want it very sweet, so I'm just adding one date, chili powder. So this is actually a turmeric sesame butter dressing. But like I said, you can make it with any nut or seed. So you see, I haven't used any oil in the rest of the recipe. So our good fat is coming in, our fiber is coming in, our protein is coming. We've got tofu and chickpeas, the haldi for the anti-inflammatory, some lime juice, and I'm going to add water based on the consistency that I want. Of course, you can add a little more as well. And now I'm just going to blend it. I'm just going to mute because it's very noisy. So I have the dressing here. It's beautifully colored. And can you see the consistency? So it's got the herbs, the turmeric, the seed butter or the nut butter, lemon juice. And I'm going to take a seat now. This is our Buddha bowl, which you can do with leftovers or with fresh food that you have bits of left, or make it specifically fresh. And that's our dressing. And always remember, if you are someone who's pressed for time, you can always make the dressing and keep it and pack all this either to work or when you're traveling to work, and then just put the dressing when you're actually going to eat. Yes, so now I'm done with what I had to talk about, and I'm free to take questions.
Great, thanks Vinita for very, very, very vibrant and colorful cooking. Definitely was very tempting. Would have been even great, better if we had a physical event. So hopefully that soon too. But jumping right into the questions, because we have a next segment lined up. So certain questions that we got are, if we so herbal teas, right? So herbal teas that can be taken empty stomach.
Yeah, that's a very good question and a very relevant one, because I think COVID has seen people go a bit crazy with kadhas, and people are taking herbs which are very strong and then boiling them down to half or quarter of the original water, making them very, very concentrated. So what you want to do to your system in the morning is to wake it up gently. The herbal tea is in replacement for tea or coffee, in the sense of having something warm to drink. So I would recommend using things which are gentle and cooling in nature. Little bit could be soft, like fennel, elaichi, which is your cardamom, lemongrass, mint, and at max maybe a little bit of cumin, little bit, because I've studied Ayurveda as well. So all of these are cooling in nature and they will not make you acidic. If you have green tea first thing in the morning, or you have clove and pepper and cinnamon and all of those boiled a lot, it can give you acidity. So I guess that's where the question is coming from.
Okay. Next question is examples. Okay, so it is a common opinion not to mix fruits. What fruits would you suggest for smoothie recipes?
Yes. So I always say this whole debate and dialogue about fruits and mixing fruits, mixing vegetables with fruits in terms of the smoothie. Let's understand there's a spectrum. Okay, there are people who are very into raw food or very into natural hygiene, and a nature cure will say you should have a mono fruit, one fruit at a time. Some will say you can mix sweet fruits and you can separately mix citrus fruits. Some will say you can mix your fruit with green leafy vegetables, like I suggest to do in your smoothie. What I will say is, whether you do mono fruit, whether you do similar fruits together, or you do greens and fruits together, okay, the idea is get more fruits and vegetables in, whatever works for you. Purist approach would be not to mix. But if in one go, by having a liquid breakfast, if you stay full and satiated and you get your daily dose of greens and your fiber, and that works for you, that's what you should do. So go with your gut, go with what your current digestive system is like, and pick accordingly.
Somebody's asking for online store for reliable organic vegetables and fruits from Chennai.
So you can go on to my website, Vinita Contractor. I have a tab specifically for this called resources. And within resources, I have pan India, at least in the big metros where things can be available. So you can check. I don't have it offhand.
That's so helpful. Thanks, Vinita, for doing that. If gut issues, can we have raw food like salads?
So saying gut issues is a bit generic. I need to know what kind of gut issue. Having said that, eating any raw vegetables I would only trust, even for someone who has a slightly sensitive stomach, to eat only if they are made at home, where they are properly cleaned, because we know that a lot of pathogens can come into our system when you're consuming raw vegetables. And if you're really not comfortable, it's perfectly okay to lightly steam your vegetables, and you'll still get the benefit of the greens and the or of the other raw vegetables and the fiber. So eat at home after thoroughly cleaning them, or steam them.
Great. If we want to go gluten-free, can we take roti in any meal? If yes, then which atta should we use? And I think we did just a session with the president of the Celiac Society of India, just on the gluten-free aspect. I hope you did attend that session too. But Vinita, what's your take on that?
I missed the first part of your question, gluten-free, and then I missed what you said.
If you want to go gluten-free, can we take roti in any meal? If yes, what attas do you suggest? So what we got from Miss Ishi Khosla were the high protein attas like chickpea flour and the atta.
Then I missed what you said.
If you want to go gluten-free, can we take roti in any meal?
Yeah, so you can take buckwheat, which is in the north called as kuttuka atta. You can make it with rajgira, which is amaranth atta. You can also use our simple millets like jawar and bajra. Some people find it difficult to make rotis out of that. You could add a little bit of a steamed root vegetable. So like a sweet potato or a bit of a carrot would help to bind the gluten-free atta. So you really don't need to go in for something packaged or mixed together. Buy a product. You can do it yourself. And a little bit of rice atta helps to bind as well. Nidhi, you're on mute. Sorry.
Does fermented foods help? And sorry, my window is, Does fermented food include jalapenos as well?
The jalapenos are just a form of chilies that are from South America. They are pickled very often. That's why you get them in jars which are pickled, but they're not fermented. Okay, what we're getting in the market are with vinegar. They are not fermented. They just have a sour pickled taste. Can you make a ferment with jalapenos? Yes. Like you can make with chilies, like you can make with capsicum, you can make a ferment with any vegetable. There's just a formula that you need to learn and certain safety precautions that you need to take, and then you can ferment and get the benefit of fermented foods. For more, you can check my fermented foods course.
Okay, which brand of dates can we buy? Is Menstrual dates the one, some organic and reliable brand?
So I didn't know this for a long time, that most of the dates that come to India is not from India. Okay, so I think you'll have to just, Menstrual are very, very expensive. And again, it's important to keep things accessible for everybody. So just go with a good vendor of yours. There's no brand that I specifically want to recommend. Just make sure they're not adding sugar to them, that they're not putting oil on the dates to make them shiny. Any simple date is fine. And anyway, we're not going to overdo dates. Like just because they're healthy, let's not forget that they are very calorie dense and very high on sugar.
Great. So Vinita, a couple of questions on how people can access you and your courses.
Yes. Can I put it on the chat? But people won't be able to read them on the chat, right?
You can put it on your screen if you like.
Yeah, sure. I can do that right now. Yes, these are my contact details. And like I said, a few reviews and a few followers on Instagram would make me very happy.
Okay, thank you. Thank you so much, Vinita, for taking your time out and doing this with us. taking your precious time out on a weekend. So thanks for doing this. And also would like to say that Vinita is on our panel. So if you'd like to do any consultations, you can also approach us and we'll be happy to arrange a consultation on your behalf. Vinita, with this, I thank you again for your time and explaining us beautifully how we can make things better while cooking. For her detailed courses, guys, please do check her website and other socials that she's available on and gather more information. With that, we will jump right into the next segment.
I wanted to say hello to Dr. Piyush. He's been waiting for the last few minutes. I started 5 minutes late, so we ended 5 minutes late. So handing it over to you and Nidhi. Go ahead. Thank you.
Thanks, Vanita.
Thank you so much, Nidhi ma'am, Vinita ma'am. So before we start with the next, we would like. Thank you so much, Nidhi ma'am, Vinita ma'am. So before like to with the next, we would like introduce you to that session. That Organics is a health and wellness brand. Am I audible? Thank you so much. Cannabis. We have our own. Now, we would also like to.
Hi, everybody. I think we have some network issues with our MC, so apologize for that experience. It's been raining very heavily at Kolkata, where Olivia is streaming from, so apologize. Thank you so much for joining in, everybody, for this next segment, which is about hemp. And we have Lavina Sirohi and Dr. Piyush Juneja. Dr. Piyush Juneja, I will shortly put an introduction, so just allow me a second. So I'm ready. Thank you for waiting. So Dr. Piyush Juneja is an Ayurvedic expert with an experience of over 12 years. He's currently practicing Ayurveda physician and also consultant to several national for clinical trials and businesses. He's on board of advisors for Canadian Association of Ayurveda Practitioners. Dr. Piyush has held various positions for and was responsible for management of clinical trials, regulatory affairs, R&D at various renowned medical boards, effectively managing various diseases by his renowned Ayurveda treatment and therapies like skin disorders, digestive disorders, hypothyroidism, and various gynecological disorders related to children, adolescents, and adults. You can read more about his journey and his work at drpiyushjuneja.com. With him, we have joining Lavina Sirohi. She's a co-founder of Indian Hemp Organics. This segment is brought in by Indian Hemp Organics, where we're going to understand everything which is research-based and evidence-based about hemp and how it can help healing chronic conditions. In India, we see there's still a lot of conversation that needs to be happen on this subject. There's a lot of resistance or reluctance from people just because there's not enough knowledge about it. So we thought we'll bring the the best of the both worlds, the doctor here and Lavina herself here, who's going to talk about India Hemp Organics, and Dr. Piyush going to talk about hemp and its advantages. Welcome, both of you. Thank you so much for making time today to be part of PCOS Club India's first annual conference.
Thank you, Nidhi, and thank you, India Hemp Organics and Lavina and Rohit for making this possible. And first of all, I would like to appreciate PCOS Club India because as a clinician, we are seeing so many cases are now there in India as far as PCOS is concerned. and you people are focused and exclusively working on giving better quality of life to all the people who are suffering from PCOS. So I think excellent effort, and we need more people like you to address these kind of issues in our country. Thank you.
Thank you so much, Dr. Piyush.
Thank you for having us, Nidhi, and a warm hello to you, Dr. Piyush. Likewise, I would like to thank you for hosting this summit, because we do believe that education sits at the forefront of everything. And to be able to educate so many masses about the prevailing problem of PCOS is a well-needed cause. So thank you for doing so. And I am looking forward to be a part of this session.
Fantastic. With that energy, I think it's the perfect time to dive into the conversation. So Dr. Piyush, can you tell us what is CBD oil and how does it really help for dealing with chronic conditions?
See, first of all, we need to understand, as far as the CBD oil is concerned, CBD is just one ingredient of the complete herb, and the herb is known as, you can say it cannabis, you can say it hemp. We in India know it as bhang. The problem here is in our tradition, it was there as a medicine, but somehow in last few years, again it is reviving. But prior to that, somehow it has been connected to only the recreational aspect, which is also a kind of a taboo. Now, when we see the Western world, they have done exhaustive research on this. So CBD oil is basically the ingredient of the complete herb that is known as cannabis. In India, specifically, we are using the leaf extract. So from the leaves, it has been extracted. However, as per the Indian regulations, it will be complete Vijaya extract, or the complete leaf extract will be getting, and it is also known as full spectrum CBD oil, which you will be getting as a product or as a medicine if you want to start it for any issues which you are having. There are several procedures of extraction. Predominantly, it is ethanol extraction right now, but yes, few companies have started doing CO2 extraction, which is somehow more precise. And nano emulsion is also there in some international facilities, not yet in India. So there are right now predominantly three forms in which it can be extracted, and it can be taken in the form of tinctures. And definitely it is legal as far as India is concerned. The Ayush department at state level issues the approval, and from that it has been like all these companies are taking the approval, and it has been like coming into the market. So yes, it is legal, and we can the only thing which we need to understand is all the cannabis medicines or products or whatever is there, the internal ones need a prescription because it's a Schedule E drug. So the internal products in terms of tinctures, tablets, any capsules, whatever you are taking, having cannabis or CBD or hemp will be only taken with a prescription. The external local application oils or some types of cosmetics, food products like hemp seed oil, all of them you can take directly. You can purchase online, or you can take it from the store if you have a nearby store without any prescription. Prescription is not required, but for internal it is required.
Great. And how does it really work on our body? Like, what benefits do you see? What does CBD really doing in our body?
Actually, it's an excellent question, but it's a very, I will say, a very detailed explanation which we need to understand. But just to quickly summarize here, we need to understand, prior to understanding how CBD is working, we need to understand, and I request all the audience who are attending this session today, you people can read about endocannabinoid system. Endocannabinoid system is a system which is there in all of our bodies, in all the individuals. We all have that. And this particular system is responsible for many aspects. In fact, there are so many aspects in which this system is involved. That's why this herb is also healing many diseases, because many times people say, is it a kind of a, like in your topic also, I was saying the word magic. So nothing is magic. Everything is science. Everything is pure, like complete science. It started from the Ayurveda, and now in this era, the language has been changed, but the concept and the overall, if you see, it's beautifully mentioned in Ayurveda also. And the same concept right now we are seeing in a form of an endocannabinoid system. So basically endocannabinoid system is there in all our body. In 90s it has been discovered, and it's a kind of a biological system which impacts all the major process of our body, include appetite, sleep, mood, memory. Many aspects are there, and there are three parts of this system, that is receptor, enzymes, and endocannabinoids. So we need to understand that this entire system is existing, and each and every organ directly or indirectly is related to this endocannabinoid system, specifically our thought process, specifically all the inflammation, pain, and in all the receptors, the main are CB1 and CB2, which are primarily responsible for like nervous system, movement, pain, appetite, uh, memory, mood. All these are related to CB1. And for CB2, specifically the peripheral nervous system and inflammation, and again, it is related to pain as well. So all these receptors are there. And when we take CBD, so basically CBD, what CBD does is it directly impact this entire system in form of modulating some kind of receptors, that is, for example, the serotonin receptor. So it modulates that, and the result of that is it triggers the entire system, and a kind of a you can say in a form of healing for the pain, for the inflammation. So it's a bit technical, I don't want to go much technical, but in simple language you need to understand. So there are some chemical components which are related to each of our organ and each of our system, and CBD is really helping those to optimize or to heal sometime if there is an imbalance. In Ayurveda also it is known as Yogvahi, and Yogvahi means it is acting as a catalyst. So for example, whenever we are giving the prescription, and along with that, whenever we are adding cannabis to our Ayurveda prescription, the results are tremendous. Earlier, I remember we used to give like healing or kind of a good quality to PCOS patients in suppose 6 to 8 months. But with cannabis, we are easily seeing the results within a month or sometimes in couple of months, which were not possible earlier. So it is acting as a catalyst, and it is like kind of uh, doing the healing in a better way in a lesser time as compared to the other herbs.
So that was really helpful. Could you also tell us that in terms of symptoms, now specifically looking at PCOS, with PCOS you have irregular periods. Apart from that, there are sleep issues, migraines, inflammation. How can does CBD help with that as well?
Yes, absolutely. In fact, there are so many research studies which are available in public domain that CBD is really helping. And see, we need to understand the irregular periods or uh, that is one symptom. However, the reason for that are many. For example, the hormonal imbalance can be one reason. And there is one study in which it has been found that CBD is really effective in regulating the stress activating hormone, that is cortisol, and cortisol is directly related to like for balancing the hormones in females as far as estrogen is concerned. And in another study, it has been, apart from cortisol, the melatonin, we all know, the sleep hormone. So the cannabinoid is helping or kind of a healing or influencing hormones like cortisol, melatonin, estrogen, and all these hormones are being regulated or kind of a, if it is in a stage of imbalance, so it is creating a balance or a harmony to these hormones. And end result is, if hormones are being balanced, our overall symptoms, our overall issues in terms of the irregularity in the periods, mood swings, sometime hair fall, acne, facial hairs, there are so many aspects are there. And PCOS also, it's a kind of a catch 22 situation, because on one side the anatomical aspects are there, on another side the physiological aspects are there, and the physiological aspects are again predominantly causing the hormonal imbalance. So it's a kind of a catch 22 situation. As a clinician also, sometimes we see in the patients. So now if we have something which is directly helping us in terms of regulating the hormones and creating a balance of the hormones in the body, so it will definitely help in regularizing the periods and other symptoms also which are there. And as I said, along with other Ayurveda medicines which we are using, we have seen healing in a very swift manner.
Great. Since you were talking about the benefits it can come across, come with using the oil, do you think it's addictive in nature? How long can one take the oils, and what is your recommendation?
Excellent question, Nidhi. I think this is one question which many of my patients keep asking to me. See, we need to understand whenever we are talking about anything which is plant-based, so we can take long-term as well. First, second, we need to also understand the organizations or the companies. Like for example, IHO, they are specifically focused on sourcing the raw material directly from Himalayas and preparing the products, the medicines, whatever, in a most organic or most like safest way without as minimum as chemicals possible. Sometimes we need to add, I think as a clinician I can understand, to get the stability, but those are safe. But otherwise predominantly the active ingredient is a plant based, is a herb based. But yes, if you are taking that under medical supervision, as I mentioned, the internal should be taken under medical supervision. Long term studies are also there for 5 years or for 10 years. In fact, from last 15 years I am into practice, just to correct the profile introduction which was mentioning 12 years. So it's around 15 years now, and around 10 years back I started getting exposed to medical cannabis for some of my Canadian and US clients, and because I was working in corporates. But in India it started few years back. So I have seen from last so many years, the answer for your question is for long term also it is not having any issue. In fact, in the studies it has been mentioned that if somebody is taking on a long term way, it is in fact helping them out in many aspects. But yes, you need to ensure that it has to be taken under medical supervision. You can maybe long term follow ups can be there if somebody is being adopted. So maybe after 3 months or 6 months, they can just have a quick follow up with their clinician and they can continue. And also sometimes we need to give a break as well, because the body sometimes kind of adopt or get saturated as well. So we need to give some kind of a flush out period or a break as well in meanwhile, and then again we can restart. So that principle also we are following. So again, if you are in real in regular connect with your physician, with your medical cannabis physician, I think it will be beneficial for you, and accordingly you can take it forward.
So, what really happens once, say, for example, somebody needs to get CBD oil? What is the process for that?
Excellent question again. See, again, I first of all congratulate companies like IHO and other who are in medical cannabis space in our country. Many of them, most of them, in fact, is following the land of our law, which is saying that whenever you want to get the CBD oil or medical cannabis, any medicine, you can either go to the websites which are there offering you the products, and maximum of them are saying that you need to get a prescription when you are finalizing your order or when they have to dispatch your bottles. So either you can have an external prescription from your respective doctor. Many doctors are also now recommending this in our country, and that will be definitely growing in numbers. And second, the company, the organizations also having some in-house doctors which they can connect to you and you can discuss with them, because they also sometimes have an exhaustive experience of medical cannabis, which maybe your gynecologist or your physician is not having. So that you need to understand, and we are very at a very initial phase right now in our country. There are very few clinics or very few doctors who have an exhaustive experience, and we were lucky enough that till now, as I was just reviewing my data, we have more than 5,000 patients, and it can be one of the largest in India. We have healed with medical cannabis. So just check with your existing physician and clinician or gynecologist with whom you are taking the treatment. If they have any exposure or experience, definitely they can prescribe you. Otherwise, you can connect with all these organizations. And I think PCOS Club also has started some initiatives. So maybe they will be bringing you more medical cannabis clinicians as well. So you can connect with them, you can take the prescription, and then accordingly you can start for internal. For external, you can straight away purchase. Still, you need any guidance or any consultation, you can always consult. And also, one more important aspect to the entire discussion I want to add on, that hemp seeds and hemp seed oil as a nutritional product is also very, very crucial, especially for PCOS cases. I personally recommend and I ask them to start, because it's an excellent source for all the minerals, vitamins, one of the best source for protein. And the most important point, there are two sources right now in the entire world having the best, I will say, or the golden ratio. I'm not a dietitian or a nutritionist, maybe they can differ, but as per my limited knowledge, I can understand that hemp seed oil and fish oil, They both have the golden ratio of omega 3 and 6. And as the more and more people are going vegan and they prefer plant-based diet, so hemp seed oil or hemp seeds are a good option for them. So if they add that, the balance or having a, because it's a lifestyle issue, PCOS is a lifestyle issue, and if we are managing our diet and lifestyle, in fact, many times maximum patients and 50% of the cases are being healed through lifestyle changes and dietary changes as well. And we also prefer as a clinician to give as minimum medicines or as minimum internal products as we can. So that we need to understand as well. And that if we will keep in mind, I think it will be a very good solution, and it can be taken as a food also on a regular basis, which can replace your, I don't want to say, but yes, unhealthy foods. You can replace it with a very healthy and very beneficial alternate.
That's very rightly said. As we know, there are only very few sources which have all the amino acids, and I think hemp is one of those, which has all the 9 amino acids and a great source of protein. So I hope more and more people know about it. But this question, next question, I want to ask to Lavina as well. Since you're bringing this brand in India and you've been working on it for quite some time now, why do you think CBDs are still not spoken enough about in our country? We see so many influencers and so many people and so many communities internationally who are speaking very confidently about it. But when we speak about CBD in our community, they're like, I'm not sure. I don't know if I want to, explore that. So, have you seen this kind of reluctance, and what are you doing to sort of, going past that?
Right. Thank you for asking. So now we have a lot of medical literature available overseas with regards to medical cannabis. But in India, we're only starting to get there because the legalization for hemp for industrial purposes only happened in 2018, which is very, very recent. And it was not until just about a year or so ago until we saw the first companies come out with medical cannabis products because the market was not yet ready for it. A plant that has been considered as a banned substance for so long, to suddenly lift the ban upon it and then present it to the country, it requires some amount of perspective change, which is why for us, we also took the approach of always partnering with reputed medical practitioners such as Dr. Piyush himself to be able to help create that level of education. Because when you're offering a medical product, the most amount of trust and faith a patient has is in the doctor himself. So the right way to build awareness and education is to do it through these reputed practitioners. And that's the approach us as well as other companies alike in the space are also following, to be able to help people unlearn and relearn about the potential and benefits that this plant offers, and to help them understand that this is not the one plant that you think is responsible for recreational uses, but it is the plant that can also offer you so many nutritional benefits, medicinal benefits. And now we have more medical literature coming up in India. So slowly, we're seeing a change in how people are opening up and accepting the plant medicine as well.
That's fantastic, Lavina. Thanks for sharing that. So good to know that people are getting to know more about it. But I feel that the journey has just started, and I hope we get there soon as a country where hemp has originated, has been there. So we'll get to the product segment as well to understand more about the range. But Dr. Piyush wanted to ask you, is it safe for pregnant women or people who are trying to conceive to consume hemp? And what is the ideal dosage? Any important tips that one should look out for?
Yeah, first of all, as far as the addiction is concerned, see, addiction is not at all there. And if you are taking under medical supervision, as I can always say, it will not be there. See, addiction, we need to understand what do we mean by addiction. Addiction is anything which you are taking like apart from the regular dosage which is recommended. That is one. Second, if you are abusing, so there can be addictions to many aspects. So that is a very sensitive question, but still I can say no, because as per the patient scenarios, it is not there. Second, as far as the pregnant woman is concerned, there are not that much studies, so we generally avoid in pregnant women. In fact, maximum over 90-95% of allopathic medicines, as far as Ayurveda or any system of medicines or any like ingredients, we generally avoid, because till the time we don't have any authentic study and data, we try to avoid. So for pregnant women, I definitely, as far as the internal tinctures and medicines are concerned, I request not to take. You can apply external oils if you have pain, any skin issue. You can take food products, that is not an issue. But internal medical cannabis medicines, try to avoid for pregnant women. And yes, for people who want to conceive, in fact, see, we need to understand the hindrance in conceiving naturally. One of the most common hindrances is PCOS. And people come to us, especially the married females and ladies, that they want to heal, or they want to maybe suppress, or maybe they want to maybe go to that limit where they can conceive. So in that scenario, yes, we have to start the entire medicines along with medical cannabis to ensure that at least they are able to conceive. But once they conceive, we have to stop. So that is the criteria which we are following. Ideal dosage, again, there is no specific dosage, because this is a very dynamic herb. As per the body weight, age, the potency of the tincture, how much percentage or how much mg is there in a particular maybe 10 ml, 30 ml or 50 ml bottle. So that we need to decide, and accordingly we need to fix the dose. And any important tip one should look for is, see, we need to understand 2-3 aspects. I will specifically talk about the oral tinctures, which are one of the most prominent medical cannabis medicines right now. And as per the bioavailability also, the second most preferred. The first one is the inhalation or the vape mode, which still is in a bit like legal issues in our country. The second is the sublingual. So sublingual means you are just putting some drops under your tongue, and from there it will be absorbed. So you need to understand whenever you are placing certain drops under your tongue. So first hold on that for maybe a minute or a couple of minutes to to allow them to absorb from that space, the sublingual glands. That is point number 1. Second, when you start, always start with a evening or night dose, ideally after your dinner, after 1.5 hours for your dinner, and around 1.5 hours prior to your bedtime. So for example, if you are having a dinner at around 8, you can take at 9:30 and you can go to bed at around 11. So that is the ideal way of starting this. Start with whatever the minimum dose your prescription, your clinician or doctor is prescribing you. And then gradually, sometimes we can increase as well as per the tolerance or the body, how the individual is adopting. So we can increase accordingly as well till the time we reach the threshold. So again, the dose modification and the dose modulation, I will say, will be under your medical permission, but you need to ensure these points. And if you are first time using this, so try to avoid at the daytime, try to avoid driving after having this for initial some days, try to avoid alcohol and smoking tobacco and all these aspects along with this. So these are some basic aspects which you need to understand, and accordingly you can take it forward. And I can say that yes, it will be an excellent solution for problems which are there as far as the gynecological issues in terms of PCOS, in terms of dysmenorrhea, the pain during the menstrual cycles, and many other aspects. It has it has been proven in a very good way. And there was one question in terms of the reviews, live cases and all. So we have so many patients and so many reviews you can see on our handles. People are talking about this, people are posting about this, the benefits and the healing which they have achieved. Many couples have conceived as well. So they have shared their review and testimonials also. You can go through all those which are available there. Right.
Sorry, just to add to what you said, Dr. Piyush, in fact, after, Rohit got in touch with us regarding CBDs, we've been testing in our community and started with myself. And I would like to be, without just saying that it is for Indian hemp organics, but it has truly helped me, especially with my sleep hygiene. And there are certain things that you don't expect that, okay, these symptoms also you feel you will, see an improvement, especially with the moods, irritability, anxiety. And ever since we started recommending it to our people in our support groups, there has been a great acceptance. So getting a very unbiased and, sort of opinion, what we are seeing really in the community, I feel there is so much that this CBD oil offers. And anybody who's looking to, especially somebody who's going through sleep issues and anxiety, CBD can really help. And Dr. Piyush is also on our panel in case you want an appointment. We'll be happy to help. And India Hemp Organics is running a very, very interesting and exciting, offer as well. So anybody who's interested, do check out the sponsor lounge. And by the way, on this segment, when we get to the end of it, there is a chance to win a free CBD oil by India Hemp Organics, a full spectrum CBD oil. So please, maybe Dr. Piyush can ask a question from the audience and people can answer it, and we can go by it. I hope this works. With that, I would like to get to the end of the session. There are certain questions I will ask you from the audience that we've got, but Lavina, I wanted you to get an opportunity here to just talk about your products and how and what is the response that you've received so far from your community.
Sure. Thank you so much, Nidhi. So at India Hemp Organics, we are extremely focused on consumer well-being, and we have products panned out in 3 different categories. One is nutrition, another is medicine, and the third one is personal care. So specifically speaking about our medical cannabis range, because that directly translates to being able to combat and heal a lot of symptoms that women with PCOS have, we've got 4 oils. One is for stress management, everything related to stress, anxiety, depression, etc. We have got 1 oil for better sleep and insomnia related problems, to be able to balance your circadian rhythm, your melatonin production, your cortisol levels, etc. And we have got the 3rd oil for pain and all inflammation related ailments. This helps with women that are also suffering with period cramps, pelvic pain, etc. And we've got the last oil, which is the one that you also tried, which is called Balance. And that is for complete balance, so balancing of different hormones in your body, as well as your mental and physical well-being. And then, of course, we've got products in the other categories as well. So all of them are, again, anti-inflammatory, and they're because they all directly work with the endocannabinoid system that Dr. Piyush touched upon. They help to regulate a lot of symptoms such as food cravings, mood irregularities, bloating, cramps, appetite balance, weight management, etc. So yes, we've also got discounts for the whole PCOS community over here. And I am excited to see who would be able to win that oil as well and see how their journey with it goes.
Awesome. Since we have a bit of a lag on our streaming service, Dr. Piyush, would you like to ask your question right now? And till the time we will address some of the open questions, we'll get to the winner.
Great. So the question is, during my talk, I mentioned about 2 receptors, the name of 2 receptors. So anyone who can answer those 2 names can be the winner.
Okay, great. So we have a question from the audience. What is your view? And this is from Ishmeet Kaur. Ishmeet says that your view on CBD oil for treatment of endometriosis. And she also says it's great to see the work both you and Shruti are doing.
Sorry, can you repeat the question, please?
She says your view on CBD oil for treatment of endometriosis.
Endometriosis, okay, fine. So see, we need to understand again, endometriosis is what? It's basically a painful disorder in which the tissues which are there as far as the lining of uterus is concerned, that is endometrium. So that grows outside like the uterus, and it also sometimes involves ovaries, fallopian tubes, and the tissue lining your pelvis. So basically, it's a kind of an acute painful disorder. And yes, as we have mentioned and we have discussed this in our session today, that specifically the endocannabinoid system and the components which are involved in that are related to the pain management and inflammation management. So we have seen that it has been working well. So we need to understand, as being an Ayurveda practitioner, there are specifically certain Ayurveda herbs which are very much effective in managing cases with endometriosis, and we have seen very good results in pathological and radiological investigations after some time. And cannabis and medical cannabis is helping us out in two aspects. One, the entire efficacy or the entire healing timelines or the duration has been reduced with a very significant time, because these days people don't have time. They need quick solution and immediate results. So in that scenario, medical cannabis is working very well. We generally give a holistic or a comprehensive prescription or a treatment along with other Ayurveda medicines. We include medical cannabis, and we have seen that it has been helping them out, and all the cases of endometriosis again getting healed with lesser time. And second, sometimes standalone also, if people are not able to take so many of medicines and they need one or two quickly, they can take. Fast life is there, people are working in corporates, and so many things are there. So sometimes with just one or two medicines we can add medical cannabis, and we can see at least some healing effects in that. And third, it is sometimes causing very acute pain, which is sometimes not able, people are not able to tolerate. And cannabis has been proven an excellent painkiller. In fact, the highest painkillers in other pathies, in especially in like systems like opioid analgesics or other painkillers. So sometimes cannabis is getting sometimes we are getting results with cannabis better than those painkillers as well. So I'm looking forward for some companies in India to develop some specific localized products as well, like a kind of a patch which can be there, or roll-on kind of thing, or these kind of some innovative products with cannabis, so that it can help in managing acute pain along with the internal ones. But definitely it is helping in the endometriosis cases, and we are seeing healing in those cases as well.
Brilliant. And there's some love coming from for CBD from the community. Somebody said that CBD has been a blessing for my PCOS symptoms, especially insomnia. So good to know. Thank you for sharing. And there's somebody else who said, currently trying the Stress Buster from India Hemp Organics, and it's magical. Absolutely love the changes it has brought in mentally to calm my anxiety. I would say +1 to that because I'm here in this journey as well. And I would actively say that anybody who's not tried out and has been struggling to manage their symptoms, I think at least for 3 months, you could definitely see and look at the change. So with that, we are at the end of the session. Thank you so much, Dr. Piyush, for taking time out, and Lavina for educating us about a segment that everybody, is not so much aware about. And I hope your mission reaches more heights. And we should also pick a winner. So I'm going to the auditorium to see who's the first one to answer. So Piyush, Dr. Piyush, what is the right answer?
CB1, CB2.
Okay, so Madhu here has answered the first, was the first one to answer. She said CB1 and CB2. Somebody else also said serotonin receptors. Even Pratyusha got it right, and Nutan also got it right, but Madhu got it right the first time. So congratulations, Madhu. If you can share your details with our help desk, and we can get in touch, with India Hemp Organics to get your giveaways. Thank you so much for being so interactive, audience. Again, thanks to our speakers for taking time out and being part of our mission.
Thank you so much for having us, Nidhi, and to everybody that participated in Dr. Piyush's questionnaire to win the oil. Thank you. And thank you so much for Dr. Piyush for always sharing so much information and knowledge on medical cannabis. The whole industry is so grateful to have you.
Thank you, Lavina, and thanks, Nidhi. First of all, I would like to congratulate both of you for making, for ensuring that this kind of event is like there, because we need to understand that there are two aspects to this which I see. One is PCOS, which again is there. I would not like to use this term, but it is spreading in a very speedy way in our society. So at least we have a platform now where people are talking about this and taking their time and the focused approach is there, which is very much required, and correlating that to the cannabis and the hemp, the medical cannabis, hemp, and all these aspects. And this particular herb is excellent in terms of pain management, in terms of inflammation, and many other aspects. But the problem here is neither so many people are talking about PCOS, nor so many people are talking about CBD or cannabis. So if we are talking the both aspects on a platform, I think that is one of the most I will say innovative combination I have seen in my clinical practice, and which should continue, and which should maybe I request PCOS Club India, and we can take it forward, that we can have a dedicated session, and we can maybe bring some more clinicians and organizations as well, and we can talk in detail, because this is just one session in this entire summit, but we can have a detailed session later on as well. So because this needs to be discussed. And one more thing I want to specify, and then I will conclude my discussion. I know that other speakers are waiting for the next session. See, one thing which we need to understand, be it medical cannabis, be it hemp, and be it any other plant-based medicine or herbal medicine, the entire thing has been beautifully mentioned by our acharyas in Ayurveda, in our ancient knowledge granthas, and we all predominantly are Indians, and we should be proud of that. But this knowledge now in this world we have to present, and I coined the term as a new age Ayurveda, because when we go to the people and we talk to them about this, and when the solutions they are seeing, and if they are in the form of some kind of solutions which are they are already taking, so that is easy for them to adopt. And I think that was the only reason, as you have seen my profile, and Nidhi mentioned beautifully about that, and thanks for that, by the way. I was in corporate, and I was in many companies, and recently from last few years I have focused on my clinical practice, and by virtue of practicing New Age Ayurveda, and specifically our area of focus is on gynecological disorders, because I have seen so many people are frustrated, irritated, and they are not able to get solution. And with simple solution is Ayurveda, we were able to heal. And when we are healing the backbone, the most important member of any family, I think the entire family connects with us. And due to that, within last few years, we are one of the highest rated Ayurveda clinic in entire North India, with more than 600 ratings on Google, and the Facebook fan following, and so many aspects are there. And I give the credit to First Ayurveda, and to all the organizations, including IHO, for ensuring good quality products, so that we clinicians are being enabled and able to heal them. And one part of the credit goes to platforms like you, Nidhi, so that we are able to attend these kind of events, and we are able to communicate and convey our message to the larger segment of the society. Thank you.
Thank you so much, Dr. Piyush, for concluding your talk and with such a positive message. I hope people learn more from you, and there's already been a great response from people who have consulted you. So kudos to your good work, and thanks, Lavina, again for making time. And as I said, good luck with your mission. I hope more and more people know about it, and thank you for making time today.
Thank you so much.
Thank you.
Great. So with that, we are up next with Nishtha Bijlani. Priya, over to you.
Yeah, thank you so much, Nidhi, Lavina ma'am, Piyush sir. So Nishtha Bijlani is a yoga teacher based out of Mumbai. She's an ex-media professional who turned to yoga at a time when nothing else made sense. It has been 6 years of practicing, sharing the ancient gift of yoga with people from all over India and abroad. Nishtha studied yoga from various respected yoga schools in the country, such as the Yoga Institute Mumbai and the Himalayan Younger Institution Dharmshala. She's also a certified counselor in the robot calcuf and the robot modalities. Nishtha ma'am will be teaching us about healing with yoga and effecting practices for PCOS. She's also a part of Hatya, the restorative yoga, and along with that, she combines her counseling skills with yogic wisdom to help people develop the right attitude to deal with many phases of life. Nishtha ma'am, we welcome you with all our heart. Thank you so much for joining us today.
Thank you so much for having me. I'm very glad and honored to be a part of this summit today with PCOS Club India. And you guys are doing a wonderful job. And I'm so happy to have a little contribution to this that you have created over a weekend. And I really, really hope that many people watching this can benefit from this wonderful event that you have created. So I will move on with today's conversation, which is of course about PCOS. And being a yoga professional, being a practitioner, I would like to shed light on how yoga can have amazing healing benefits to our life. Now, we understand, and I'm sure we have heard enough now in the recent times that yoga is a very important part or should be a very important part of your life, especially when you're dealing with PCOS. But many of us don't really understand how it plays a role, or will it actually work. I've even heard sometimes people say, I've practiced for a while, but it doesn't seem to show results, etc. These are very common concerns by people. So let's understand first about yoga, just a quick understanding of how yoga helps. Now, whether you have PCOS or not, yoga is something that is a phenomenal practice for anyone to have as a part of their life. So whether you take it up because of PCOS or otherwise, it's sure to show its, effects on you. Because yoga, you understand it as stretching, flexibility, okay, just, 1 hour on the mat. But the day we decide to see yoga or understand or open ourselves to seeing it differently and understanding that yoga is much more than that 1 hour on the mat, but it's actually a lifestyle shift, that is when we'll be appreciating yoga for what it actually does. So when we call it a lifestyle and we speak about PCOS, for example, PCOS is a lifestyle disorder, a lifestyle issue, caused mainly by the lifestyle. And when you adopt yoga as a lifestyle, then as a result of which you start seeing changes in many aspects, including PCOS and any other issue a person is going through. So, when we talk about PCOS, even diabetes, thyroid, hypertension, and many such, which all fall under the umbrella of lifestyle disorders, they are greatly elevated with the help of yoga. But now, if we are speaking about yoga for PCOS specifically, some of the most quickly seen benefits would be when a person starts to practice yoga. The first changes would be on the person's nervous system. So, it's like when you start slowly, gradually adding few hours every week, the first impact you will see would be on the nervous system. Usually when we are undergoing moments of stress, anxiety, it's the sympathetic nervous system, which is the fight or the flight mode, which is always staying active. So the body, the mind are not able to really rest. And we're constantly in the state of panic or unease. And that state of relaxation doesn't come in very easily. But when we start practicing yoga and allow it to have its effect, we are then able to stimulate the parasympathetic nervous system. And with this, we are then able to heal our nervous system. And we do understand one of the major issues when it comes to PCOS is stress. It could be a very highly stressful lifestyle a person is going through, or some traumatic events in their life, or certain life episodes which have caused immense trauma, immense stress, which could have played havoc with a person's hormonal functioning. Or it can be the stress that is caused as a result of the condition, because you're worked up or worried about the symptoms, irregular periods, acne, hair fall, etc. Either way, stress plays a very important role. So when we first start to submit ourselves to yoga, the nervous system starts healing. As a result of which, everything starts like a domino effect, changing, taking shape. So the endocrine glands work much better. The adrenals get some rest because we're constantly producing the cortisol, and we're always under that stress. So those things start changing. As a result, hormonal functioning starts improving, regularizing, metabolism gets a spike. We have seen commonly that obesity is linked with PCOS. Weight gain is very common, and dropping that weight becomes an issue because the metabolic rate is also affected greatly. So as a result, yoga starts showing, changing a lot of those things in our life. And more than anything, even when you just start with your asana practice, when you haven't even taken it as a lifestyle, but all you're doing is your yoga asana practice, very first changes would be the feel good feeling after your practice. You feel connected to yourself. So with yoga practice, we are able to develop that bond, that connection with our own bodies, with our own thought processes, with our own breath. We're able to reclaim our breath. And this is something we just have forgotten as we started to grow up and have just allowed the, the world and life around us to take over. So these are the small things that, happen. So I would call it going back to your roots. I would call it reclaiming what you already had control of. So that is one of the first shifts that starts happening with yoga. Now, we've also seen, we have the digital world around us. We've seen things on social media, YouTube, etc. Plentiful videos on here are 5 asanas that can cure your PCOS. Here are, 5 magical yoga practices that can treat PCOS. I'm sure by now we do understand that there is no cure or treatment, so to say, for PCOS. Yes, it can be managed very, very well to the point that you don't really feel anything or any of its symptoms, right? And your hormonal functioning can really stabilize. Yes, it can happen. But to make claims or for you to, fall for things like this is going to cure and just 5 asanas are going to make the difference, no. They may be presented as asanas which can help you, but trust me, it is actually a full practice, a full lifestyle change, and parallelly working with your doctors, getting the right advice and the right guidance that will actually help you. So I would really strongly suggest to not fall for any of these, clickbait videos where you just say, when you see cure and treat PCOS, no. We have to also see that PCOS is not the end all and be all of, our life. It should be, in fact, taken as a wake-up call from your body that, it's time to check within. It doesn't happen overnight. Yes, we do understand that PCOS doesn't just develop overnight. It's as a result of years of neglect, for example, or other health conditions which may cause issues with, the hormonal functioning. So it's always as a result of over a period of time that it develops. So we have to understand that there has been neglect, there's been lack of care, and PCOS has come in as a wake-up call, as a reminder for us to check within. So it's a great opportunity to re-establish that connection with yourself, with your body. So, and as women, we anyway have it. It comes to us naturally to be caring towards others and ourselves. But we sometimes get so focused to the, to our surroundings, to the people, our families, that the neglect is first felt towards ourselves. And I think PCOS is a great way to really work within. As women, we want to be able to connect with our reproductive system, with our moon cycle, with the menstruation. So those are one of the first shifts that we can start to make with the help of yoga. And also I want to talk about what are the physical practices. Even when I speak of yoga, I also want to speak of exercising. One of the first things that, experts, health professionals will tell a person with PCOS is, please start exercising, because insulin resistance is seen very often. Obesity is seen very often. Feelings of depression, feeling very low, and mood is affected. Hormone, as a result, of course, we know is affected. Because of which, if you start exercising, all of these things start getting taken care of. We understand the metabolic rate also increases. And with exercise, if you talk about even yoga asanas or any other form of exercise, sometimes I have seen concern amongst people as to which form of exercise shall they go for. So if obesity is a concern, yes, you would want to increase, the amount of, say, hours you put, but do you have to immediately go head on into it and take on an intense practice? Not really. You can start slow, especially if you're someone who hasn't done much of a workout in your life or haven't exercised much and you struggle with that. Start slow. I would say one of the best ways to get started with a movement practice would be with yoga asanas. It will slowly give you that confidence that you can, move your body, feel connected, and you get the feeling that, yes, I can do this. So yoga asana practice, maybe starting 3 times a week and slowly increasing, would give you the confidence and that connect with your body. And then when you have, suppose, weight issues to deal with, confidence issues to deal with, you can start including strength practices. So it can be a calisthenic practice. You can go for, I would say a workout in the gym, or going for some, freestyle movements like kickboxing, martial arts, dance, Zumba, etc. can then slowly be added. But it would be advisable to not immediately shock your body, because here we're also speaking of stress. And even something like a workout, which is supposed to, release happy hormones by the end of it, shouldn't be a practice which gives you stress, right? So we want to go slow. We want to allow ourselves to accept something, let things shape up gradually. And with yoga practice, if I'm to kind of, put a parallel between other forms of exercise and yoga asanas, with yoga asanas, and when we include even pranayam, dhyan practices, meditation, it really starts to help and have a calming effect on our mind. It helps us to have a shift in the thought processes, the way we view ourselves, the relationship that we have with ourselves, the way we speak to ourselves starts changing. So when you're speaking of other forms of exercises, they primarily function at a physical level. But when we speak of yoga asanas and also speaking of pranayam, dhyan, they help us to just view and ourselves differently. A perspective change happens. And that is really important for us to make a lifestyle shift. So when I also earlier mentioned that yoga is not just an hour on the mat, and it's not just the 60 minutes that you spend on your mat, it actually begins the moment you wake up. When you wake up in the morning with a prayer of thank you, a gratitude, it starts right there. When you land your feet on the ground and you allow yourself to establish the connection with the earth, grounding your feet, that's when yoga begins. When you take your first sip of water very mindfully, appreciating the beauty around you, if you're sitting by the window, that's where yoga is happening, right? When you consume foods which are rich and high in prana, fresh, healthy foods, that's when yoga is happening. When you're feeling extremely anxious, worried, but you tell yourself, I'm going to be here right now with myself for few seconds and be aware of my breath, appreciate the breath that is flowing through me, that is where yoga is happening. Yes, so yoga is happening in all of these small things. That is why it is a lifestyle shift and not just the physical movement, which we associate with flexibility, stretching, etc. Right? There's a lot happening there. And even when you are to take up yoga practice for your lifestyle, and you may have seen different styles of yoga, which are called power yoga, for example, hatha yoga, Iyengar, for example, how do you know what choice to make? I would suggest that it would be helpful for you to start with something which is not too intense, which is something that is comforting, relaxing. So before one decides to jump out of their comfort zone, right, that is a great thing. You can want to challenge yourself eventually. But before you do that, you want to find comfort in it, right? So you want to first develop the ease into the practice, starting with a hatha style practice or Iyengar style practice, or even taking up restorative styles of yoga practice, yin style of yoga practice would be very helpful from the physical aspect. And slowly starting to add breath practices, simple breathing, breath awareness, going on, eventually moving towards pranayam, and including guided relaxations, guided audio meditations would be very, very helpful. Because sometimes you just need that, external guidance to help you. Initially, it may feel difficult to meditate on your own. And today we have plenty available audio tracks, videos, etc., which can help you with a guided relaxation like a yoga nidra or meditation, any kind of dhyan practices that you can find. Or if you have a good teacher that you can reach out to, that would be the most helpful thing for yourself, to be guided by a professional, a yoga professional, to take you through this. Now, if you have a mat with you and if you're ready to join me for a little session, I would like to give you a glimpse or a peek into a practice that you can probably start doing on your own. Do I say that this is the practice to completely take care of PCOS? No, you have to make it a holistic practice with a yoga professional, and slowly make it a more comprehensive practice. Today, we're going to do a very simple, easy, relaxing practice to help you to weigh off the stress and the anxiety which you may experience on a daily basis. Okay, so we will get started. I'm going to be getting onto my mat, and if you would like, you can join me. So we can first just begin in a seated position in Sukhasana. So I'm using a yoga block to sit on. It allows me to be upright and higher. My spine is able to stay straighter this way. And a simple cross-leg position will do. We'll first begin by preparing the body, the mind. So we'll just establish a little meditative silence first. Once you're seated comfortably, just check on your posture, allowing your head, neck, trunk to be aligned. Palms are rested on the lap downward or upward as you're comfortable. Slowly, you may start closing your eyes and shift the awareness inward. Just take a few moments here, being still. Now, just being aware of the posture. How does it feel at your feet, the ankles? Scanning your body mentally around the legs, the hips. Checking on your spine. Checking on the abdomen, the belly, the chest. Moving your awareness on your arms. Relaxing your shoulders, the neck. Creating a softness in your facial muscles. Loosening up your jaws, your mouth. Relaxing your forehead, the crown of your head. Taking this time to arrive inside your body, to be fully aware of every physical sensation that you may experience. To remind yourself to be an observer, not trying to change anything about this experience right now. Just being a witness to it. Letting the breath flow freely in and out of you. And let's take one full breath in here. Inhale, allowing the breath to fill up entirely. Exhale to freely release the breath out. Gently move your fingers. Slowly begin to open your eyes. And now we release out of the seated posture. And you may come on your palms and knees as we move on to cat cow or Marjariasana, Biddalasana. So very simple one. In fact, something you can do as soon as you wake up or even in the middle of the day. A very good one to awaken the spine. Start by opening up your spine. Inhale, look forward. Exhaling and rounding the back, press your chest up, navel up. And continue to move this way a few times. Inhale and open. Exhaling, rounding your back. Make sure you're keeping the movement going with the breath. Inhale as you open. Exhaling, rounding the back. Let's go one last time here. Inhale, open. Exhaling, rounding the back. And very slowly release. Now we will sit back on the heels. You may allow your knees to open up a bit wide and keep your big toes touching each other. And we start to walk the hands forward as we move into Adho Mukha Virasana, allowing the chest or the chin to lower down or the forehead to be rested and holding here for a few breaths. Keeping the elbows straightened out and spine lengthened. And then very slowly lift your head, start to walk your hands back. From here, we move into Adho Mukha Svanasana, also known as the downward facing dog. So spread your fingers, curl your toes here and push your body up. Have a good distance spread out. Press the ground. You can also bend your knees a bit here to better balance yourself. And being here for 5 breaths. And then slowly bringing your knees back down and resting in child's pose or balasana. Now in here, similar to the one we did before, but we keep our thighs together, knees together. Allow your arms to be forward, or it can even be on the side. Rest your forehead down. Inhaling slowly, lift yourself up. Great. Now from here, we'll come into Badha Konasana or the butterfly bound angle pose. Can we call any of it? And you have your feet joining in, keeping a little distance between the heel and the groin. And from here, we will start to just lengthen the body a bit forward. I'm holding onto the feet, allowing the elbows to go a bit to the side, shoulders going a bit to the side. See if you're able to allow the elbows to press gently down in towards the legs, moving your body forward just as much as you feel comfortable. You could also be a little higher if you find it difficult to do that. Just spending a few breaths here, releasing the tension between in the inner thighs and the groin region, freeing up that space, gently opening up your hips. And very slowly, if you're comfortable, start to walk your hands a bit forward, creating a little extension there. And slowly release, walking out of it, come back out. Now from here, we move into Parivrtta Janusheshasana, wherein I'm going to keep the heel in towards the groin one side and the other leg opening out to the side. Right, so one leg out, one foot in, and here check how we are seated. Make sure you are seated comfortably. You can also take a little cushion or a block if you find it difficult to sit like this. And we're going to simply allow the hand to slide towards the leg. So I have one hand on the waist and simply allowing the hand to reach for the foot or in front on the mat. Walk it out, and stay right here. Allow the shoulder, the chest to be open. You walk only till you feel comfortable and keep your chin in towards the chest. Allow the breath to flow freely. We'll spend about 7 to 8 breaths here. Then very slowly release, come back. Let's repeat the same thing on the other side. Having the heel in, opening the leg on the other side. Okay, once again, once you adjusted yourself, same way, let's start to slide the hand towards the foot. The other hand on the waist, open the elbow, shoulder back, chest opening. And very slowly release, coming back out. Now from here, we're going to open up the second leg as well. So we sit like this in a V shape. If you find it difficult to keep your spine straight, you can always keep your knees bent like this, works perfectly fine. And if you're comfortable, you can allow your legs to be dropped. You just want to pay a little attention to the spine. It shouldn't be rounded. All right. And once you settle, let your feet be a little active, toes curled in towards you. We're going to move in for Chakki Chalanasana. So we're going to move in circular motion. Let's interlace the fingers here. You can begin from your right side. Exhale, moving forward. Inhale up. 5 circles. Exhale forward. Inhale back. Exhale forward. Inhale back. Exhale. Inhale. Make sure you're combining the breath. Exhale. Inhale. Then you can go for 5 circles on the left. Breathe out. And coming back, breathe in. Going 4. In. 3. Exhaling forward. 2. One last time. Completing the circle. Go as much as you can forward to the front. And then we let the hands reach the thighs. Take a few seconds here. Okay, now from here, we're going to move into Upavishta Konasana, wherein you can have your hands either walking to the front or you can have your hands reaching out to the legs. So we go for a fold in the wide leg position. So once you're seated comfortably the same way, even now you can be seated with the knees bent if you find it difficult to keep your back upright. Let's start by extending the arms up, inhale, and see what's more comfortable, either going to the front or reaching out with your hands. Going forward just as much as you're comfortable, even right here is good enough. There's no problem with this. If you're comfortable, start to walk your hands forward. And when we are moving forward, try to look ahead rather than looking down, so that you are having a more open spine. When we start to press the head down, the back goes in a turtle shape. So we instead want to keep the spine open, chest open, creating the length. Staying here for a couple of more breaths. Easy breathing. Allowing yourself to be able to experience every physical sensation. Noticing the changes in the breaths. And from here, slowly inhale, use your arms and coming back out. Great. You will then start to bend your knees in one by one, come back in. And we're going to lie down on the mat, going in for Setu Bandhasan or the bridge pose. Again, a very, very effective posture and has wonderful, many benefits. It helps us to open the tight sacral region, which also is very good for reproductive health, for your uterus as well. If you are somebody suffering with menstrual cramps as well, can be a good one to elevate the feeling. So let's lie down. Allow your head, neck, trunk to be rested comfortably. If you have the hair coming in the way, please move it out. Let's have the palms by the sides. Walk your feet in nicely, and then we're going to raise the hips up. Inhale, pick the hips up nicely. See if you can roll your shoulders inward and allow the chest to make space, opening it up. I'm actively pressing the feet and working the hips up, creating a nice extension in the front body, holding here. Then very slowly release and allow your hips to come back down. Take a moment. Inhale, exhale. Let's do this one more time. Picking the hips up. And exhaling very slowly, allowing it to come back down. Now from here, we will take the knees coming up towards the chest, having your knees and thighs joining. Open up your arms to the sides. We'll go in for a twist here. Exhale, twist and fully drop down towards the right side. Reach the ground. Allow your knees and feet to be stacked one over the other. Head turns in the opposite direction, staying here. Inhale, slowly come back up. Exhale and twist. Breathe. Again, inhale, come back. Let's change. Exhale, twist one more time, looking to the other direction. Inhale, come back up. Change. Exhale, twist. Inhale, slowly return back into the center. Now for a moment, I'm just going to sit up and I'm going to place a bolster. You can do this even with a pillow or two, the long pillows which we use to sleep on. So I'm having a bolster here on which I'm going to recline and move in for Supta Baddha Konasana. That's going to be the final posture for today. I'm also going to be speaking through a breathing practice known as Samavriti Pranayam, as we will be on this, on the bolster in the position. Yes, so for Supta Baddha Konasana, you want your hips to be on the ground and rest of the back and the body reclines on the bolster, keeping your feet joining here, letting the legs open up in Baddha Konasana. If you're doing this with me and if you find this intense, you can straighten up your legs eventually, that's fine. Now here I'm going to recline to the back. allowing my knees to be dropped. It's an amazing, amazing posture. There's so many benefits when you work with Supta Baddha Konasana. Extremely relaxing as well. Now, from here, I can have my hands rested to the sides, or you could also place one palm on your belly if that's comfortable for you. First, we start relaxing the body entirely. Shoulders, neck easy. Relaxing the entire spine on the pillows or bolster. Relaxing the pelvis, the abdomen, the chest. Relaxing your facial muscles. Loosening up your jaws. Relaxing your lower extremities completely. Allowing the legs to weigh down towards the mat. And feeling the entire body heavily pressing down. Let there be no control, no resistance within. Just fully allowing yourself to surrender. Now start noticing how the breath is moving through the body. We're going to go for a few rounds of Samavritti or equal breathing, wherein you have equal length inhale, equal length exhale. So I will give you counts and we're going to allow the inhalation to enter for 3, exhalation to release for 3. Let's do this together, placing your awareness on your navel center. Inhaling 1, 2, 3. Exhaling 3, 2, 1. Inhaling 1, 2, 3. Exhaling 3, 2, 1. Inhaling 1, 2, 3. Exhaling 3, 2, 1. Last time as you inhale for 1, 2, 3. Exhaling 3, 2, 1. Then return back to easy breathing, natural breathing through your nose. Continue to be here for the last couple of moments. Then very slowly allowing your fingers to move, your toes to wriggle. Start bringing your knees coming into each other. Roll over to your right side and slowly sit up in a cross-leg position. Take a few moments here. Reset yourself. You then take the palms rubbing into each other, creating the warmth. And cupping it to your eyes. Move it all over your face. Take it to your neck, shoulders, across your arms. Slowly bring the palms back into each other and gently open your eyes. Thank you very much. Thank you for joining. So this was just a little glimpse into how a yoga practice can be if you allow it to be a part of your life. You're on mute, Nidhi.
Sorry, that is happening every time.
Yeah.
Thank you, Nishtha, for such an informational session. In fact, the talk that you gave in the beginning was very, very nicely done, giving all the important things and reiterating certain things that we don't take care of, mostly in our very busy world. So thanks for taking us through all these important lifestyle and simple habits that you can include in our daily lifestyle while going through chronic conditions like PCOS. And in fact, as you rightly said, a lot of people in our community, they have had an experience trying yoga but did not see the effects. So it was really important for you. So whatever you said, I hope this sort of clears a lot of questions from the audience. We do have some people who have some questions, so I'm going to ask you these questions. So first question is how to approach yoga by when there is a trauma history.
So I would suggest the person who has experienced trauma, yoga can be so healing. You know, there are times when we have practices, and I have students who have like cried during Shavasana because they've allowed the emotional baggage and the emotional release to happen. What we don't sometimes realize is very psychosomatically we're storing so much of emotion and pain in the body. So when we even move physically, for example, we are releasing not just the stiffness, but also the emotional storage. We have like the hips, for example, the neck, the shoulders, they store a lot of emotions. And just by simple movement, combined with the breath and of course with the guidance of the teacher, you're able to find that release. That would be one at a physical level. But when you talk about real healing, it would be very beneficial for the person to then allow their practice to move into more breath practices, focusing on specific pranayams and also guided meditations. They can be so helpful, and that basically helps you to do the work within, because there's a lot of unresolved emotions or unresolved things that are stuck and we're still holding on to, which can then happen. And the person can also combine that with counseling. So both will work very, very well. Therapy, counseling, a lot of artwork, for example, or even dance movement releases can be put together for a person to find that release.
Thank you. The next question is, in terms of exercise along with other lifestyle changes, is practicing only Surya Namaskar enough to help reverse PCOS? If not, then what are the other yoga practices would be needed?
So see, again, it goes back to when we are clueless and when we don't know how to approach yoga, we need to find the right person to help us do that. Okay, when PCOS are severe, it would be advisable for a person to take a one-on-one guidance from a teacher to help you. Just 12 rounds of Surya Namaskar, will they help? That doesn't really act as a yoga practice, in my opinion. Yes, it would be a physical form of movement. It will be your exercise. But for it to have a holistic effect, just 12 rounds will not be counted as I'm practicing yoga. So if a person is to approach yoga, you have your exercise, you do your exercise. So suppose you're doing 3 to 4 times a week of any other form of workout, keep at least 2 or 3 days a week of pure yoga practice. Don't try to mix 2-3 things in that given time session, which you call exercise or workout. The moment when we start viewing yoga not as workout, but as practice, but as something that is therapeutic, then only we will be able to see its benefits. Yes. So again, it goes back to what I said. Do not think 5 magical asanas are going to do the job. It has to be a complete holistic practice, and never to skip your shavasana when you're doing your practice. So that is what seals the deal, So just doing 12 rounds of Surya Namaskar is just an exercise. That is not yoga. It's just an outward practice. So it doesn't help in that way.
And I can totally agree, like in the sense, I can totally relate to these questions which are coming from the community, because in the fast-paced world that we live in at the moment, we're often advised that, these are the things that you can do and get your movement in. But that's good for to start with. But when you're looking at the whole experience, I think we've spoken about it before, that our bodies get used to the movement that we're doing. So what benefits you were getting on that exercise, your body needs more improvement. So it's all about practicing and developing and improving your, practices, as Nishtha explained in these in her sessions. Shilpa has a question that I have a severe lower back pain issue. So can yoga be done on the bed, or any other way that I can do it? Sitting on PDS becomes uncomfortable. If I sit on the floor, the tailbone starts to pain. Please suggest a way.
So when you talk about lower back pain, definitely you can do, I would say, supine twisting on the bed, but I wouldn't suggest anything more on the bed, because the bed and the mattress are not the best for us to, do the rest of the practices. When you're doing it on the floor, you have options of certain mats which are cushioned enough to help you, be seated comfortably. But I would really suggest, one, to not do things, just by looking here and there on your own. To also have somebody who's guiding you, like a yoga teacher or a professional. And when you said that your tailbone hurts when you sit down, so say for example, right now I mentioned when I was sitting, I use a yoga block. What that does is it gives me that little height, and just enough height for me to be upright without my tailbone getting that pressure, and making sure that you're not doing, generally speaking, for lower back pain, that you're not doing forward bends. So if you're in a seated position and you think you're going to do a forward bend like Paschimottanasana, for example, that wouldn't be the best for your lower back issue. More back opening ones, for example, a Bhujangasana, gentle Bhujangasana, or Sethu Bandhasana for that matter, or supine twisting would be better. Certain standing postures would be better. So again, this has to be done because it's a specific issue. It has to be attended very specifically so that it has the right effect on you. So certain props can be used for you to find the solution.
Is it always important to practice yoga out in the open, in balcony or terrace? So what is the ideal difference in time between food and yoga sessions?
When you talk about the venue and the place of practice, I'd suggest, in fact, just do it indoors, because even though the idea of doing it outdoors on a balcony, terrace, or in open air in a park seems ideal or exciting, or it looks visually beautiful, but trust me, there are a lot of factors that you cannot control in the environment. For example, extreme heat, for example, wind or rain or whatever it is. So if you're doing it in an indoor environment, which will be much more effective for you, and you'll feel the difference, and you can make sure that wherever you're doing in your house, you can keep the ventilation going. So having good natural ventilation, avoiding AC or direct fan on you, just making sure that the room is well ventilated, the air is circulating. Speaking about the gap between food and yoga, if you can, ideally best to wake up early in the morning and do it empty stomach. If you're somebody who has low BP and you constantly feel dizzy or lightheaded, you can take maybe a few dried nuts or raisins or dates, sweet or dry fruits, so that you don't have that sugar issue happening there. Or if you are to do it at a later point in the day, which could be evening preferably, making sure you at least have 3 to 4 hours of a gap after a heavy meal. A snack is still okay if you take 2 hours, but if you had lunch or something, 3-4 hours would be advisable.
Great. Somebody asked, my knees ache while doing Baddha Konasana. Is that okay?
So first you have to address what is the pain, what is the reason, what is the issue with your knee. And once you are able to diagnose that, then you would be, then it would be told whether you should do it or not, or whether you should do it with a modification. So currently, if you don't know what the issue with your knee is, avoid Baddha Konasana and bending, the postures which require to bend your knees a lot. Another thing you can check with Baddha Konasana is, like I mentioned earlier, don't keep your heels very close to the groin. Keep it a little forward, so that releases the pressure on the knees, and see if that makes a difference for you.
Okay, so we're going to take the last question and jump right into also talking about your, how we can consult you. So can practicing only yoga, so we got this from 3 people, can practicing only yoga is enough, or do we need to combine it with weight training and cardio? I think you did mention about it a bit earlier, but yeah.
You can definitely combine it. There's no issue with it. Both should be treated as different practices. Like earlier when somebody asked, can I also merge it with my Surya Namaskar, along with the other stuff? I would say keep it separate. There is no issue if you're taking 2 practices, but you can first check what is your purpose and what is the reason you want to take. For example, if obesity is an issue, weight gain is an issue, or metabolism is an issue, then you can gradually add strength training to it. But if you have, say, never worked out in your life, you've barely moved, done any form of exercise as such, yoga would be a gentler way for you to start off. And then slowly, when you have, more body awareness, when you're feeling better to move and add on the intensity, then definitely you can add strength training or any other form of exercise. So you can keep it gradual. Don't just attack your body on senses. Allow yourself to slowly ease into it.
Great. So Nishtha, you are already, working closely with our community, and you're empaneled on our validated approved health experts as well. So anybody who's looking for consultation, you can reach out to the number that is provided on bottom of the screen, and we can help you get in touch with Nishtha. Alternatively, Nishtha, do you want to say how people can get in touch with you?
I believe you will be sharing my other contact details in the form of social media handles. I'm available. I'm pretty active on Instagram, and my handle is @Nishtha Bijlani. My name is spelled as NISHTHA. Bijlani, BIJLANI, and that's all. I can also be reached on my website, and I have an inquiry option there. My website is nishthabijlaniyoga.com. And my email address is nishthabijlani@gmail. So I believe all these details are being shared by you as well. So yes, you can directly reach out to me through these platforms, and I can help you in the best way possible.
Great, Nishtha. And I would like to thank you again for volunteering for our segment on yoga. It was truly, truly helpful, and we learned so many important aspects which are mostly overlooked in our daily lives. I really wish you all the very best for the mission that you've been working on, helping so many people. Again, thank you for your time today.
Thank you so much for having me, and wish you all a very good luck, especially PCOS Club India, and good luck to all the people who are watching. And I hope you have plenty to gain from this weekend summit. Thank you so much. Best of luck.
Thank you so much, Nishtha. Thank you so much, Nidhi ma'am. We will move forward with the next session. So we have Ashina Jain from PSafe and RahoSafe, and she shall be sharing her own story. But before that, we shall also be talking about our sponsor, which is also PSafe, and talking about how Ashina has led a change in her own movement. Now, PSafe is a brand that is loved by almost everyone in India. PSafe is India's leading feminine hygiene brand. Our vision has talked people to talk more freely about personal hygiene. India, being a developed country, has seen many taboos surfacing about menstruation, and we have used social initiative Housie period that works to eradicate period poverty by giving them access to menstrual education, menstrual products. Under PSafe's initiative, they have catered to over 3,000 people and has distributed over 1 lakh sanitary napkins with over 95 organizations in 90 plus cities. Thank you so much, Ashina, for joining us today. We are overjoyed to have you here. If you're looking for the agenda of the session, please look at the live ref to your screen. And if you're looking for the helplines underneath or for the questions, please also look to the left of your screen, especially at the bottom. Thank you so much.
Thanks, Olapriya, and thanks, Ashrina. Welcome on board. We're so excited to learn from you the good work that you guys have been doing with Housie period, and we all learned about PSafe as well. So I would like to take this opportunity to learn more about what Housie period is all about and the work that you've been building, what we could learn from you. So over to you about explaining what the mission has been and what have been achievements so far.
Firstly, thank you so much for this lovely introduction. I am honored and pleased to be a part of this summit today. I think what PCOS India today, your club, is doing is extremely important because it's a very common problem that a lot of women are facing. So thank you so much for this introduction. So like you mentioned, PSafe is India's leading feminine hygiene brand. I'll quickly tell a little bit about the organization. So we started off in 2013 when Mr. Vikas Bagaria and his wife Srijana Bagaria were out for a road trip. And, they had to abandon their trip because Mrs. Bagaria faced severe UTI infection. And, UTI is also not talked upon because it is known with respect to, vaginal fungus or, infection in your vaginal area. And people are still very, very shy to talk about it. So she was in such a bad situation where she had to be hospitalized. That's when it came to Mr. Vikas that, this is a problem which has been faced by many individuals, and the sanitation of a country in public bathrooms is not good. The conditions have never been good when it comes to public hygiene, right? So this strike to him about how we can start with our flagship product, which is the toilet seat sanitizer. When he was experimenting it, he did not get a single negative feedback. So clearly there was a need for this, right? And even today there is a need for having safe sanitation awareness when it comes to public toilets or even UTI for that matter of fact. So that's when PCA started their journey in 2013. In 2017 is when they took shape as a brand. Over the years, we have come a long, long way. We have sub verticals now catering to different issues in our community. For instance, PSafe is the umbrella, and the sub brands that we have is Domina, which takes care of sexual wellness and sexual health. Fur is for self-care. Housie started off initially for COVID essential products and economical range of sanitary pads because of the mass population which still does not use any menstrual product. And PSafe working towards more of sustainable menstrual product, which caters to menstrual cups, reusable sanitary pads, biodegradable pads, and tampons. So over the years, our brand as a communication has always focused to talk about the subjects which are tabooed and stigmatized in our community. It was really difficult for us and it still is. But at the end of it, we feel it's our responsibility to make sure that we actually state the facts and the myths and kind of educate our consumer base as well. So while we are doing this, it also struck us that that time when we started Housie period, there were only about 27% of the menstruating population had access to period products, whereas the rest was still using dirty cloth, hay, or mud to manage their flow, even being in the 21st century. So that's when Housie period took birth, and we started out last year in September, and we're going to very soon going to celebrate our 1 year of our initiative. When we started off, we were targeting rural and remote areas of India. And we didn't want to only provide accessibility of menstrual product, but our focus was to kind of spread awareness and to get a behavioral change. It's very easy to, give out menstrual products. You give out menstrual products to a community for good 2 months, 6 months, a year, maybe 2 years maximum. But, do you expect the third year, are they going to be going out and purchasing a pad? Are they going to not wrap it in a black polythene and come back home that they do need these sanitary pads? So our whole approach is to kind of get behavior changed, or in our target audience, which are menstruators, to realize that menstrual products is absolutely necessary. It is a need that every menstruator has. So that's what our approach has always been. So far, we have been able to distribute actually more than 500,000 of menstrual products. That was only by the help of our organizations, our partnered NGOs and foundations who are also working towards the same cause. Again, this is also only behavioral change programs that we have done. During the pandemic, even our volunteers faced a lot of restrictions of not going on field. So we made sure that we connected with them virtually. So we conducted more than 160 virtual programs and catered to more than 10,000 menstruators virtually. So we made sure that our education is not stopping because of the pandemic, because this is also something which we believe should be a mandate, in even government colleges or Anganwadis, which is not given importance at all, which is really, really sad. Because when we encounter young girls, when we speak with young girls, there were times when they told us that they thought that they had injured themselves. They thought, because a lot of brands were also advertising blue liquid. I'm very happy that this is slowly changing with the bigger brands. But they really thought that they were supposed to bleed blue and not bleed red. So they were in this misconception that, they have hurt themselves so badly that they're going to bleed and die. So we have encountered so many things like that, where we realize that, education needs to, like government schools and government bodies need to really up their game and, make sure that this is something which is mandatory and not something to be ignored. And not only in government schools, but I would also say a lot of private schools, they also don't talk about, they brush off the topic very smoothly, and they say that, yeah, we'll just like cover the topics from, they won't get into the nitty-gritties of it. So that's when we also started with our fellowship program, where we will be onboarding about 10 to 13 individuals from different cities of India. And we will be, training them and giving them a certified course to become an educator and a menstrual hygiene management trainer, so that they can actually reach out to these communities in their areas. And we know that we, from our end, have pushed these 12 educators out there who we know are now going to take the next step forward by, making menstrual hygiene management the subject to be taught and learned. So that is a little bit about Housie period and PSAFE.
Thanks, Ashrina. Congratulations, first of all, for the kind of mission that you, on behalf of PSAFE, are leading, and bring the change, much needed change India requires. Now, having said that, we would also like to know what have been the achievements so far. In the sense, what are the things that you are planning in future, and what are the achievements that you are proud of?
Okay, so something that I'm really proud of are a couple of the projects that we did under Housie period. One of them being the inmates project. I think I was, we were going through certain articles and reading about it during the pandemic, and we didn't realize that, while we were focusing, in communities outside, there were people inside who were not getting the adequate resources that they needed during the days of menstruation. So I reached out to a lot of government bodies. I reached out to the Haryana government, because that's where our office is. And with the help of one of our IAS officers that we were in touch with, Mrs. Aprajita, I got in touch with her and I said that, I really want to do this project, and I think that this is something that we should focus on as well. She's like, sure. And, she got really intrigued about it. And, we spoke about it and we jotted down a proper plan. And when I got in touch with the Haryana government, they said that due to the pandemic, they're displacing all the inmates to other district prisons, because, they cannot have too many people at one place. So they're like, how do you plan on doing that now? Like, are you planning on going to each prison? But we don't know the amount of prisoners over there. So Ms. Aprajita, she actually helped us, and we visited the Neemka jail in Faridabad, where there were maximum numbers of female inmates, which were about 65. So we actually went inside there with our group of ambassadors. We were 3 of us. And, we went and we spoke to them. It was an interaction that we have, because they are locked in that community of those 65 people. So we thought that, having an interactive communication to understand what problems they are facing, or what are the resources that they're not getting, and, what do they do in case they don't have these resources. So after that, communication and, that interactive session that we had with them, we provided them sanitary pads again for about 6 months for all those 65 inmates. However, we know that we created access for those 6 months, but we also wanted to make sure what they can do post those 6 months. So we gave them a little bit of tips and tricks to understand why do you get period, what you can eat if you can get it from the prison office, if you can request them, what are the other facilities that they need, like, clean water. So those kind of requests we had put in down to the police officers. And they did give us good news that they were giving that, because they realized that this is also very important. Because we wanted to target the whole state, the Haryana government was extremely helpful. They connected about 350 inmates virtually for us. So we connected together on one Zoom screen. We had about 350 inmates, and we conducted about a 2.5-hour session with them on why periods take place, what are the important factors to keep in mind when you're on your period, how to maintain hygiene during these days. And the kind of questions we were getting were very overwhelming. And we were really happy for the fact that we did kind of target and we achieved this project. And it was quite a success for us. So this is one of the key highlights for Housie period, for covering all the female inmates of Haryana. Yeah,
that's amazing. I mean, I think the kind of length and depth that you went into to organizing this and thinking about people that might be affected is truly inspirational. That's some great work that you've been doing with Housie Period. What are your future goals at the moment, and what are the other projects that you're working on?
Right. So, this is an ongoing project for us, and this is something that we don't want to leave at any given point of time because due to the pandemic, the percentage of accessibilities to menstruators have decreased drastically. From 27%, it's gone down to 13%, which is shocking to us because, of course, people do not have affordability, right? They don't have the money to even purchase pads. Even the kind of conversion which took place from 13 to 27 happened, but now it's just gone back down. So our future goal is to create a community. We are going ahead with a holistical approach. It is not something that we alone can end period poverty. That is not something that, we have an approach with. We want to collaborate with other organizations. We want to work with other foundations and help them in whatever capacity that we can, right? So if you see about our future plans, our aim is to build up a community and create a safe space where people can talk about period freely and can talk about menstruation freely and get all the required knowledge at the right time. We with the fellowship program, that is our next big project where we want to educate and certify 10 to 15 young individuals who we know are responsible enough to now kind of spread this awareness to even the ground root level, or to go deeper to the problem and understand how we can bring about a change to help people get a behavioral change out of them. And yes, thirdly would be the accessibility. The myths are so strongly and deeply rooted in people's mind. I conducted this one workshop in Rajasthan where there were about 85 menstruators, and I asked them that why do you believe in these myths? Why do you not enter the temple, or why do you not touch a pickle? They had no answer to. They were just blindly believing it because they've been told so, and they didn't know any better. They were never taught about it. They didn't have any logical reasoning behind why they're following it. So this is the kind of change that we as a brand feel are responsible in bringing about. We want to tell them why you should follow it, why you should not follow it, and then get the practical knowledge out of it, right? So I think this is what our focus is, and this is what we are working towards.
Great, and I think there's so many takeaways for somebody who's trying to build community, who's trying to do the community service. So many things to learn from, and what you as PSafe is doing as community building alongside your products is truly helpful and inspirational. There's a question from the audience: is raising awareness about menstrual cup a feasible option in your initiatives given the environmental benefits of them?
Yeah, so we have done several menstrual cup workshops. We did it also with Path Squad, which is one of the very famous initiatives which works towards bringing about a change in the field of menstruation itself. So the only difference or the only problem that we face is the insertion, right? People are very hesitant when it comes to inserting. I think there's a big roadblock. There's a big block in people's mind that, if you're inserting something, you might lose your virginity or you might hurt yourself. So there are certain difficult paths or difficult roadblocks when it comes to menstrual cup. However, it's not impossible. However, I feel that menstrual cup is one of the best solutions to someone who's menstruating. I'm a cup switcher, and trust me, it has made my life so much easier. It is sustainable. It goes for 5 years. I don't have to worry about anything. And the fact that I know that I am not adding to the pollution has just made me feel even more proud that I'm a sustainable menstrual bleeder. So I think our future aim is for everyone to switch to a sustainable product. That is definitely the aim. But we also have to understand that in these remote and rural communities, the biggest problem is the money factor. And these sustainable products, even though it's a one-time investment. It's a lot for them. So we have done these projects where menstrual cups have been beneficial and they have switched successfully, because we make sure that, we kind of reach out to them after every 3-4 months and make sure that they are using the product. And they do switch more comfortably to rather than a pad, and they will be happier because you're giving them something which will work for about 5 years. But yes, there are certain roadblocks with menstrual cups, but we are completely up for that challenge, and we have taken it up.
And I think India is doing some great progress with so many successful stories and a lot of influencers and brands doing some great work. So I think we'll get there soon and catch up with the West world. But great work, Ashrina. Congratulations to you and the team. And thank you for supporting us and joining our mission as we talk about one of the most highly spread chronic condition and very least talk about, that is PCOS. And there are some questions about the products, about PSafe. You might want to go to Sponsors Lounge, and we have every detail and some special offers from PSafe, their socials and their website. They have a new range on sexual health and self-pleasure with their Domina range of products, lubricants, and even period pain controllers. And we have a very exciting session coming up. Nicole Jardim joining us right from the US. And PSafe is supporting our segment. So very excited to learn from Nicole about the menstrual health and protocols to fix our period. So thanks, Ashrina. Thank you so much for your time. And I wish you all the very best with your mission with Housie Period, Safe, and PSafe.
Thank you so much, Nidhi, for having me, and wishing you all the very best too. And I hope we bring about a change together and make this a more safe environment for people to talk about menstruation. So thank you so much.
My pleasure. Thank you.
Thank you so much, Nidhi ma'am. Thank you so much, Ashrina ma'am. Now we are on the segment where we talk about the journey, about what motivated Nicole Jardim ma'am to become a women's health coach and what made her write the book Fix Your Period. So Nicole Jardim is a certified health coach, writer, speaker, mentor, and the creator of the Fix Your Period series of programs that empower women and menstruators to reclaim their hormone health using a method that combines evidence-based information with simplicity and sass. Her work has impacted the lives of tens of thousands of people around the world. And as a result, she's earned the nicknames the Period Girl and the Professional Period Fixer. Thank you so much for joining us today.
Hi, thank you so much for having me. I actually have slides, and I was wondering, is it okay for me to share my screen so that I can use those?
Absolutely. So Nicole,
yes.
I want to take an opportunity to welcome again as a founder of this community. It's truly very exciting to know about your book, about the protocols. We've seen some truly informational, content on your website and the kind of content that you're doing in the US. And if we here in India could learn something from you, and the menstruators here could gain some knowledge, that'll be super amazing. So thanks for making time. Thanks for being so humble and approachable so that we can get to you. And this segment is sponsored by PSafe. We were just learning about the beautiful initiatives that they've been doing in the menstruation world. So thank you for them so that we were able to make this possible.
Yes, absolutely. Thank you so much again for having me. I think what I'll do is then just share my screen, if that's okay with all of you, and then we can jump right in. Okay, hold on one second.
To interrupt for a second, before we jump right in, we have the Housie night coming right after this session, and I would request all of the participants to check their email for the tickets and to join us for the event, because it's going to be seriously a lot of fun. So thank you again. Sorry for interrupting you again.
No, not at all. Okay, amazing. This is so great. Okay, so can you see my screen all right? Hope so. Yeah, okay, amazing. All right, well, I just wanted to start by saying thank you all so much for having me. I'm so thrilled to be here. My presentation today is called Understanding and Tracking Your Menstrual Cycle for Healthier Periods, and I'm really excited to share all of this information with you. And everyone, thank you for being here and for being part of this, and to all the amazing organizers. This is just an incredible event. I was looking at the lineup and you have such great speakers. I'm completely blown away. I know how difficult it is to put on an event like this. So congratulations. Anyways, before I get into everything, I just wanted to share a little bit about my journey. It began a long time ago. I was a teenager. I struggled with debilitating period problems, very heavy bleeding that sometimes lasted for 10 days, sometimes longer. I had really bad period pain, major mood swings, very irregular periods that would come every 3 to 4 months. And I was never formally diagnosed with PCOS, but I had a lot of the hallmark symptoms, like I was just describing, the very irregular cycles, excess hair growth, long periods of heavy bleeding as well. And I actually was born and raised in Antigua in the West Indies. You all might know our cricket team, or that it's a nice beach vacation destination, and it certainly is. But as is the case in India, there were precious few resources for girls like me who were experiencing the health challenges that I had. And unfortunately, that is still the case. So it wasn't until my late teens that I finally went to my mom's gynecologist, and I explained all of my symptoms that I had been experiencing in great detail. And she just prescribed the birth control pill for my period problems and just sent me on my way. And things settled down for me. Within a few months, my period pain had practically vanished, and my heavy periods were now relatively light, and they came every 28 days. And I felt like I was finally having a perfect period. The only problem is it wasn't really a period, but I'll get into that. Anyway, so fast forward a few years, I started experiencing symptoms that no one could figure out. Chronic yeast infections, I had UTIs. I know we were just talking about that with PSAFE. Hair loss, I had melasma all over my face, weight gain. It was not great. I had terrible gut problems as well, joint pain, all of these weird symptoms. And I remember being in and out of the gynecologist office, just getting medication for all of these issues. And I also saw a lot of different doctors to try and figure out the joint pain and the digestive problems and the skin problems. And no one could figure out why I was such a mess. And I remember just feeling very hopeless and defeated, and I didn't know what else to do or where to turn to actually figure out what was wrong. And I then had an allergic reaction to a UTI medication. I ended up in the emergency room. And I had hives all over my body. I had a 103-degree temperature. It was a terrible situation. And I remember thinking I have to try something else because I can't possibly go on like this. And so the day after, a friend of mine recommended I go and see her acupuncturist. And I thought, okay, I'll do that. And he was the person who finally pointed out that the birth control pill might have something to do with what was going on with me. And that was when I started to make changes. And this was almost 20 years ago now. So it's been a long time. But I realized over time, changes were helping and things were starting to move in the right direction. And as a result of all of those experiences, I decided to train to be a women's health coach. And I really dedicated my life to helping women and people who menstruate, who struggle with their hormones and their menstrual cycles, try to figure out what's going on with their bodies and just help them, have better periods. And as a result of all of that, I wrote my book, which I know you mentioned, Fix Your Period. And I believe it's on Amazon in India, but I'm not entirely sure where else. So I know that there have been a number of Indian women who've said to me that they have read it and they've been really happy with it. So that makes me really happy. So anyways, that's a little bit about me. I also wanted to share another little tidbit about my family's background. When I was chatting with our wonderful hosts about this summit a few months ago, I mentioned that I'm actually of Indian descent and my ancestors were brought to Guyana after slavery ended in the Caribbean. And this is a picture of my grandparents on the right when they were young, and the middle picture is my grandfather and my mom, and the other two pictures are my parents. So as everyone can see, I look like my dad's side of the family. I often get a lot of shocked responses when people learn this about me, but the reason I bring this up is because my family and I have a huge love of India and Indian culture, and I'm just so happy to be here with all of you to share my work and how it can help you have better menstrual cycles. And we're going to talk a little bit about the genetics for South Asian people as well when it comes to PCOS, because there's some interesting research on that. So in this presentation, I'm going to just begin talking about why your period is not just your period and why it is such an important indicator of overall health. I'm also going to discuss the 4 phases of the menstrual cycle, the hormone fluctuations that happen, along with the changes. Oh, sorry. Whoopsie. Sometimes I do that, along with the changes in cervical fluid that occur throughout the cycle. And I'm going to go into the differences between PCOS and endometriosis and how to track your cycle to get acquainted with your own cycle as part of a healing journey. And then we're going to wrap up with a conversation on blood sugar and insulin and how insulin affects your menstrual cycle and your period. Okay. And of course, if everyone has questions or anything like that, I'm definitely going to get to them at the end. So no worries about that. So let's talk a little bit about your menstrual cycle and what it can tell you about your health. And so I say this often, that your period is not just your period. I know that it's potentially a nightmare for some of you, and it certainly was for me for a really long time. And I want everyone to understand that your period is not just rebelling against you. There's a reason why you might be having problems with it. And so it's important to think of it as your body's early warning system. So it's sounding the alarm if your body needs attention. And it's going to do this via various symptoms. So for instance, if you have irregular periods, so that's periods that don't arrive consistently every 25 to 35 days. If they're outside of the 35-day window or below 25 days, this could indicate that something's going on. Your body might be under too much stress psychologically, or there might be multiple nutrient deficiencies, or there is a condition like PCOS or even low ovarian reserve. And then we have painful periods, especially the ones that leave you in the fetal position on the bathroom floor or on the couch for days. So this could be a sign of a system-wide inflammation, pelvic floor dysfunction, or even a condition like endometriosis. Then there's heavy periods, and this could be linked to uterine fibroids, polyps, adenomyosis. And so this is a uterine or condition where the uterine lining tissue grows into the muscular wall of the uterus, causing it to thicken. There's also endometriosis, which I will talk about, and then even low thyroid function. So you need your thyroid to be working properly in order to have healthy periods. Heavy periods are also connected to PCOS because oftentimes people with PCOS don't ovulate and don't make enough progesterone to counteract the effects of estrogen on the uterine lining. So estrogen is like the growth hormone, and progesterone sort of thins it out. The other condition I see a lot of is missing periods. And this basically means that you are not ovulating and thus not making the sex hormones that you need each month to build up your uterine lining and subsequently shed it. So oftentimes, again, people with PCOS have periods that disappear or are very infrequent because they are not ovulating consistently. And what I want everyone to remember is that these period problems just should not be ignored or dismissed as normal at any age. And this is why, the menstrual cycle is now referred to, at least in my circles and probably in yours, as the 5th vital sign. And so we're going to get into why that is. So menstrual cycle awareness and understanding is truly, as far as I'm concerned, the bedrock for creating better health for ourselves, and becoming well-versed in this topic, I think will really serve you for all of the years of your life. And unfortunately, the menstrual cycle is often dismissed, right? We know this because culturally it certainly is. And in pretty much every culture, it looks different though, I think, for each culture, but it's dismissed and it's poorly understood. And I think it's high time that we as a society move beyond this view that menstruation is a curse, and we need to change the perspective on what is basically a very natural body process, not only for us currently, but for future generations of girls and women and gender nonconforming menstruators. So traditionally, our menstrual cycle has also been viewed as a bodily process that happens solely for reproduction. But now I really think that viewpoint is changing as more research is published to support the system-wide benefits of having consistent ovulatory cycles. So back in 2005, there's a Society for Menstrual Cycle Research. And basically, this research body it actually exists, but basically they co-sponsored a scientific forum called The Menstrual Cycle as a Vital Sign. And then 10 years later, in 2015, the American College of Obstetricians and Gynecologists released a report acknowledging that menstruation should be recognized as a vital sign in girls and adolescents. And this really applies, as you all know, to females and menstruators of all ages, since your menstrual cycle is a barometer for your overall health, no matter how old you are. And what was so interesting about this report is that they said identification of abnormal menstrual patterns in adolescents may improve early identification of potential health concerns for adulthood. So it's important for clinicians to have an understanding of the menstrual patterns of adolescent girls, the ability to differentiate between normal and abnormal menstruation, and the skill to know how to evaluate the adolescent girl patient. And by including an evaluation of the menstrual cycle as an additional vital sign, clinicians can reinforce its importance in assessing overall health status for patients and caretakers, which I really loved because it makes it very clear that our menstrual cycles are very much an important and integral part of our overall health. And there was also a study titled Ovulation, a Sign of Health. And the research in that said normal ovulatory activity during reproductive years can be considered a sign of health, because what this implies is adequate endocrine and gonadal function. So this is amazing, because what it means is that now we're finally recognizing that there's a huge importance placed on the menstrual cycle and it being healthy, and addressing any underlying health conditions that could be impacting not only the adolescent's menstrual cycle, but in adults as well, is really, really important. And regular ovulation, not just having a regular period, is very much a sign of optimal health at any stage. Also, considering that most teens and adults are just put on birth control or some other form of hormonal birth control when they present with almost every menstrual cycle related issue, you can now see how problematic that approach is when you understand the importance of the cycle to our overall health. So now I want to talk a little bit about the 4 phases of the menstrual cycle. So this is essentially what is going on with our hormones and what's going on with our bodies throughout our entire month or our monthly cycle. So our bodies are cyclical by nature. We produce varying quantities of sex hormones at different points in our monthly menstrual cycle. These are the main ones are estrogen, progesterone, and testosterone. Other hormones, such as follicle stimulating hormone or FSH, luteinizing hormone or LH, there's also anti-Müllerian hormone, prolactin, oxytocin, and cortisol, as well as a few neurotransmitters like serotonin, epinephrine, and dopamine, all fluctuate during the cycle. So we have a lot of hormonal interplay happening. And all of these hormones are directly or indirectly responsible for these 4 distinct phases of the menstrual cycle. So for women and menstruators who are getting their period roughly every 25 to 35 days, this occurs on basically a weekly basis with our cycles. But contrary to what society says, these are not bad things. Like we're not having, these are good things, our hormonal fluctuations. So we really want to make sure that that's happening with our own unique cycles. Anyone who has a longer cycle, what you should know is that the follicular phase, so that's that first half of your cycle, is going to be longer for you. And for those with shorter cycles, the follicular and or that luteal phase, which is the second half there, could be shorter. And so if you have a longer cycle, especially with PCOS, that's very common. What that means is you just aren't ovulating. And so when ovulation occurs, that luteal phase is a set time frame, and then you will know when to expect your period. But like I was saying before, really mastering these internal rhythms is the key to being more connected to our bodies, and generally the first step to solving a lot of the physical and emotional complaints that are associated with our cycles. So I think that this knowledge will really help to prepare you for your own natural ebbs and flows of hormones, and will definitely provide important clues about whether your hormones are functioning the way they're supposed to in the various phases. Okay, so the bleeding phase. So let's begin with phase 1. So this is the bleeding phase. It's known as menstruation. We all know this. So day 1 of your menstrual cycle is the first day of bleeding. On average, the bleeding phase lasts for 3 to 7 days. And then right before your period, your progesterone levels plunge, which we'll talk about in a bit. And it causes the breakdown and the shedding of the uterine lining. And as menstruation gets underway, estrogen and progesterone are at their lowest, and they're going to be, they're at their lowest that they would be in the entire cycle. And then progesterone actually does not rise until ovulation, which we'll talk about. And so our cervix, so this is the cylindrical shaped tissue that connects the vagina and the uterus. And so this cervix changes position throughout the cycle. And in the first phase, it's firm. It's kind of it feels like the tip of your nose, and it's in a lower position. It's just slightly open to allow menstrual blood to pass through. Okay, so this is now the non-menstruation half of the follicular phase. I kind of divide the two up because that seems to make the most sense. And so this is the time in the menstrual cycle when the ovaries are preparing for ovulation. And one thing I want everyone to understand is that it's the length of the follicular phase that varies, like I was saying before, and this is going to determine how long an actual menstrual cycle is. And then once you ovulate, you're going to have a pretty good idea of when your period is coming, which I'll talk about. And so around halfway through this follicular phase, so somewhere between like day 7 to 10, one follicle from the group of follicles in the ovary starts to dominate. And this is because anti-Müllerian hormone is inhibiting the other follicles. So one leads the pack. And so AMH is often talked about in reference to fertility and ovarian reserve and PCOS because it is a marker for the number of preantral follicles, which are essentially the pool of follicles available for reproduction in the ovary. So in cases of PCOS, it can sometimes be high. And this has to do with the higher number of preantral and antral follicles on the ovary producing higher amounts of AMH. Oh, sorry, ladies. Okay. So one more note about AMH. I feel like this hormone is talked about as a be-all, end-all of fertility. And, this I think really needs to change because dietary changes, lifestyle, supplementation can absolutely raise or lower AMH depending on, what your current situation is. So it really shouldn't be the final determining factor on whether someone can get pregnant or not, because one hormone can never determine the overall health outcomes of a person. As you know, all of these hormones work in conjunction with each other. So this growing follicle is producing more and more estrogen, and that is going to send a signal back to the brain to let the brain know that everything is going well with the ovaries, and then the brain will then continue to send different hormones. So that's kind of what's happening here. The other thing I wanted to talk about as part of these 4 phases is what is happening with our cervical fluid during all of this. So I don't know about all of you, but when I was younger, I did not know anything about this stuff. And I remember thinking I had some sort of infection every month because I had no clue. I didn't know that this cervical fluid changes so much. And when you're really young, it changes quite dramatically and you might see a lot of it. So what you might notice after your period is a little to no cervical fluid or a dry vaginal sensation. In other words, when you touch your vulva or you wipe, it's only feeling slightly moist or it might even feel dry. However, as estrogen is building during that follicular phase, it stimulates your cervical crypts. And so these are where the cervical fluid comes from. And you start to see more of the cervical fluid, and it begins to take on a wetter consistency, as you can see in the image here. So it will look pasty or creamy or kind of like lotion initially. And then as you start to approach ovulation, it's going to change and become even more wet. So you'll start to notice this slippery sensation when you wipe, and you're most fertile in the second half of the follicular phase leading up to ovulation. So if you are not trying to get pregnant, you would use a barrier method of birth control. If you are trying to get pregnant, this would be the time to be having sex in order to get pregnant. So this should be the time. Also, this is the time where, as ovulation approaches and then happens, you'll then start to notice that the cervical fluid starts to dry up a little bit. And then as progesterone is produced after ovulation happens, your cervical fluid will become more sticky or tacky. It actually even blocks sperm because you are no longer considered fertile after ovulation is complete. So with that said, now we move into this ovulatory phase. And I often say this: ovulation, not menstruation, is the star of the menstrual cycle show, because the ovulatory phase packs the biggest hormonal punch, and it's the driver of all the hormone production throughout the cycle. If we don't ovulate, our hormones are pretty flatlined, and you would see that if you tested and you were not ovulating. You would see that you have very little estrogen and very little progesterone. And so, like I said, ovulation is really the culmination of all the hard work that your body has been doing throughout the follicular phase. So I mentioned this before, your estrogen levels are rising in parallel to the size of that maturing dominant follicle and the number of granulosa cells. So those are the cells in your ovary. And so this dramatic rise in estradiol, which you can see here, it goes up pretty significantly. It tells the brain to trigger this LH surge from the pituitary gland. And so that is what is needed to initiate ovulation. And so the start of the LH surge is a good predictor for when ovulation will take place, but it doesn't mean that ovulation will actually happen. So there are times when LH rises but never reaches its peak. So ovulation doesn't occur, and then the body will likely just try again to ovulate. This is what our bodies do, always trying to ovulate. And so this is why those ovulation test kits or the ovulation predictor kits that test levels of LH aren't the greatest predictors of ovulation, because they cannot tell you if ovulation has actually occurred. They're only measuring levels of LH in the urine. So then 10 to 12 hours after that LH peaks, ovulation occurs. It's a really short period of time. So it's anywhere from 24 to 48 hours, this whole ovulatory process. And all of these hormones come together. And then what happens is the egg bursts out of the follicle on the ovarian surface and into the peritoneal cavity, where it's ushered into the fallopian tube and it's pushed along toward the uterus. Before I move on, though, I wanted to say something about this, about LH and people with PCOS. So sometimes LH is elevated, which makes it difficult for the body to reach that high LH threshold that triggers ovulation. And I'm often asked, well, how do I lower LH? Well, it's a great question, but it's important to know that hormones all work together. So you have to look at the overall picture. And I know there are a number of amazing speakers on the summit talking about dietary changes and lifestyle and supplementation for all of these concerns. So I think everyone should really tune into those. And I'll talk a little bit about that later as well. Okay, I just want to come back to this fertile quality cervical fluid so that everyone can see what it might look like. So at this point in our cycle, our cervix becomes soft. It actually moves up higher in the vaginal canal and opens up. And this positioning helps your released egg get the best, strongest, healthiest sperm, because these sperm that have to swim farther to get to the cervix, where they kind of take a pit stop and then they move on to reach that released egg. So in preparation for the sperm, your cervical fluid transforms into this fertile quality cervical fluid, and it becomes clear, like translucent or viscous, if you think of raw egg white, which I know is how it's often described, and it's elastic, so it will stretch between your fingers, which is what you can see here. It's very wet, watery, you can see that too. And if you looked at it under a microscope, you would see that it contains channels, and that's actually what helps the sperm swim up through the cervix. It's kind of incredible. It also nourishes the sperm. It protects them from the vagina's natural acidity because they're more alkaline, and it guides them toward the egg. And something I wrote about in my book was that ovulation occurs randomly from either ovary on any given cycle, but some studies have indicated that ovulation actually occurs more frequently on the right side. And on the right side, it has a higher potential for pregnancy, which is, I think, such a neat little fact. Okay, so let's move into the luteal phase. So this is typically about 11 to 17 days, but is about 12 to 14 days in most menstruators. And when the luteal phase fits into this range, it's considered to be a fertile cycle. The luteal phase is dominated by the hormone progesterone, which is a heat-inducing hormone. So it's going to raise your basal body temperature. And I'm going to talk about that with cycle tracking. So where does the progesterone come from? Amazingly, progesterone starts being secreted by the granulosa cells on the ovary just before ovulation. And then an egg is released. The follicle that it came from turns into the corpus luteum. And you can see that on the screen. It's also known as the yellow body. Makes sense. It's very yellow. And it's yellow, or it's called this, the yellow body, because it's colored by the carotenoid pigment known as lutein. So it gives it that yellow color. And you can see it's really big. It's actually somewhere between 2 and 5 centimeters. And it's this transient endocrine gland. It only lasts for a short period of time. It starts producing this progesterone. And, every month our bodies are making this, or every cycle at least, our bodies make this endocrine gland. And I always recommend people take out a tape measure to measure that, because 2 to 5 centimeters is pretty huge. Anyway, in addition to progesterone, the corpus luteum also produces estradiol, but progesterone is the main hormone because it transforms the endometrium, or your uterine lining, into a place that will welcome a fertilized egg. And then once the corpus luteum gets going, the progesterone just keeps on going, and the levels rise significantly in comparison to the levels in the early follicular phase. And I want to reiterate how important progesterone is. It's not just for reproduction. It's responsible for many aspects of our health, particularly our brain and cognitive function. Really helps with sleep and mood issues. It helps with heart and breast health. It's also really important for bone health too. So that is a little bit of a summary on progesterone. I'll talk a bit more about it in a second, but this is the 4 phases of the cycle, and how all these hormones fluctuate. And now I want to chat a little bit about PCOS versus endometriosis, because this is something that comes up often. I'm asked often the difference between these two conditions. Endometriosis is another very prevalent health-related condition. It affects supposedly about 10% or 1 in 10 menstruators throughout the world, but I have a feeling it's probably higher, very similar to PCOS. There's a lot of underdiagnosis. And so for PCOS, as we all probably know already, this is a complex inflammatory endocrine disorder, and it's mostly characterized by high androgens, the testosterone, androstenedione, DHEA, and DHT. And it's also characterized by elevated LH, not always, but often. So both of these combined prevent those ovarian follicles from reaching the ovulation stage. And of course, this delays or even prevents ovulation, which of course then causes these irregular or non-existent periods, or you might bleed constantly, just depending on your body and your makeup. And this ongoing bleeding is due to the lack of progesterone, because progesterone holds your uterine lining in place. And so as you can see on the screen, there are a lot of symptoms associated with it. These are just a few, but particularly insulin resistance is quite prevalent, the elevated androgens. Some people might experience mid-cycle or ovulatory pain. There is weight gain, acne, oily skin, hair growth on parts of the body, baldness on top of the head. It's very unfair. And then, of course, the period-related problems. Before I get into endometriosis, though, I did want to share something that I discussed with our organizers before the summit about whether South Asians have a higher prevalence of PCOS or if they are affected differently. And there are multiple studies that suggest both of these things. One study says, despite a genetic component to PCOS, ethnicity plays an important role in the phenotypic expression of PCOS, with South Asian PCOS women having more severe reproductive and metabolic symptoms than other ethnic groups. So South Asians with PCOS seek medical care at an earlier age for reproductive abnormalities, have a higher degree of hirsutism, infertility, and acne, and experience lower live birth rates following in vitro fertilization than do whites with PCOS. Similarly, South Asians with PCOS have a higher prevalence of insulin resistance and metabolic syndrome than do other PCOS-related ethnic groups of a similar body mass index. So inheritance of PCOS appears to have a complex genetic basis, including genetic differences based on ethnicity, which interact with lifestyle and other environmental factors to affect PCOS expression. So this is why events like this and the amazing speakers sharing all of this knowledge are so incredibly important for us to understand that, there might be, more issues with South Asians when it comes to PCOS, and we need to be informed and aware and know that there are solutions to starting to feel better and addressing our symptoms. So now there's endometriosis. Endometriosis is similar to PCOS. It's a complex inflammatory disease. However, this disease occurs when tissue that is similar to the kind that lines our uterus grows outside the uterus. It's not the same, but it is similar. And the presence of this tissue triggers an inflammatory response, and it produces this ongoing inflammation. And then there are adhesions and scar tissue that build up around the endometrial lesions. It's a really challenging condition, as is the case with PCOS too. And so some of the common symptoms associated with endo are severe pelvic pain. You might feel pain leading up to your period and then during your period that really disrupts your life and impacts your ability to even work or go to school or things like that. And it's important to know that endometriosis can be diagnosed in younger people. So keep in mind, it doesn't necessarily just show up later in life. We're seeing 10, 11, 12-year-olds who are being diagnosed with endometriosis. There's ongoing fatigue, fertility problems, a lot of bloating and digestive issues. Oftentimes, endometriosis is mistaken for IBS or other digestive problems. So that's something to consider too. Painful sex, depression, bowel movement, pain with urination, heavy bleeding. These are all signs. So this is not just like a few cramps or, a slightly problematic period. This is absolutely a condition that needs to be addressed because it's not a problem with the uterus. It's a problem with the full body. And it just shows up as problems with the menstrual cycle, but endometriosis lesions can be found throughout the body. It's not just in the pelvic cavity. So that's something to consider too. And unfortunately, it is possible to have both PCOS and endo. The research isn't really very great on that. Like, you don't really see a high prevalence, but I have a feeling it's higher than what we see in the research. And I often hear from women online that one of their main PCOS symptoms is period pain. And I'm like, no. One of the things we need to know is that PCOS doesn't really cause period pain. I mean, yes, if you are very inflamed, then you might experience some period pain, but it really shouldn't be one of the most prevalent symptoms that you're experiencing. So if you have PCOS and you're experiencing period pain that is disrupting your life, then it is definitely worth investigating. And it could be a sign of just chronic inflammation, or it could even be endometriosis. And I know getting an endometriosis diagnosis is extremely challenging. This is why a lot of the lifestyle components that are talked about throughout this summit are going to be really necessary for everyone to start to implement as best they can. Okay, birth control pill. I just want to talk about this real quick because I feel like, unfortunately, it's the go-to treatment for conditions like PCOS and endometriosis. And in my experience, many people are put on the pill or some other form of hormonal birth control somewhere between the ages of 10, which is really ridiculous, and 18. I learned about an 8-year-old who was put on the pill recently for menstrual migraines, which is unfathomable because what is happening here is that we are being prescribed the birth control pill and then we're staying on it, almost exclusively, aside from, using it for, or coming off of it for pregnancy, but we're staying on it all the way through perimenopause and menopause. This is what I'm hearing more and more. Or it's being prescribed again in perimenopause when we're done having babies, and then you're just instructed to stay on it for as long as you need to. But this is not great for as far as I'm concerned. And hormonal birth control, the reason I say this is because hormonal birth control doesn't fix any of the problems that it is being prescribed for. We don't have these problems because we're lacking in synthetic hormones. Hormonal birth control is just shutting down ovulation, which is required for overall health and well-being. And it's replacing these real hormones with synthetic hormones that have a range of side effects. And this is, with PCOS, where ovulation is already sporadic, it's not going to solve the problems that we're experiencing. We really need to take a more whole body approach, which, I'm going to talk about. I think at the same time, we all need to do what is right for us individually. This is not an anti-pill sentiment by any means. It's just bringing awareness to the fact that there are other options. And, sometimes the pill is helpful for post-endometriosis surgery or as a stopgap for extremely disruptive period problems, when you're working on diet and lifestyle factors. So obviously consult with your doctor, or even find a doctor who has a more of an alternative mindset and can help work on addressing whatever symptoms or problems you're experiencing. Okay, let's move on to using your cycle as a gauge for your overall health, because our cycles can tell us a whole lot about our bodies, and it's really great to know what your baseline is so that you can then make changes to improve your cycle. So as far as I'm concerned, cycle tracking is a first step in getting acquainted with your menstrual cycle and attaining period literacy. And we want to quantify things like how many days you bleed, how much blood loss you're experiencing, and your period-related symptoms that you are experiencing as well, so that you can know how they correlate with your cycle. All right, so step one involves tracking your basal body temperature, and this is how you start to become period literate and end the cycle of confusion around what's normal and what's not. And so before we get into this, I want to say that many people ask me about hormone testing, and that's another way as well to figure out what's going on with your health. But sometimes we don't get the right testing, or we don't have access to testing at all. And so this is a great way to be able to determine what might be happening with you on a unique level. If testing isn't available, or you just didn't get the right testing, or the testing was done at the wrong time in your cycle. So for instance, you need to test progesterone about 5 to 7 days after you have ovulated to determine whether you have a high enough level of progesterone or whether it's low. So a lot of the time, someone will come to me and they'll say, oh, I tested my progesterone, but it was done on day 7 of my cycle. And I'm like, well, that's not going to tell you very much, because your progesterone needs to be tested after ovulation, because that's when you make your most progesterone. So there's so much we can do on our own, like I said, outside of this. And this is why I'm such a big fan of tracking our cycles and taking our basal body temperature first thing upon awakening. So as you can see on the screen, you want to purchase a basal thermometer. And this is a thermometer that's just a little bit more accurate. It measures temperatures in 1/100th of a degree versus a regular thermometer, which is in 10ths of a degree. So in other words, what you'll see is a temperature reads 36.11 versus a regular thermometer, which would just say 36.1. However, if you don't have one of those, it's not a big deal. Don't worry about it. You can use a regular one as well. So just keep it by your bedside. Set an alarm on your phone, and and use that to take your temperature each morning as you wake up. And so when you take your temperature first thing upon awakening, at least 3 hours after 3 hours of consecutive sleep, you will start to see a pattern show up. And so you really want to do this after you've had a decent amount of sleep. You don't want to go to the bathroom or brush your teeth or do anything before, just do it first thing. And it's important to know that your temperature actually rises about 0.2 of a degree per hour. So try to get it at around the same time each day. And then record your temperature in an app. I know there's tons of apps out there. I use an app called Kindara. It's Kindar. Clue is another really popular one. I'm sure there's tons more. Anyway, so that's what I use. And you want to just use an app that has a temperature tracking option. And then note events, things like air travel, although no one seems to be doing that anymore, alcohol consumption, any kind of excess stress that you're going through, if you take a temperature later or earlier, and because all of these factors are going to potentially change your temperature. So it's good to check that. And then do your best to take your temperature every day. If you take it later or earlier, don't worry about it. The goal here is just to see an overall pattern, which I will show you in just a minute. I just want to come back to cervical fluid again, because I really want everyone to track their cervical fluid changes as well. I described this earlier. But the goal here is to just check your underwear when you go to the bathroom each day to see what the consistency is, see how much you have, and you can make a note of that in an app as well. Sometimes some people have to do an internal check using a finger because we all have varying amounts of fluid. So it just depends. If you've been on the birth control pill or you're having something else going on, it might be a little bit less. Depending on what's happening with your health. But generally speaking, cervical fluid follows this a dry, wet, dry pattern throughout your cycle. But as I said before, there are a lot of influences that will affect this. So this is why it's really important to track the changes that you see in it. And again, you mark this in your app and you start to determine what your norm is. And so the end result of taking your temperature each day is a chart. You'll see your temperature show up on a chart. And the goal here is before ovulation, during your follicular phase, your waking temperatures will be on the lower side. I can't remember what type of temperature measurement you all use, Fahrenheit or Celsius. But anyway, I use both. So yeah. 36 point Celsius, right? Yeah, okay. Okay, so anyways, I'll just say both. So 36.11 or to 36.5 degrees Celsius is what you're looking for, or 97 to 97.7 degrees Fahrenheit. And then a day after ovulation or 2 days after ovulation, your temperature rises because of that progesterone. And so it typically would rise at least 0.2 of a degree and stay elevated until right before your next period, which is really cool to see. And so these post-ovulatory temperatures usually rise to 36.55 degrees Celsius or 97.8 degrees Fahrenheit or higher. And this is caused by the production of progesterone, which is a thermogenic or heat-inducing hormone. And this first chart is a biphasic chart. And you can see here clearly the temperature has gone up. The second one is this monophasic chart, which is there's no discernible thermal shift. And a lot of the time people with PCOS will see a chart that looks like this. And I know it can be frustrating, but you're here now and you're in the right place. And we want to get you to the point where you're ovulating more consistently. Okay, so then the next thing here, we have a couple of other charts that I wanted to share really quickly, because you can see that there are multiple ways that your basal temperature can tell you other things as well. It can tell you about progesterone levels, it can tell you about low thyroid function possibly, as well as pregnancy and even a cortisol imbalance. And cortisol is that main stress hormone, and it shows up in your temperatures too. So as you can see here, low thyroid function tends to keep our pre-ovulatory temperatures and our post-ovulatory temperatures on the lower side, typically below 36.11 degrees Celsius or 97 Fahrenheit. And so this is certainly one way a person can start to assess whether they may be experiencing a thyroid problem. Then they go to their doctor and ask for a full thyroid panel to test their thyroids to see what's going on. Same with progesterone. It's usually indicated by these lower post-ovulatory temperatures. So typically you don't really see a rise above 36.66 or 98 degrees Fahrenheit. So that's something to pay attention to. If you're pregnant, you will observe 18 or more days of high temperatures. So you will likely know before a pregnancy test that you are pregnant. And then the HPA axis or adrenal dysfunction can be seen with this sawtooth or zigzag erratic pattern that that may indicate you just need to focus on supporting your body's stress response. And I know that life is extremely stressful for a lot of us right now. So if you notice that, it's something to pay attention to. Also, long cycles, again, this would be something you might see with PCOS. You'll see when you ovulate, and ideally what you would like to see is a luteal phase somewhere between 10 and 16 days. And if it's less than 10 days, oftentimes that means that low progesterone is happening again. And this low progesterone doesn't allow the temperatures to rise high enough. And then when it drops prematurely, it causes your period to arrive. And so this, of course, can have an impact on fertility because that fertilized egg needs about 10 days to travel to the uterus and implant. So if the uterine lining is disintegrating before the egg implants, pregnancy cannot happen. So this is essentially what's going on here. And you can kind of see that it can put you in control because knowledge about your body gives you power you didn't have before. And it's something you can easily start doing to start to feel like you understand what's going on with your body and have clarity around that. Okay, I want to move on to interventions because there are a lot of things, right? We hear all the time about our menstrual cycle and fertility problems are caused by a hormonal imbalance or multiple hormonal imbalances or hormone disruption. And it's what I think is most important to know is that hormone imbalances are the trigger for a lot of the symptoms we experience, but the cause of the hormonal imbalances is really what we need to focus on. And we have a lot of causes here, right? So we have a lack of adequate nutrition because we need specific nutrients to be able to ovulate and produce these sex hormones in the right amounts. And a lot of these nutrients include things like iron and iodine and magnesium and zinc and selenium, as well as the B vitamins and vitamins A, C, D, and E, just to name a few of the important ones. And then, of course, there's psychological stress, and our body's stress response will always take precedence over our menstrual cycle and fertility because we are wired for survival, and no body is trying to get pregnant or have a baby when it perceives constant stress or danger. So what happens is stress will literally stop ovulation in its tracks, starting in the brain. It kind of hijacks the brain. So this is why we really need to look at the stress in our lives and start to help mitigate the effects of it. Blood sugar imbalances are another issue as well, which I'm actually going to talk about in more detail over the next few slides. That's the one I wanted to focus on most, since it's the one that I think that affects PCOS the most. So blood sugar is regulated by insulin, and it's a powerful hormone, and it can disrupt our sex hormones, which I will go into. Gut conditions and autoimmunity and viruses, as well as pathogens, also play a role in hormone disruption. Again, like I think we need to get our nutrition under control as a first step. And then that might be a second stage if that's something that might be going on for us. There's testing that's involved with that kind of thing though. Exercise, too much or too little can be problematic. Too much will put the body into survival mode, and too little can reduce insulin sensitivity. And then we end up in a situation where we have more insulin problems because of that. Environmental toxins, they tend to have this estrogenic effect on the body, and they will throw off the balance of estrogen and progesterone. So those really need to be limited. And then alcohol, I think alcohol is challenging for some people. Others can take it or leave it, but it really does put a huge burden on your liver detoxification pathways, and it can set us up for estrogen dominance. Unfortunately, caffeine can also be a problem. It can raise blood sugar and cortisol. And I just described what that does. And so I think the big takeaway here is that your menstrual cycle is a reflection of your overall health and a window into what is going on in your body and your external environment. And often it signifies one of these issues or maybe multiple issues happening at the same time. And, I can't go into all of it right now because we don't have a lot of time, but I wrote a lot about this in the book, and I recommend getting that if you want to delve more into the causes and some solutions. Okay, so insulin in your period. I don't want to run out of time, but I know that basically insulin and blood sugar are so challenging, I think, for so many of us in the modern world, and especially if we have PCOS. So just so everyone knows, insulin is released by the pancreas in response to food or blood sugar that's coming into your bloodstream from your digestive tract. And its purpose is to take sugar from your blood and move it to your cells so it can be used for energy. And high insulin has the potential to alter the precise balance of FSH and LH. And so if we have a lot of we're eating a lot of sugar or a lot of refined carbohydrates, and we're not eating enough protein and fat to balance those out, we end up with this high insulin in our bodies. And so too much insulin is basically causing that pituitary gland to release more LH in proportion to FSH. And when we don't have enough FSH, that means the follicles can't mature adequately, because that's what FSH does. And then we never have this dominant follicle, and then we don't ovulate, and then fertility problems arise and other issues as well. So what's happening is we have these immature follicles, all of these cysts on our ovaries, hence the reason we call it polycystic ovary syndrome. And so then a lot of other issues can arise from this too. So a lot of people with PCOS have insulin resistance. This can cause high levels of insulin to be circulating in the blood. And this higher LH that's made causes the ovaries to produce more androgens, such as testosterone. And when ovaries produce more excess testosterone, the entire feedback loop between your brain and ovaries gets interrupted, and then your eggs are not able to grow adequately. And then we have this sporadic ovulation like I was describing. It also can cause an estrogen dominant situation as well, because sometimes what can happen is aromatase, which is responsible for converting testosterone into estradiol, is increased by insulin. And so then we run into potentially a situation where there's excess estrogen too. And so this is why the consumption of refined carbohydrates and sugar is directly connected to these hormonal imbalances I've been talking about, the progesterone deficiency and the estrogen dominance and high testosterone. And of course, all of these hormonal imbalances are connected to a lot of different conditions and symptoms. So this rising and lowering of blood sugar really messes up our hormones and our cycles, as well as our overall health. And this is why getting our blood sugar under control is one of the first steps that we can take to start to feel better with PCOS, in addition to lifestyle changes and dietary changes and whatnot. I also wanted to talk really briefly about blood sugar and PMS symptoms and hormonal cravings and all of that. And so if you feel very frustrated with your mood changes throughout your cycle, or you feel like you have major cravings for certain foods at certain times in your cycle, this is not surprising, because our hormones are playing a role in that. So if you have certain cravings for salt or sugar, or your mood really crashes in the lead up to your period, then there are a few things that might be going on. So first of all, higher estrogen in that follicular phase of your cycle, when it's rising, it actually is associated with increased insulin sensitivity. So this means that insulin works better, or you need less of it to control your blood sugar. So your mood feels better during that time. Higher progesterone in the second half of your cycle kind of negatively affects that. So what will happen is you are just more prone to blood sugar swings and sensitive to these drops in blood sugar in the second half of your cycle. And then of course the brain issues come up and the mood things happen, and you have these huge cravings for sugar and other things. And the other thing to remember too is estrogen drops after ovulation, and it takes mood related neurotransmitters with it, serotonin and dopamine. And this is because estrogen works in tandem with these neurotransmitters. And then if you are in a low progesterone state already, then progesterone doesn't quite catch up, and then you just don't feel great in that second half of your cycle. And so this can cause you to just feel like you're not sleeping properly, you're having cravings, you feel depressed or you feel anxious, and you want to eat something that's going to bring it back up, and usually it's sugar or something like that. So that's why this might be happening for you, and it's something that I think we should all be paying attention to when we're tracking our cycles. And so what I talk about in the book, and I've worked on this with clients for years and years, is testing your own blood sugar. I feel like it can really help you see how food and beverages that you consume are affecting you in this way. And like I said, I talk about it in my programs in my book, but I feel like one of the ways to do this is to just buy a glucose testing kit. You can find those on in drugstores as well as online. I imagine you can in India too. And, basically what it is you're using a glucometer to get accurate readings on what your blood sugar numbers mean. And so blood sugar usually peaks somewhere between 30 minutes and an hour after your meal. So in order to see how your meals are affecting you, you should test your blood sugar before you eat. So this is fasting blood sugar. And then 30 to 45 minutes after you've eaten, possibly an hour after you've eaten too. I do 15-minute increments, and that's helpful. I know it's not fun to prick your finger, but it's really useful. And so, as I said, you just buy a blood sugar testing kit. It's going to include the glucometer, the testing strips, and the needles, and they should be relatively available for all of you where you are. Anyway, this is what you're looking for. So fasting blood glucose should be somewhere between 70 and 90. I actually should have changed that on the slide. I just realized that. 70 and 90. I feel like it's good to have a little bit of a bigger window, because 85 is not always easy for everyone to attain. And so that's the numbers in the US. It's 3.9 to 4.7 millimoles per liter. I think that's what you guys use in India. Anyway, so if your fasting glucose is consistently above 5.5 to 7 millimoles, you might be pre-diabetic. And in this case, you want to make an appointment with your doctor and start to figure out a solution for that. And then post-meal blood sugar, you really don't want it to go more than 25 points or over 110. And for instance, if your fasting glucose was 85, you would want it to be higher than 110 after a meal. If your blood glucose levels go up more than 20 to 25 points after you're eating, then it's time to figure out what you ate that might be causing that problem. And so that's 7.2 millimoles per liter. So that's 130. So 7.2, you don't really want it to go above that when you eat. And then your blood sugar levels really should go back down about 1 to 2 hours after you've eaten. And, what I just shared, you basically know that blood sugar and insulin problems really can be a big part of the hormone issues that are associated with PCOS. So I feel like this is one of the things that I really recommend everyone start to think about. In my book, I talked a lot about what disbalance or dysregulated blood sugar looks like in mood and physical symptoms. So you can even just start there. Not everyone has to go pricking their finger. I know it's kind of a lot to ask of people, but it is something that I think can be really helpful if it's something that you've been struggling with. Anyway, yeah, I think that this involves obviously not only looking at your blood sugar, but looking at what you're eating to see why it's impacting your blood sugar levels and then possibly your insulin as well. And I also talk in the book as well about different types of testing that you could go to your doctor with and ask for with regard to having blood sugar tested with your doctor, having insulin levels tested too, to see whether there's insulin resistance in play already. So all of that's outlined there. I don't want to take up too much more time. So I wanted to just wrap all of this up and just to say to everybody, no matter what you were taught, I just want you to know that suffering related to your menstrual cycle is not considered normal. And I know that statistically it is normal. There are a lot of people suffering with period pain on a regular basis and a lot of other symptoms too, but it's really not the way that your body was designed to work. And it really is not the way that it has to be. We're not supposed to be doubled over in pain every month or, going through huge amounts of period protection just to sleep through the night or get out the door for work. We also shouldn't be wondering when our period is coming, just living in this perpetual state of fear about whether we'll be able to get pregnant or not. And so ultimately what I want everyone to know is that our bodies are incredible, and we need to start to shift this belief that that all of these negative experiences that we have with our cycles is normal, and start to aim for periods that are healthier and don't disrupt our lives on a regular basis. So thank you all so much. I think I'm done here and I'll let you take it over, Nidhi.
Yes. Thank you so much, Nicole, for this so elaborate and comprehensive presentation. Honestly, I did not expect you to go through into tiny details, which is really helpful. And in fact, this is one of the most comprehensive sessions we've had today. So thank you so much.
Amazing. Oh, thank you.
Thank you so
I aim to please.
Get into details about the cervical mucus, relationship of the difference between PCOS and endometriosis. It certainly was very helpful just understanding your cycle, because I think most of us take a lot of years into our life to fully understand our bodies. And what you've done is, with your book that you've written and what you just presented, was phenomenal. And I encourage everybody to get hold of this book. You can definitely find it on Amazon easily in India. So do purchase the book. I do have a few questions, Nicole. I don't know if you have enough time.
I do.
Okay, great.
Yeah.
Fantastic. So
it's only 10 in the morning here for me, so I know that it's late for all of you, but I'm happy to hang out.
People are excited for our upcoming game of the bingo night that we have. So I'm sure they're excited for that, but a lot of questions regarding our presentation, so I'll get on with it. First is, I have PCOS and done follicular study, but no ovulation. What changes to be done to naturally ovulate? This is one from our attendees.
Yeah, and I think that this is such a great question. And I feel like this is based on what I saw with all the presentations that are coming up. I think that this will be discussed. One of the most important things, as I described in the presentation, is really working on your blood sugar. And bringing more nutrients into your diet. And of course, I don't know this person's particular history or what their current diet or lifestyle looks like. But that's really where I start with everybody. And we talk about, having what I'm trying to say here, a balance of protein and healthy fats and carbohydrates, mostly in the form of vegetables, so that you can start there. And if you have PCOS, that blood sugar component, I think, is really huge because of how many people have blood sugar and insulin dysregulation. So I would start there. I would start with the cycle tracking so you know what's going on with your cycle, and then focus on that. And then there's supplements as well. There's supplements that support blood sugar. I think there's a presentation on inositol. I highly recommend that. I'm a big fan of the D-Chiro and myo-inositol combination. In the US, we use a product called Ovasitol. I don't know what's available to all of you, but that combination I've seen remarkable results with it. That, as well as magnesium, is a big one. Vitamin D is so huge. And let me think about that. And even zinc as well. So that's another one too that I recommend. So I would start with food as the foundation. If you're really stressed out in your life, you've got to figure out some way to help to mitigate that, because the stress is hijacking our brains and our brains are too scared to tell our ovaries to ovulate. So it's something that, it was a protective mechanism in the past. It's not so great for us now. So I would start with those basics.
Great. What does ovulatory pain tell us about what's going on in our bodies? Does it have to feel close to our ovaries, or it could be felt in our uterus?
That's a good question. It usually would be the ovary. So it's like the lower pelvic area is where you might feel it. You might feel like a sharp, crampy feeling, or you might just feel this dull ache. So yes, possibly you might feel it, throughout that area. And so honestly, what I find it's telling us most of the time is that there's underlying inflammation. And, one of the things when I'm talking to my clients and anyone really online who listen to me, is that we have to figure out what's happening with our bodies in terms of inflammation. So if we are chronically inflamed, and this is again caused by all the things I just talked about, one of them being in particular, if everyone can take this away, thinking about how to start removing these very processed omega-6 rich oils from our diet. So this is the canola and the corn oil and the sunflower oil. I'm not sure what all of you cook with, but I've really had to take all of that out of my diet because they cause a ridiculous amount of inflammation. When we have too high omega-6 in relation to omega-3, which is anti-inflammatory, we tend to run into problems. And so I see that show up as ovulatory pain or period pain or joint pain or migraines or, fertility problems. It shows up in a lot of ways, just depends on our genetics. But I would say, yes, it's a sign usually of inflammation. It could be a sign, it's a sign of PCOS because we have these little follicles and it's almost like a shell outside of our follicle. Like the egg can't get through. It's having a hard time. And it's because of this, the follicle just doesn't get built up properly. So that's usually a sign of PCOS or a symptom of PCOS. So that's kind of it in a nutshell.
Great. Is irregular periods a symptom of endometriosis? Can PCOS cause endometriosis?
Usually, no, irregular periods are not a sign of endometriosis. Usually it's a sign of PCOS. And PCOS cannot cause endometriosis, but like I was saying on the presentation, the research does show that the two conditions show up together, not super often, but often enough that it's important to pay attention to. If you have PCOS and you have extremely painful periods, or you're struggling with having painful sex or bowel issues, those are signs of endometriosis for sure. Not always, but signs. So no, they don't cause each other, but they are, I feel like they have similar root causes, you know, this like overall inflammatory conditions that are driven by so much of what's happening in our, you know, our diet and lifestyle. Not that we're causing them, but they are, because there are genetic components, of course, but they are, a lot of them are driven by what's happening with our lifestyles.
Great. What constitutes as too much of exercise? I think this is in reference to your picture where you showed.
Oh, yeah, I know. Okay, so my question for everyone who wants to know about this is, how does exercise make you feel? Do you feel energetic? Do you feel good after you work out? Or do you feel completely exhausted? Or do you have a hard time motivating to work out? Or when you're working out, you feel exhausted doing it and you just feel like you can't actually do it? Those are signs that you are probably exhausted. You might be working out too much. Another sign too for me is if exercise is the only thing that makes you feel good, and you have to do it, otherwise you're not going to feel good. So those are signs to me that something is not quite right. And really, I think what it comes to with exercise is we have to be fueling our bodies correctly with the right amount of protein, particularly in order to be able to, build muscle and to be able to withstand the exercise that we're doing. So I always recommend thinking about shifting your exercise according to how you actually feel. We don't need to be doing, well, in the US, you know, we love these spin classes and things like this. So this is what we do, like 5 days a week. And I'm like, women, you're crazy. You can't do that. So think about, slowing it down as you're leading up to your period and really addressing or including your menstrual cycle in your exercise routine. And I talk about that in the book too, if that's helpful for anybody.
Absolutely. And we've talked about this in a couple of our PCOS healing programs that we do also run, that exercising as per your menstrual cycle is also very helpful. You might not do training right before when you're at the period, and your estrogen rise and progesterone coming in, and all of these changes can affect how you feel. So that is definitely very helpful. And if you're covering that in the book, I would definitely, everybody should go and get hands-on to your book and read about it.
Thanks. And your programs too, for sure. We can't learn enough about this stuff, I think.
And with that, there is there's some love coming your way. One of the attendees said that her doctor just told to Google PCOS instead of explaining the things in detail. And she's so glad she could join your session today.
Oh, that makes me so happy. Thank you so much for saying that. I know it's really challenging to be navigating these conditions in the world of modern medicine. And I know it has its place and all that, but it really leaves a lot of people feeling like they're lacking in information that is useful. So thank you.
Thank you. I have 2 more questions for you, but before I would like to tell everybody who's watching that in 10 minutes, we will be starting our Housie night. So we are going to go in the game in 10 minutes, and in the WhatsApp group, if you've not joined it already, the details are all sent to you over the email. The tickets are already sent to you over the email. If you have any questions, please go to the help desk and ask your questions, because at 8 o'clock, we'll start the game. So stay tuned. And back to the session here with Nicole. Nicole, another question is from the audience. My fasting blood sugar and the PP are almost same. Checked multiple times in a month. What does it mean?
I'm not sure. I feel like that's a tough question to answer just because I don't know what's going on with this person's particular situation. So, yeah, it's a tough one. It would really be a situation where I'd have to do a consultation with someone to find out what's going on. Sorry about that. I feel like I wish I could answer that.
Yeah, you need more information, definitely.
Yeah.
It's a very interesting question, and I'm really glad this came up. My blood glucose levels are normal, but is that different from insulin resistance? Is there a different test for it?
Yes, there is. You really would want to go to your doctor and test fasting insulin, your fasting glucose and your fasting insulin to see what's going on with your insulin, because blood sugar is only one piece of the puzzle. And so it's helpful, I think, for someone who's trying to figure out what foods are impacting them, but it's not going to tell you whether you're insulin resistant or not. So you'd really want to do the fasting insulin as well, or even like a glucose tolerance test. I talked about that in the book. I think I talk about it on my blog as well. So if everyone wants to just look there, but yeah, and on Instagram, actually, I talked about it the other day. I'm doing a whole series on PCOS right now, everybody. So if you go to my Instagram, you'll see that series. And I did talk about the different tests that you would want to ask your doctor for. But yes, for sure, insulin resistance, you won't be able to tell necessarily with just testing at home.
Absolutely. And earlier today, we had a session with Dr. Vishakha Shivdasani. She's a lifestyle medicine expert. Even she spoke a lot about how to measure insulin resistance in India. Very few people actually understand that there is a separate test that you can run as a HOMA IR test as well, which is helpful. And we are offering this as a package in our diagnostic center tie-up. So in our website, there is a test that you can do to test your fasting insulin and get more details about your insulin resistance and so on and so forth. So do check that out. Last question to you, Nicole, is how can we know whether we are ovulating or not in a cycle of 40 to 50 days?
The cycle tracking. Taking your temperature is the most accurate way currently to know whether you're ovulating or not in a cycle of 40 to 50 days. But just so everyone knows, generally speaking, if you have a cycle that's 40 days long and you then get your period at the end of that, you have more than likely ovulated. Typically, these are, ovulatory cycles. So at some point in there, you ovulated, and it might mean that your luteal phase is maybe a little bit shorter, and maybe you ovulated on day 28 or something like that, or day 31 or something, and then you got your period, at somewhere 10 to 14 days later. That's typically what happens. But definitely start taking your temperature, recording those temperatures on an app, paying attention to your cervical fluid. I know it's challenging with PCOS because the cervical fluid changes you tend to see like a lot of the wetter quality fluid and not so much that dry, wet, dry. But, when you're paying attention to it, you'll see your own pattern, but the temperatures really don't lie. And so once you see that temperature rise, as I described, then you will know for sure that you've ovulated.
Thank you, Nicole, for the lovely presentation. Very, very comprehensive. As I said, there are a lot of questions about lifestyle change and questions which are technical for the gynecologist maybe to answer in detail as well. Tomorrow we have a very interesting session with Dr. Neetu Bajikal. She will be joining in from London, and she's also a certified lifestyle-based medicine practitioner, along with being a gynecologist. A combination that we all want to get for our PCOS and not just a medical treatment. So everything that you're asking for, maybe you want to look out for that session. Don't miss it out. And thank you, Nicole, for taking time out in your early morning today with the amazing presentation that you've had, and wish you all the very best in your future goals and endeavors. And I hope we do some more work and bring your work to India as well.
Thank you so, so much. This is an amazing summit that you've put on, and I'm so grateful you invited me. Thank you all so much for your questions as well, and wish we could hang out and answer more, but I know you want to get to your next thing. So thank you again, and we will be in touch soon for sure.
Thank you. Bye-bye.
All right. Bye.
Bye. Thank you so much, Nidhi ma'am and Jordan ma'am, for the session. I think it's time for us to move into the Housie session.
Hi, good evening. Hi, good evening.
Hey, good evening.
Good evening, everybody. I know you're very excited about our Housie night, so I just wanted to quickly state the rules here before we start playing. So we are playing for corners and early five, and then the three lines, top line, middle line, and bottom line. And then we are playing for three houses, first house, second house, and third house. The first house will be for, the prizes will be worth 10,000. The second house, the prizes will be worth 7,000. And the third house, the prize will be worth 5,000. All the lines will be worth of 1,000 rupees, and corner and early 5 will get prizes for 500. So I think everybody must have been added in the group itself, on our WhatsApp group, and we'll just start playing in another couple of minutes. I just wanted to quickly say the rules out loud here. So if you win an early 5, if you win a middle line, you will tell it on a group, on the WhatsApp group. Otherwise, all the coordination will happen here. The WhatsApp group is only to coordinate with the winners. So rule number 1, a player can claim a winning only before the next number is called out. If they do not claim their winning after the number has been called out, they cannot claim their winning. After the player, rule number 2, after a player claims that they have won a particular winning, a moderator will check the tickets. Everybody has their ticket number assigned to them, hashtag, and then that is your ticket number. So you tell us the number, we'll cross check it for you, and then we'll claim your winning. In case there's a tie in particular winning, either prize can be distributed to the first 2 winners who claimed it, or it could go to the first winner. Our moderator will decide that. A player cannot claim for more than 1 winning. If you have won a winning, you cannot claim for another winning, but you can play for the full house. That means if you have won a line, you cannot win another line, but you can win the house. You can text on the WhatsApp group if you have any other more questions regarding the rules. We cannot state the rules again and again. We have also written down what we're playing for. Just waiting a couple of minutes for people if they have any questions. If we win early 5, for example, can we claim? Yes, you can. Yes, Archie, you can claim the house afterwards if you win early 5. Just a couple of more questions for minutes, then we start a game. Let me know if you have any other queries. I hope you like the event today, and do come to the event tomorrow. Also, we have great speakers lined up for you tomorrow as well. Surbi, can you contact our customer care? Okay, great. In a couple of minutes, we will start our Housie game. In another 2 minutes, we start our Housie game. Share my screen. Hi, everybody. If you can see my screen, I'm going to put the WhatsApp group QR code
Please take a moment to join it and scan it and join the group. If you've not been already added. In our earlier emails, what you must have received this morning or late last night also has a link to our WhatsApp group. So I think there are two people, Surbi and Shreya Sikar. Great. Is Shreya who's not joined? Has she joined? Shreya, were you able to join the group through the QR code? Everybody who's playing, very much encourage you to join the WhatsApp group. The reason being, we need a quick response, and WhatsApp is much quicker, and we would know who is winning the first, because it's first come first grab of the prizes. So please do join the WhatsApp group. I'll give another 1 minute. Whoever is on board, I am sharing this on my screen. Please scan the QR code and join the WhatsApp group. Whoever wants to announce their winning, you have to quote the ticket number and what prize you won. So win, hashtag your ticket number is what you have to respond. So with that, I am going to get on to the ticket generation. No, sorry, Tambola generation. So here we go. Give me a moment. See. So who's excited? Give me a thumbs up on the WhatsApp group. Yeah. Okay, great. So, okay. I hope you can see my screens. Right. Okay, great. So the first number is 81. 81, 81. I will have to play a bit slowly because there is a bit of a lag on what you see on the screen. So this is the reason I'm going to play it a bit slow. Next number is 52. 52, 52 is the next number. Remember the prizes. It's corners, early 5, and all the lines until we move on to the house. Next number is 3939. 3939. Next number is 5959. So we've got 4 numbers so far: 81, 81, 52, 52, 39, 39, 59, 59. So let's see who's getting the early 5 and the corners. Here we go. 5, the single digit 5. Next number is 5151. 5151. Next number is 1818. Next number is 4949. Any early 5 and corners? Looking for early 5 and corners. Got 81, 51, 52, 5, 18, 39, 49, 59. Next is 17. 1717. So there is a question on the WhatsApp that can you repeat the numbers? So if you look at the streaming of this event, you can see the numbers right there in front of you. Next number is 7575. No early 5 in corners yet. Okay, great. 7575. Next number is 4747. So we have a win by ticket 77. So we're just checking. Ticket number 77, can you confirm the number on which you played the game? Okay, fastest 5. Do you mind sharing your ticket, a screenshot of it for quick reference? Five, 17, 51, 9, 75. We're just looking at your ticket as well. 5, 17. Great, awesome. So ticket number 77 wins the early 5. So we still have the corners and all the lines until we move on to the house. So 4747. After that, we move on to 6060. Next number is Two Little Ducks, 2222. Okay, so we have another win. Ticket number 89, Sharanya. Could you share what? So fastest 5 is already gone. So it won't be applicable. So fastest 5 or corners, fastest 5 or early 5, we've already are exhausted. It's gone. So we have available prizes now, corners and the lines on the house. Six one 61. 7676. The earlier one was 6161. One 1515. Two 424. So I'll repeat the numbers that have been completed so far. It's 5, 15, 17, 18, 22, 24, 39, 47, 49, 51, 52, 59, 60, 61, 75, 76, 81. Next one is 3, 5, 35. One 11. One 11, 2020. Two 727. Two 121. So everybody, corners are up for grabs on your ticket. And the lines, top, middle, bottom, houses 1, 2, and 3. 3 houses, 3 lines, and corners are still up for grabs. 9090. Eight 989. Eight 383. Two 525. I can't believe there are no corners done so far. Four 343. Why is everybody so silent? 6666. Okay, there's a lot of build-up and we have no calling. Looks like everybody will be barging in and fighting on the prizes. Okay, 5656. 5656. 6262. 2626. Come on, guys. So corners are for grabs, the lines are for grabs. Next number is 3636. 45. I like the jokes that are going on the group. So much fun. Please win something. Okay, next number is single number 4. Single number 4. Next number is 8080. And I have no idea why it says Gandhi's breakfast. That's so weird. Next number is 1616. Come on, you people. Corners. I hope everybody understands corners, right? So it doesn't have to be just the corner. It could be the second box as well if it's that's your last number. I'm just saying just in case. Somebody said fastest 5 done now. Okay, next is 8686. I can't do anything with the numbers. It's automatic. You see on the screen. So unbiased I am. Okay, next number is 1212. Okay, so it'll be for you, Jai Mata Di. Just for you. Okay. Next number is 5454. Okay, corners. Okay, corners happened. Ticket number, please. Ticket number is 106. Okay, so it's 16, 86, 4, and 67. Oh, sorry, 89. Cool. So ticket number 106 wins and the corners are out. Can you confirm? Sorry. Okay, so there is 173 ticket number which finished the middle line. That is 15, 35, 54, 62. Okay, sorry. I have to see who won the first one. So Priyanka said the middle line called first. So sorry about that. Ticket number 33 is just validating for middle line. Priyanka, can you send us your ticket, please? Okay, I have it. Just checking for middle line. Priyanka gets the first one because she messaged first. Sorry about the confusion. Ticket number 173, Aishwarya. Hard luck. Priyanka got it first. So Mohana wins the corners. Priyanka wins the middle line, and Aishwarya, I hope you win something else next. Sorry about the confusion. So middle line, corners, early 5 are gone. We still have the top line and bottom line and the houses. Okay, so next number is single number 3. Next number is 4040. Come on, top and bottom lines. Okay. Abdul Bashish win 108. What is the winning? So win number 108. Can you mention what's the winning? $108. What is 108? Win number 108. Could you please confirm your winning, please? What line are you referring to? Top line. But Chinky is 93, right? Okay, that's confusion here. Chinky. So there are 3 winnings on the top line, and we're going to go with the first 2 ones who called out.
Is already done, right?
Yes.
So 2 for top.
2 for top. Okay. This is Chinky and Nutan. Okay. So Nutan and Chinky, you have to share the prizes, and the top line has gone to Chinky and Nutan. Can you confirm it, please? Just give us a moment as we're validating the numbers. Or okay. Okay, so Chinky and Nutan both get top line, but with prizes sharing. Let's see what you get. But congratulations to both of you. So corners, early 5, top line, middle line gone. So we have the bottom line and the houses. So exciting. Let's see who wins the first house and second house and third house. So here we go. Single digit 9. Next is 5757. Bottom line and 3 houses, guys. Let's go. Next is unlucky for some, lucky for me, 1313. I don't know what that tagline means anymore. Next is 5353. Five, 53. Next up is 4242. Let's go, let's go, let's go. Single digit 2. The tension is building up. Next up is 6464. Next up is 1919. 1919. 2323. Next up is 6868. I like your jokes. Next up is 7474. Next up is single digit 6. Okay, there is a win. Win number 89 by Sharanya. Sharanya, can you share what is your win? I'm sure it's bottom line, right? Checking on win number 89. Okay, so can you give me the numbers? 15. Bottom line, no? Okay, sorry, 4, 18, 49, 52, 74. Okay, great. So, Sharanya, you win the bottom line. Congratulations. So, we dive into the house. So, prizes worth minimum 5,000. So, 10,000 for the first house. Second house prizes worth 7,000. And third house wins prizes worth 5,000. Let's go. Okay, then. Next number is 3333. 3333. 33. Next number is 6969. And next, single digit 8. And what a body shaming Tambola number generator this is. Seven two 72. Okay.
Oh my God.
Okay, somebody win. Last line.
Last
Last line is gone. Sorry, Priya. The bottom line is already taken by Sharanya. You can contact her if you need any of the prizes and if she is willing to share with you. But sorry, it is already gone. But we are all playing for the full house, so let's see. Okay, next one is 3434. Farzana, I hear you. Three, 4, 34. Next up is single digit 7. Single digit 7, guys. I love the energy. Let's see who wins the house. Chingy, you already won, but I hope you win another one. I hope for everybody. Next one is 2929. Let's go, let's go, let's go. Next up is 5555. Next up is 6363. Let's go, let's go. 6363. Next up is
89.
Okay. Win number 89. Okay, Sharanya. Can you share her number or ticket number, please? Okay, this full house. So Sharanya, this is first house, and then Mohana win number 106 with the second house. We're just checking your ticket, please. So in this case, in the first house, there are two claims by Mohana and Sharanya. If both of them are okay to sharing the price, it's okay, but the first call was made by Sharanya. So just want to be fair to both the participants. I would call it to be a sharing price between 106 and 89. Okay, great. So we go with, I'm waiting since there's a lag. So Sharanya and Mohana, Sharanya and Mohana, we share. You share the first house. Congratulations. Now the second house and the third house are up for wins. Let's go. 5050. Next up is 1010. Seven nine 79. Only number one. So second house and third house is up for grabs. Let's go. Next up is 7171. Next up is 8888. Next up is 4848. Win 172. Okay, there's a win 172 full house. And just checking on it. 9, 15, 34, 52, 71, 16, 36, 54, 75, 80, 18, 20, 20, 61. Great. So the second house is gone. So ticket the price worth 7,000 goes to ticket number 172. Ticket number 172. Can you name your first name and last name, please? Who won the second house, please? Ticket number 172. Can you please share your name, please? Sahana. Okay, great. Okay, great. So last house, the final prize for today is next number 38, 3838. Calling for the third house. Next up is 2828. Next up is 7070. Last and final house, prize is worth 5,000 rupees. Up for grabs. Let's go. Next number is 4646. 143. Okay, Newton has claimed the third house of 143. Can you quickly share your ticket again, please, for a quick reference? Encourage when people are leaving. Thank you so much, everybody, for joining us for such an interactive game. We really enjoyed. I'm sure not many people won, but the whole experience was so interesting, and we had a lot of fun with you. And I hope we are able to do this more often. I'm just checking Newton's ticket. It's 411 40 66 80 16. Okay. 45. Okay. 43 52 70. Okay, great. So Newton gets the full house, and the third. Good. Okay, great. Thank you so much, everybody. Thanks for joining in today for our very interesting full day of events. And I want to thank you, our team members, without whom this would not have been possible, especially Devyani, who's been the backbone of this event, Olipriya, who's joining us from heavy rains happening in Kolkata, still surviving through her internet, but great going with moderating today's session. Our creative team, Archie and Nitya, for making it possible with all the creativity, what you see on our platform today. So thank you so much. Tomorrow's session is even more interesting, where we're talking about hirsutism, we're talking about hair care with one of the leading dermatologists in our country right now, the hair growth queen of India. Then we have gut health expert, we have inositol sessions, we have Dr. Neetu joining from UK, talking about plant-based foods, and of course a dedicated session on fertility with Dr. Anjali Kumar and Anupama Menon, and so much more on sleep and various other interactive sessions. So I hope you stay with us tomorrow like you did today. Thanks for supporting always. Without your involvement and without your interaction, this community would have been very boring. So thank you for all the interactions and communications and sharing your experiences. With this, I take your leave. And if you have any questions, you know where to reach out to. And we see you tomorrow at 10:45 a.m. where we start with our first session. Till then, have a great evening, and thank you again, and have a lovely evening. Bye-bye.
It was really great to join.